provide countries with a roadmap to operationalize One Health at national and regional levels. Program Director, this conference offers a forum to showcase and exchange information on One Health efforts and innovations in Eastern and Southern Africa. From rabies elimination projects to climate-smart agriculture, from regional trade organization, harmonization to youth-led workforce development, we will share and engage on how Africa is demonstrating integrated approaches to deliver health solutions and impacts. The Quadripartite recognizes and applauds the efforts of the SADC in developing the SADC Secretariat in developing the regional roadmap for One Health, whose launch will be made during this conference. The SADC roadmap for One Health is indeed a milestone, marking the start of collective action to strengthen preparedness, surveillance, and resilience across the borders in Southern Africa. The Quadripartite stands ready to support this implementation. In closing, Director of Ceremonies, on behalf of the Quadripartite organization, we reconfirm our commitment and offer our hand of collaboration to all stakeholders, including governments, regional institutions, civil society, and the private sector and development partners. Let us embrace the One Health approach to secure one future where healthy ecosystems support healthy animals and healthy people and drive thriving economies for our region and the African continent. I thank you.
Thank you kindly, Dr. Letshwenyo. Re a leboha, as they would say in your home language. Our next speaker is a key leader as well in ensuring that active participation as a key advocate for One Health. He not only prioritizes technical support for his home country in Senegal, but also is a recognized expert in One Health, animal health in primary, and first elected president of PREZODE. Please warmly welcome to the front of the stage, Dr. Papa Sek, President for the General Assembly of the Preventing Zoonotic Disease Emergence Initiative, PREZODE. Welcome.
Thank you, Madam Masters of Ceremony. Honorable Minister Mishima, Minister of Health of the Republic of Zambia, Honorable Ministers, distinguished guests, distinguished delegate from SADC member state, esteemed colleagues, ladies and gentlemen, all protocol observed. It is an honor to speak on behalf of PREZODE at the opening of this important Regional One Health Conference. Let me first commend the Government of Zambia, the SADC Secretariat, the World Bank Group, and our quadripartite partners, WHO, WOHA, FAO, and UNEP, for convening with the PREZODE this timely and strategic gathering. Your leadership comes at a moment when regional cooperation is more essential than ever. Across Eastern and Southern Africa, the combined pressure of climate change, environmental degradation, rapid land use, transformation, and persistent health vulnerability are heightening the risk of epidemic emergence. PREZODE was created in response to these realities, grounded in a clear conviction. Epidemic prevention is a strategic choice, one that required long-term commitment, multi-sectoral collaboration and coordination, and sustained investment in silence and in communities. The program before us reflects this vision. It brings together political leaders, technical institutions, researchers, private actors, youth, and community innovators to design resilient and integrated One Health systems. This inclusive and multi-sectoral governance is at core of PREZODE global mission. In this region, PREZODE work is strengthened by robust partnership. The COHESA project has played a central role in supporting institutional coordination and reinforcing national One Health platform across several countries. We are also pleased to announce the launch of the AZICA project, which will begin implementing in Eastern and Southern Africa. AZICA will enhance regional and national capacities through evidence generation, stronger surveillance and community engagement, and reinforce dialogue between policymakers and scientists. Together, PREZODE, COHESA, and AZICA form a coherent and ambitious regional effort fully aligned with SADC vision and priorities. This conference rightly emphasized the operationalization of One Health, ensuring that commitments translate into concrete tools, policies, and investment. Session on research to action and evidence-based implementation embody the silence policy interface that PREZODE consider fundamental for effective prevention. We also welcome the innovation marketplace, including participatory approaches such as the Alert series game. These initiatives highlight that prevention begins not only in laboratories or ministries, but also in communities, market, school, farms, and the landscape where human, animal, and ecosystem meet. Honorable Ministers, PREZODE together with COHESA and AZICA reaffirm its commitment to supporting SADC and its member states as you implement the forthcoming Regional One Health roadmap. We stand ready to accompany government in strengthening governance frameworks, building national and regional capacities, and mobilizing the partnership and financing required for long-term impact. The discussion of the coming days offer a unique opportunity to demonstrate African leadership and to shape the future of prevention. We look forward to continue collaborating and to the concrete decision that will emerge from this gathering. I thank you for your attention, and I wish you productive and inspiring discussion. Thank you so much.
Merci beaucoup, Dr. Sek, for your opening remarks. We continue with the momentum, hearing from key partners and, of course, ongoing champions of prioritizing One Health. Our next speaker has a clear priority to ensure that preventative disease control is something that is not only earmarked, prioritized, but also achieves positive outcomes across the 55 states on the African continent. Please warmly welcome to the front of the stage, representing the Africa Center for Disease Control, Africa CDC, Dr. Yewande Alimi.
Good morning. Distinguished honorable ministers, I bring you warm greetings from Addis Ababa. Standing on existing protocol, it is a privilege and an honor for us to join you as Africa Centers for Disease Control to share a topic that we are quite passionate about, and we have continued to demonstrate continental leadership. Honorable ministers, your excellencies, leadership from the member states from Eastern and Southern Africa, distinguished One Health champions in the room. Thank you very much. I think the mic is, thank you. This is a moment for us to reflect, not just as Africa, but as a globe. Pandemics, AMR, climate change, and food insecurities continues to challenge and test the resilience of Africa. The threat we face, from the Congo forest to the islands of Seychelles, from the Cape Mountains to the Atlas Mountains in North Africa, from the deserts of Mauritania all the way to the coast of the Indian Ocean in Somaliland. Ladies and gentlemen, zoonotic disease continue to take thousands of lives across the continent. Antimicrobial resistance threatens us beyond HIV, TB, and malaria put together. Food, which is the basic sustenance for everyone, becomes a crucial challenge in very vulnerable populations. We continue to see the increase of rainfalls or the lack of rainfalls as a result of climate variability driven by climate change. Ladies and gentlemen, One Health is no longer a technical suggestion, but One Health is the way we need to operate going forward. Africa's CDC's One Health leadership has been demonstrated through our collaborations, leading conversations around zoonotic diseases, as we continue to lead the Africa Union Coordination Group on One Health for zoonotic diseases. Similarly, we have identified AMR as a significant threat for the African population, and we have taken this message all the way to the heads of state and government of the Africa Union, ensuring that we get a political declaration, AU Assembly Declaration 33, the common position on antimicrobial resistance. Continental coordination and leadership is important. At Africa CDC, we continue to co-chair and lead conversations on One Health together with our sister agency, AU-IBA. Similarly, we have demonstrated leadership around the Africa Union Regional Quadripartite conversations, leading on AMR, climate change, as well as zoonotic diseases. As Africa, we cannot stand alone, and this is where partnerships and collaboration continue to anchor our work as One Health. It is important that Africa CDC demonstrates a context-specific oriented partnership that ensures that the member states and the regional needs are highlighted. As we continue to champion this conversation, it is important that as African countries, we start to say, do we really put our money where our mouth is? And this is what we continue to champion, domestic financing. For us to have health sovereignty, our governments need to make the right investments. Your Excellencies, it's a privilege to stand before you, but we also thank you for your commitment and your high-level leadership in championing this cause. Regionalism is the way to go. We continue to say we cannot leave one person or one sector behind, but we must ensure that we leave no country behind. And this is how we can grow as a continent. Ladies and gentlemen, as this important conference brings us together, we must also reflect on innovative approaches, be it new innovations or homegrown solutions which address the needs of our communities. We must ensure that women and children, as well as youth, must be at the forefront of One Health actions and One Health leadership. Last week in Tanzania, the youth reminded us it's not the future generation, it's the now generation. And this is where innovation really lies. Your Excellencies, as Africa CDC, we remain your long-standing partner, committed to championing and leading a One Health approach. And it is indeed with pleasure we endorse and we look forward to collaborating with you as the SADC countries to implement this important strategy. Ladies and gentlemen, One Health is no longer a technical approach. It's a moral, economic imperative for us to safeguard Africa and for us to achieve the Agenda 2063, the Africa we want. Thank you so much for having me.
Thank you kindly, Dr. Alimi. In your opening remarks, you referred to the use of innovation and, of course, technology. And we will be able to explore some of these innovations throughout the course of the next 2 days by speaking to entrepreneurs, innovators, and key enablers of solutions that we need on the continent. Someone else who has prioritized this specifically through the use of technology as an expert and fully understanding the importance of data-driven initiatives when it comes to prioritization of animal health and safety and the consequences of any failures within those systems. Please warmly welcome to the front of the stage our next speaker, representing the Inter-African Bureau for African Animal Resources, the AU-IBAR. That's Dr. Mary Mboli Karioku.
Thank you so much, Honorable Ministers, standing on all protocols observed. Ladies and gentlemen, good morning. Bonjour à tous, salam alaikum, bon dia, habari za asubuhi. Firstly, allow me to convey on behalf of my director greetings and appreciation from the Commission of the Agriculture, Rural Economy, Blue Economy and Sustainable Environment of the African Union, His Excellency Moses Vilikati, who firmly supports and shares this common vision of promoting the One Health approach in Africa through strong multi-stakeholder collaboration and cooperation that will enhance prevention, preparedness, and response systems, ultimately contributing to food and nutritional security. Distinguished guests, ladies and gentlemen, as you're all well aware, Africa continues to bear a heavy burden of emerging and re-emerging diseases. Majority of these emerging diseases reported have an African origin, with 75% of them classified as zoonoses. Over the last decade, 63% increase of diseases has spread from animals to people in Africa. This has been observed. And with the projected human population growth estimated at 2.5 billion in Africa by 2050, this will ultimately place immense pressure on production systems and, of course, trigger increased antimicrobial resistance and other emerging concerns. Therefore, there is need, and it is imperative for AU member states to embrace comprehensive, multisectorial, multidisciplinary interventions to optimize the health of animals, humans, and the environment, hinged on evidence-based decisions. The narrative of One Health needs to be fully realized. Ladies and gentlemen, in the first few years, AU-IBA has positioned herself as a key One Health mover and shaker, and more recently, within the digital One Health space. A key highlight, if you may allow me to, includes the endorsement of the African Union's heads of state of the African Union One Health Information Policy and associated One Health Information Architecture Framework. This policy instrument has set the stage for transformed One Health data management and governance. This is critical to any decision that honorable ministers you may want to take. Without data, without evidence, nothing will be realized. The African Union has also supported the framework of the establishment and the operationalization of the first ever African Union Digital One Health platform, which is founded on the innovative data mesh principle. It is envisioned that this innovation will promote data sharing and integration. In the spirit of strengthening multisectorial collaborations, AU-IBA and WAR have operationalized a groundbreaking initiative, the African Public-Private Partnership Forum in the veterinary domain. This aims to foster multisectorial dialogues and sharing of innovative solutions and promotion of sustainable best practices and lessons learned. As an institution, we hold with great esteem the scientific contributions, discoveries, and innovations made by academia, and we remain committed to serve as a bridge to transfer and disseminate novel technologies, innovations, and knowledge. This will ultimately build knowledge-based economies in Africa that the Agenda 2063 really envisions. Your Excellencies, as I conclude, allow me to highlight AU-IBA's next steps envisioned to bring transformative change to the One Health sector. AU-IBA, under the third pandemic call, has been selected among the 20 applications and has secured a total of 40 million USD to strengthen pandemic prevention, preparedness, and response across the Lake Chad Basin. We are still in discussions to move the next actions forward, and this will be done across the Lake Chad Basin. This support aims to bring the much-needed transformative change across the selected region through adoption of an integrated and inclusive One Health approach. This will serve as a lighthouse to the rest of the African continent and more so to the SADC region. We look forward to continued collaboration and cooperation with all stakeholders to ensure success of these actions. In finality, One Health truly resonates with the spirit of Ubuntu. I think this is something that is really home to the SADC region. And Ubuntu spirit says, I am what I am because of who we all are. Without each other, we cannot exist, we cannot transform, we cannot move. I urge all stakeholders in this room today to heed the clarion call and promote unification, especially in the One Health space, for the prosperity and posterity of the African people. I wish you a successful conference, and thank you for your kind attention.
Dr. Mbola Kariuki, thank you so much for your feedback and, of course, opening statements. And perhaps to build up on the theme that you suggested regarding SADC and, of course, the spirit of Ubuntu, it's imperative that we hear from a representative of SADC as a region. And this time, to build up on many of the themes and ideals that have been shared by various speakers, our next guest and speaker is someone who has a wealth of experience not only in the planning, strategizing, prioritizing, evaluation, and measuring of key interventions when it comes to healthcare controls in the region and in respective countries. Please warmly welcome to the front of the stage, SADC Secretariat, Dr. Lombli Kumbuneki.
Let me try. Okay. Thank you. Good morning. Good morning, bonjour, and I'll say Mulishani since we're in Zambia. Thank you. Thank you so much, honorable ministers, distinguished guests, and ladies and gentlemen. Let me transmit first my greetings from the SADC Secretariat and the Executive Secretary, who is Mr. Elias Mahosi, who couldn't be here due to some competing priorities as well. However, as SADC, we remain committed to the agenda of One Health, as you've seen. And we would like also to thank our member states to responding to this invitation and always showing that great commitment. The SADC region, we can pride ourselves as one of the most beautiful, the best region in Africa, in the world. This is a region where you have breathtaking landscape. It has been mentioned here that we have the Table Mountain. We have, in the land of the brave, you have that where the ocean, one of the few places where the ocean meets the deserts. And when we move, we have the mighty Zambezi, which shows the intersection with 4 countries and the Vic Force. And this is one of the places where you cannot pass without seeing the great interaction between human health and environment. This also shows that why One Health is very important and should be very taken seriously in this region. In the past years and in recent history, we have seen this region also facing different zoonotic, different outbreaks. Those outbreaks, we can speak of the recent Mpox, which has affected a number of SADC countries, including the DRC. We also speak about the Ebola, which has just come to an end in the DRC. It shows that a pathogen can cross so quickly from one species to another. Hence, we cannot separate animal, environment, and human health. Us standing here today shows also the commitment of the leadership of the region. The SADC region has always shown the stewardship when it comes to addressing health issues and economic issues across this continent. And recently, our senior officials, the technical leads in our ministries have gathered to discuss on the roadmap, the One Health roadmap. The One Health roadmap is a key document that will be taking forward, taking experience and also listening to all the recommendations that we'll be having during this meeting. Why it's important to have the roadmap? It's important because we need to coordinate our response to the challenges that we are facing as far as One Health is concerned. I do not have to remind you on the cyclones or the different events that we have on a yearly basis in this region. We have faced the droughts, which are also affecting our common well-being, which are affecting our common health in this region. Hence, this roadmap is going to help us to integrate and to coordinate our response. The second point, which is very important in the roadmap, has been the issue of mobilizations of resources. How do we mobilize resources? How do we ensure that the leadership is aware and it's the issue of One Health is kept high in the political agenda? This roadmap will also help us to track how we've been spending and how we are going to mobilize additional resources to address the issue of One Health. The roadmap will also ensure that we continue having the political will. The political will which we have demonstrated in the past, which we continue to demonstrate as a region. Before I conclude, honorable ministers, I would like to make an appeal to you as the leader of this region. We'd like to make sure that in the next meeting of Ministers of Health, the next meeting of Ministers of Agriculture, and also, more importantly, also the summit, we have the One Health agenda brought at the highest in this region to be discussed, so as we have that commitment of our leadership to address the issue of One Health. Honorable ministers, I would like to thank you for welcoming us to this beautiful city of Zambia. It has been, I believe it's the best place where we had to discuss this agenda, being in Zambia, where we say, one Zambia, one nation, one health, one future. Thank you so much.
Thank you kindly, Dr. Kombuneki. Appreciate your insight and, of course, opening remarks that you've shared with us. All of our opening speakers have given us key objectives to make sure that we lean into them, prioritize them on the agenda of our ongoing engagements that we'll have over the next 2 days. What is imperative, though, is for us to understand that being here in the city of Lusaka is no mistake. As has been highlighted, there are several interventions, priorities, partnerships that have been prioritized by the Zambian economy, more specifically under the Department of Health, to make sure that there's an adequate response, prioritization, and even the mobilization of key partnerships and capital to ensure that One Health is not only a success here in Lusaka, Zambia, but across the region too. We're going to hear in just a moment from key representatives and, of course, leadership from the Department of Health. But before we do that, we'd like to welcome back to the stage to assist us in providing the tone, the context that will set the theme and the conversation that the Minister of Health will address. If we could please welcome back to the front of the stage Professor Roma Chilengi, Director General for the Zambian National Public Health Institute, who will then assist us in welcoming the Minister of Health in the Republic of Zambia. A warm welcome, please, back to the stage, Dr. Chilemba.
Thank you, Master of Ceremonies. My task at this point is really simple and straightforward. I'm here to invite the Honorable Minister to come and give his keynote address. But before I do, Honorable Ministers gathered here, our official guest, Honorable Mchima. We are proud to be hosting the One Health Regional Conference. As you've gathered from the moderate and the earlier speakers, this is an important conference to the region. And we are pleased and proud to be gathering a high-level delegation with ministers of health from several of our countries in the region. We have high officials from really ministries of health, from ministries of agriculture, from livestock, and senior leadership within the government, within the SADC region. We have our partners from WHO and World Bank and others in EXA and many more who are in the house this morning. This all, Honorable Minister, only to emphasize the importance of the conversations we are having this morning. It is therefore my singular honor and pleasure to welcome you, Honorable Dr. Elijah Mchima, Member of Parliament and Minister of Health, here in Zambia to come and officially give your remarks. Honorable Minister, sir.
Thank you very much, Professor Chilengi. I welcome distinguished guests, Your Excellencies, to Zambia. We are very proud to be with you. I take note, One Health country coordinators, representatives, Zambia, Zimbabwe, South Africa, Namibia, African Union, Madagascar, and Mozambique. Just 1 minute, Chichi. Look, open the different one. World requires young ones. Good. Honorable ministers from SADC countries, honorable ministers from the Republic of Zambia, Honorable Mposha, Member of Parliament for Munali, heads of delegations, Your Excellencies, permanent secretaries, SADC representatives, the Africa CDC representative, representatives of the Quadripartite organizations, that's FAO, WHO, WHOAH, and UNEP, representatives of the World Bank, is in fact himself there, distinguished development partners, members of the diplomatic corps, senior government officials, academia, public sector leaders, civil society, distinguished ladies and gentlemen. It's a great find today to meet our dream. President Hakainde Hichilema greets you all. When we went with him to Egypt, he found this One Health program. He quickly ordered me and my colleagues that we should implement this in Zambia. That is livestock, green economy, agriculture, and ourselves. And since then, we have been wanting to meet. But let me say this. Technocrats at times are a problem. They start fighting themselves. If we come together, who will be the leader? They are now talking about themselves, not what we are to achieve. It has been a hassle to bring them together. And yet, we have one leader, the President of the Republic, sponsored by the people of Zambia. And he's the one who directs that we should be one. And that is to protect us. One day I was joking with my tribal cousins, the Kawandes who like eating meat a lot. Those are people you should not bring near game parks. They will finish all the animals. I say, look, at the National Assembly, I've got a caucus called Kappa. We champion One Health. That's environment, animal, and human being. They say, since animals are nuisance, they bring diseases. can we isolate animals in Zambia completely? I saw this Kaonde man looked at me. He couldn't believe what I was saying, because a Kaonde lives with meat. And then when we are talking about this One Health, meat and animal, to him is a lovely delicacy all the time. So he was so surprised that this motion wants to bring us together and to see how we can live together. And today, we are speaking as SADC. We've been talking about malaria, eradication of malaria. No matter how you try it alone, you will not control the movement of a mosquito. We need to synergize, we need to come together. We talked about it at E8, E12, and then we want to involve the whole entire SADC. Here where we are correctly with a good motion, extremely good motion. You talked about political will. Our president, Hakainde Hichilema, stands tall. I'm sure he's very excited to hear that we have now convened here to talk about One Health. It is serious, but when we go back to our offices, let's look at our technocrats. To them, they want to be the director general, who will be the managing director of this institution. No, we are looking at what do we achieve about this One Health. One Health is important to all of us as an African country. I'm extremely happy that today I stand here on behalf of the Zambian government, on behalf of my own president, to talk about One Health. It is my distinct honor and privilege, actually, on behalf of the government of the Republic of Zambia and jointly representing the ministries responsible for health, green economy and environment, and fisheries and livestock, to warmly welcome you to Lusaka for the Regional One Health Conference for Eastern and Southern Africa, convened under the theme, Driving Coordinated Regional Action for One Health. Zambia is deeply honored to host this important gathering at a time when our region, our continent, and the global community are facing increasingly complex, interconnected, and transboundary health threats. Your presence here is a powerful affirmation that health security, food system resilience, environmental sustainability, and economic development are inseparable objectives, and none can be achieved in isolation. Distinguished delegates, across Eastern and Southern Africa, the risk landscape is changing rapidly. Climate change is intensifying floods, droughts, and heat extremes. Population growth, urbanization, and land use change are increasing interreactions between humans, livestock, wildlife, and ecosystems. Trade, travel, and migration continue to expand across porous borders. These dynamics are reshaping disease epidemiology. We are witnessing more frequent zoonotic disease outbreaks, rising antimicrobial resistance, persistent food safety threats, and the growing burden of climate sensitivity, disease such as cholera and vector-borne illnesses. These challenges do not respect national borders, ministerial mandates, or institutional scenarios when we respond in fragmented ways. We detect outbreaks late, spend more, and achieve less. When we act collectively across sectors and across countries, we prevent crises before they accelerate. This is the fundamental rationale of the One Health approach. Ladies and gentlemen, One Health today is no longer a theoretical framework. It is a strategic imperative to recognize that the health of people is inseparable from the health of animals and ecosystem. Food safety and nutrition depends on environmental integrity and sustainable production systems. Eco's resilience depends on preventing health threats at their source rather than responding after the fact. Importantly, One Health is not about creating new institutions. It is about connecting existing ones, aligning policies, sharing intelligence, strengthening coordination, and deploying resources more efficiently. It emphasizes prevention over reaction, integration over fragmentation, and resilience over vulnerability. Distinguished colleagues, allow me to briefly share Zambia's One Health journey. Recognizing the interconnected nature of the health risks, Zambia launched its first national One Health strategy plan in 2023, making a shift from manual collaboration to institutionalized multi-sectoral coordination. Even at Parliament, we have got a caucus that is driving the One Health. Members of Parliament are deeply involved. The previous ones, current, are deeply involved. And this is accelerated at the level of the Vice President. All the time we converge each year in Kabompo to talk about the One Health issue. At the core of this effort is the Zambia National Public Health Institute, Zambia National Public Health Institute, which is managed by Professor Chilenge, the man who invited me here, which serves as the National One Health coordinating body, doing great job in Zambia, bringing together the ministries responsible for health, agriculture, fisheries and livestock, green economy and environment, and other critical sectors. Today, Zambia has established a National One Health Steering Committee at permanent secretary's level, a functional multi-sectoral national technical working group on One Health coordinating mechanism in all 10 provinces and all 116 districts. Joint systems of zoonotic diseases surveillance, antimicrobial resistance monitoring, climate health surveillance, food safety, and environmental risk management. Through these platforms, Zambia has strengthened joint risk assessments, accelerated outbreak detection and response, and improved community engagement. Practical results have been demonstrated in areas such as rabies control, anthrax response, aflatoxin mitigation, and climate sensitivity disease surveillance. Our experience confirms a critical lesson. One Health delivers results when embedded in government structures, budget, and operational systems, not when it exists only on paper. This reminds us here that we should not just be talking and meeting just for the sake of it. We should call to action itself. Honorable Ministers, health security in our region is only as strong as its weakest link. No country, regardless of capacity, can secure itself in isolation. The Southern Africa Development Community has long recognized that regional solidarity, policy harmonization, and cross-border collaborations are essential for protecting health, trade, and mobility. This conference is firmly anchored on that vision. Over the coming days, this forum provides a platform to, one, share practical and operational One Health experiences, align national One Health platforms with regional priorities, 3, strengthen cross-border surveillance, early warning information, sharing, and coordinated responses. In our era of constrained resources and competing priorities, regional cooperation is not optional. It is a cost-effective, efficient, and essential. As countries, we should not be hiding the truth. Just one outbreak of cholera, it affects many. Other countries have been putting that information under the carpet, and as such, we have prolonged the disease in these countries. In Zambia, moment we hear one, we announce to the public. It helps us safeguard the lives of many. Distinguished guests, this conference is also strongly aligned with continental and global frameworks. At the continental level, One Health is central to 1, the African Union One Health Framework, 2, the African CDC New Public Health Order, 3, Africa broader agenda on pandemic preparedness, climate resistance, and food system transformation. Globally, the Quadripartite collaboration comprising the Food and Agriculture Organization of the United Nations, the World Health Organization, the World Organization for Animal Health, and the United Nations Environment Program provides critical normative guidance and operational support to translate One Health from principle into practice. The World Bank's leadership in financing prevention and preparedness is equally vital in helping countries move from planning to sustainable implementation. Zambia values these partnerships deeply and remains committed to aligning national actions with regional roadmaps and global commitments while maintaining strong country ownership. Ladies and gentlemen, One Health is not the responsibility of governments alone. Farmers, veterinaries, and animal health workers from the first line of defense against zoonotic disease emergencies, wildlife and environmental officers protect ecosystems that buffer disease spillovers. Health workers detect and respond to our outbreaks. Researchers generate evidence to guide policy. The private sector shapes food systems, pharmaceuticals, supply chain, and innovation. Equally important, are communities themselves, whose knowledge, practices, and trust are essential for prevention and response. This conference deliberately brings together governments, academia, civil society, the private sector, and the youth innovators, recognizing that durable One Health solution must be inclusive, practical, and locally grounded. With Africa's youthful population, One Health should also serve as a platform for skill development, entrepreneurship, and green jobs, transforming health security into a driver of sustainable development. Distinguished delegates, over the next 2 days, let us move beyond dialogue to decisive, measurable action. Let us focus on strengthening multi-sectoral governance and accountability mechanism, enhancing integrated surveillance and data interoperability, investing in climate-informed early warning and preparedness systems, advancing domestic and innovative financing for prevention, and shaping a regional One Health declaration that reflects both ambition and implementation. Zambia stands ready to contribute actively to these discussions and carry forward the outcomes of this conference beyond Lusaka. Ladies and gentlemen, history will not judge us by the number of meetings we convene, but by the systems we build, the crises we prevent, and the lives we protect. One Health is not a slogan. It is a new way of governing health, a new way of investing in resilience, and a new social contract between people, animal, and environment. On behalf of the Government of the Republic of Zambia, I reaffirm our unwavering commitment to advancing One Health nationally, regionally, and globally. But let me contradict myself. It's not a slogan. But there was a wonderful slogan that came here. So even in church, we begin with hymns. So it's a slogan to remind us of our responsibility. It is therefore my honor and privilege to officially declare the Regional One Health Conference for Eastern and Southern Africa today open. I thank you.
Zikomo, Honorable Minister Natotela, thank you kindly for your opening remarks and, of course, feedback. We appreciate your time and perspective that you've shared with us today. This does underscore much of the welcoming remarks that we've had from all of our speakers who've joined us so far today. I do want to emphasize the fact that in a moment we will have an opportunity to hear from various ministers representing various countries regarding the SADC region, who will just amplify much of the messaging that has already been said by Minister Mochima. As we build up, though, one thing that we have promised you is a level of excitement. Understanding this level of commitment that we've made through One Health, what it entails, and how we all need to amplify our partnership. As we prepare for more of the commitments, camaraderie, partnership, and championing of One Health, please turn your attention to the screens as we engage in this One Health video. Please pay attention to the screens.
Across Eastern and Southern Africa, our economies, our ecosystems, and our health systems are deeply connected. Evidence shows that all pandemics in the last 3 decades originated in, or were transmitted through, or amplified in food systems. Agriculture drivers contributed to 25% of all emerging infectious diseases and 50% of all zoonotic diseases that emerged in humans in the last 40 years. Increased interaction between humans, animals, and the environment is the One Health risk. Frequent climate shocks, deforestation, and land use change, rapid urbanization, changing food preferences, and the intensification of agriculture are all major risk drivers. Many of the region's most pressing health issues lie at the intersection of animal, human, and environmental health, including emerging and infectious diseases, antimicrobial resistance, and food safety. One Health is a collaborative, transdisciplinary approach that brings multiple sectors together to respond to shared health challenges. It calls upon us to look beyond individual sectors and work together for collective benefit. It is a whole of community approach, acknowledging that farmers, environmental experts, and the veterinarians are just as important to our shared health as doctors and nurses. Embracing a One Health approach within and between countries from the community level upwards is shown to improve global health security and support development gains. One Health is an inclusive, proactive, and preventative approach. At the community level, it strengthens surveillance, early warning, communication, and capacity across sectors so we can act early, coordinate better, and invest more effectively. As these efforts add up, they enable countries to build stronger systems for managing outbreaks, food safety risks, and antimicrobial resistance, while protecting biodiversity and shared ecosystems. At the regional level, One Health translates into harmonized approaches to zoonotic diseases, antimicrobial resistance, and food safety. Shared platforms that connect ministries and countries, and pooled capacities that reduce duplication and generate co-benefits for health, the environment, and economies across Eastern and Southern Africa. At the heart of this conference is the Innovations Marketplace, a curated platform for practical, scalable solutions at the human-animal-environment interface. We're giving the floor to impactful ideas across regional governance, transboundary disease prevention and control, animal and plant health, food safety, antimicrobial resistance mitigation, biodiversity and environmental protection, and trade facilitation and economic innovation. This is where partnerships form, investments accelerate, and solutions scale. We are the generation that will live with today's choices. We're ready to co-design tools, build data systems, and strengthen frontline capacities. One Health is how our region gets safer, greener, and more prosperous. Today in Lusaka, Zambia, the Regional One Health Conference is bringing leaders and practitioners together to institutionalize and operationalize One Health across Eastern and Southern Africa. The conference is hosted by the Government of Zambia and co-organized by SADC, the World Bank, the Quadripartite Alliance on One Health, and PREZODE COHESA. Our discussions will help inform the Regional One Health joint call to action in line with SADC Vision 2030. Setting shared priorities and guiding principles for coordinated action. This joint call to action accelerates regional leadership and harmonized policies and provides a platform for youth and innovators to contribute to resilient health, environment, and economies across Eastern and Southern Africa.
My name is Onezwa, and I am a farmer from South Africa, and I have signed the joint call to action. The time to act is now.
We invite all participants to add their signature to the joint call to action during the conference and stand with the region's One Health agenda. Here in Lusaka, we will set a regional vision and commit to a way of working that endures, one that is Africa-led, integrated, evidence-driven, and inclusive of youth, communities, and the private sector. Our shared future is One Health. Welcome to the Regional One Health Conference for Eastern and Southern Africa.
Definitely deserves a round of applause and, of course, excitement to understand how we participate. Now, that is a video of a farmer based in South Africa, Onezwa, who farms, forages, has a very close relationship with her livestock as a farmer, and of course adequately prepares amazing nutritious meals by leveraging how she shares these with the use of technology and social media. And I believe that that actually underscores many of the points that we've been highlighted in that video. Youth-led, use of technology, united aspects to ensure that we educate our communities and ecosystems, but most importantly, unlock much of the intellectual capacity that we have here. Yourselves as enablers of capital, policymakers and influencers, skilled individuals within civil society and academia who assist ordinary Africans on the ground to make sure that we actually solve for the challenge of One Health. Now, one thing's for certain, we don't want anyone to be left out of the conversation, so to build up on the commitment that was highlighted in that video, I'd like you to take a look at your tables, please, ladies and gentlemen. You would note that there would be a pamphlet on there that says, join the call to action. Now, this is where you get involved. You roll up your sleeves, you highlight the excitement that you have, and most importantly, share your commitment. Most importantly, what we're asking for is your camaraderie in being champions. Champions of sharing your commitment to One Health. So if you take a look at the piece of paper, available in all 3 languages, French, English, and Portuguese, what you can do is open up your camera, scan the QR code. The QR code will lead you to a website where you are able to read the joint statement, understand the commitment that we're making and exactly how we're looking to leverage off of our partnerships. And from there, you can actually sign the joint agreement to make sure that you are a witness to the shift that we'd like to see come 2030. So to the ministers, I see a few of you still reading through, please make those commitments. To the team at large, members of academia, please do feel free to make use of the QR codes available throughout the course of the day, as you will be able to join the call to action and actively participate in being part of the solution to One Health. On that note, though, this does take us to an exciting program with part of the program where many of us will actually see the level of partnership that we have across the regions and across the various organizations we have. We're going to have an opportunity now to actually have various partners come up on stage and actively join the call to action. So whilst many of us are participating using the QR code and signing digitally, we are going to put pen to paper, or in this case, a marker board. And this is actually where we'll have various leaders who will join us on stage to actively make their participation clear in joining the call to action. To lead us within this new innovative manner that we're going to share our partnership and engagement, please help me warmly welcome to the front of the stage a key coordinator for conversations and themes that are around One Health. He's also the National One Health Coordinator for Zambia and a key partner and enabler in making today possible. Dr. Raymond Hamunga, who's going to lead us within this new innovative ceremony and moment as we mark joint commitments and partnerships to joining the call for One Health. A warm welcome, please, to Dr. Raymond Hamunga.
Distinguished guests, ladies and gentlemen, aligned with the priorities and ambitions set out in the SADC Regional One Health Roadmap, we, the participants of the Lusaka Regional One Health Conference for Eastern and Southern Africa, acknowledge that our interconnected countries share rising One Health risks, intensified by climate change, environmental decline, and food insecurity, requiring coordinated regional action. We highlight that the strong One Health systems reduce costly disruptions, support climate-stable food and trade systems, and drive jobs and economic growth. We affirm our commitment to One Health to improve prevention, preparedness, and response through national strategies and strengthened regional coordination. We emphasize that effective One Health action requires adequate resources and inclusive partnerships across sectors to enhance safe trade, decent jobs, and sustainable development. Recognizing the urgent need to translate these commitments into concrete collective action, we hereby issue the following joint call to action on driving regional action for Africa's One Health future, and urging SADC to continue strengthening regional coordination mechanisms, harmonized policies, and cross-border platforms that facilitate joint surveillance, data sharing, rapid response, and integrated implementation of the regional roadmap for One Health across member states. We urge member states to demonstrate sustainable political will by reinforcing national One Health platforms, enhance multi-sectoral coordination, and invest in sustainable systems for prevention, preparedness, and response, while urging national actions with regional priorities and commitments. We urge the quadripartite organizations to continue providing technical leadership, capacity strengthening, evidence generation, and alignment with global One Health standards and frameworks to support coordinated regional implementation. We urge regional organizations to work collaboratively to advance integrated approaches that strengthen health, agriculture, environment, and trade systems, promote regional value chains, and support harmonized enforcement of relevant standards and legislations. We urge civil society to engage communities, raise awareness, promote behavioral change, and advocate for equitable and inclusive One Health actions that protect vulnerable groups and strengthen social resilience. We urge academia and research institutions to generate evidence, develop innovations, strengthen training and workforce development, and support monitoring, evaluation, and learning to inform policy and practice. We urge the private sector to build resilient, diversified value chains for medical countermeasures and safe, sustainable food systems to protect One Health. Regional actions must strengthen cooperation, technology transfer, and capacity building while advancing coordinated preparedness, strategic stockpiling, and information sharing to safeguard human, animal, and environment health. Last but not the least, we do urge development partners to align financing with regional priorities, scale up investment for preparedness and One Health, One Health strengthening, One Health system strengthening, and support long-term capacity building, knowledge exchange, and technology transfer against the region. We, the participants of the Lusaka Regional One Health Conference, hereby announce the formation of the Eastern and Southern Africa One Health Community of Practice. And to symbolize that, allow me to invite to the fore and to sign my fellow One Health champions. A round of applause for Dr. Tracy Kuzana Muvambi, One Health Secretariat, Zimbabwe. I'd like to invite Dr. Wayne, the Deputy Director, National Department of Health, South Africa, Dr. Wayne Ramkrishna. Dr. Razafimba Vokoe, National Coordinator of the One Health Platform, Madagascar, as well as Dr. Iyalo Mwaningange, the Deputy Director from the Ministry of Health and Social Services, Namibia. Join me in welcoming Dr. Flora Pule, the Professor of Botswana University of Agriculture and Natural Resources, Botswana. Last but not the least, my friend and colleague, Dr. Inesio Chongo, the National Institute of Health from Mozambique. Together, we shall take the pen as One Health champions to sign this joint call to action. Colleagues. You can come through.
And partners who have made commitments on stage, I'd like you just to join us perhaps at this table. I'll tell you why. But perhaps to remain standing and join us just to my left-hand side, because what I'd like us to underscore and emphasize is the fact that this is a key participation and partnership that we do see from key nations within the SADC region. And most importantly, as we have done, is to mark this occasion. We want to make sure that all of you are also part of this particular historic moment that has taken place. So we're going to do something that's slightly unusual, that typically doesn't happen at every conference, but this isn't just any conference. So ladies and gentlemen, I'm going to ask my colleague, the photographer, to join me up on stage to make sure that you have the right angle, the camera angles will be up, and at the same time, I'm going to ask everybody in the room to be upstanding. Why? Because we want you to be in the images, capturing everybody in the room for this momentous occasion as we mark this time in history and the commitment that you've made. So please stand up And of course, we want our photographer to join us on stage. We'll have this particular signboard perhaps move down to the bottom to capture everyone, from the ministers to our key partners, everyone in the room representing academia, financial services, civil society, captains of industry, shapers and influencers of policy, those key participants across the continent and from across the globe. This is a moment for our photographer and key photographer, the main photographer of the day, to join us in capturing this moment in a photographic opportunity with everyone in the room. So I do see we've got many more photographers and key members of the media. Do your thing. To everyone in the audience, this is where stomach in, chest out, shoulders back, chin up. This is where we say, One Health, joint call to action. Let's do that on the count of 3. 1, 2, 3. We can do it a little louder and perhaps showing more teeth so that our photographers have a good shot. On the count of 3, 1, 2, 3. Fantastic. And if I may, can I join the picture? I'll squeeze right here in between the ministers. And one more time on the count of 3. One Health, joint call to action. Fantastic. Thank you so much. A round of applause to everyone. Thank you to my colleagues in the media joining us on stage, our partners and peers from various countries across the SADC region for making your partnership and your camaraderie visible and able. This is a part of the program. You may take your seats, ladies and gentlemen. This is a part of the program where we are changing things slightly. We will participate in an interministerial high-level conversation after 1 o'clock today. But we're well aware that there are various changes that have been adopted to ensure that our various leaders have commitments to get to and will allow them to do so. But before they do leave, as you continue to sign the QR code, we'll be sure to bring the board back up on stage in just a moment to allow many more of you in the room an opportunity to make your own personal commitment, pen to paper, pen to board, in actively adding your name to the joint call to action. So you can do it both virtually but also online. One thing we also want to emphasize and highlight that will be critical throughout the course of the next 2 days is how we're making sure that everybody is on board to provide innovative solutions to ensure that we can timeously track, trace any concerns within zoonotics or even within our healthcare systems, understand how best it is that we provide the necessary interventions, and most importantly, drive that culture of solutionist, innovative thinking across the African continent. There are a few of you here in the room who will be making presentations and pitching your innovative ideas throughout the course of the day here on stage. But as you've walked in through the registration table and even outside the main entrance doors, you'd be well aware that you would notice the innovative marketplace. This is where key innovators from around the world, but many of whom are globally competitive but locally relevant, have ensured that they prioritize solutions that we can implement in One Health. Throughout the course of the conference, all of us will have the opportunity to engage with them, to understand what kind of challenges they're solving for, how they look to partner with governments, with financiers, policymakers, and of course, key partners within the One Health ecosystem. And most importantly, how their innovations drive tangible, measurable outcomes to addressing and alleviating healthcare concerns that we have within the ecosystem. What we are going to engage in at the moment now is allowing our high table, ministerial leaders and delegation to actually rise. They will have an opportunity to interact with many of these innovators. They'll make their way out their exits through the various stalls, including on the other side of the registration table. And this is where they themselves will actually speak, engage, and interact with many of these innovators and entrepreneurs. Following that, we will have an opportunity as well in the rest of the room to participate with the innovators and, of course, learning more about the themes that they would like to derive. For the moment, though, without holding any more of our panelists back, after lunch, we will have an interministerial conversation, speaking to different respective leaders of countries and key partners who are here today. But for the moment, we'd like our ministers and official leaders in the high table to please rise and be upstanding. we'd like to have you go on a first official tour of the innovative marketplace. So to the ministers in the front row, please be upstanding. My colleagues and counterparts from the World Bank will be able to escort you as you make your way out. We'd like to kindly release you and, of course, ensure that you have an exciting time within the marketplace. Chao is going to assist you. Please can we give our ministers a round of applause as they're going to make their exit. A reminder that some of the ministers will make their return for the interministerial conversation and panel discussion we'll have. This is where we'll really understand how the national objective and prioritization of One Health is seen, echoed, implemented, and most importantly, measured when it comes to the different economies that are present here today. In the meantime, ladies and gentlemen, the ministers are just getting a quick head start into participating in the innovative marketplace, but all of us will have an opportunity to engage and speak to some of the innovators themselves. I'm not too sure if we have any more of them in the room just yet, but if they are, perhaps if you can raise your hands up high. Any innovators? If not, they must have made their way out already to actually interact with the ministers. But what I want to drive is a level of camaraderie, partnership, and understanding just to evaluate how many of us have been able to sign the commitment virtually. Have we all won? Yes, no, maybe? Yes? Any no's? No no's. That's a positive response. What I do want to ensure, though, is that we call on our participants, our colleagues on the stage to actually assist me with the board. We're going to bring that back up on stage because we're well aware that we had several commitments being made by SADC nation states, but we also want to give you an opportunity in the room to actively sign this board. Add your name to the joint call to action, and of course have that be documented here. If you do so, you're more than welcome to make up your way on stage. We will have a photographer also available where you too can add your name to the clarion call to ensure that we have one health, one future through the different objectives and initiatives that we're prioritizing. Beyond that, you can also ensure that you do complete the form online using the QR code. By scanning the QR code, reading the commitment, and most importantly, signing and agreeing to the joint call to action and partnership, you will be able to actively share your name and voice to the agenda. I'm looking for volunteers, or shall I be friendly and make my way around the room? Oh, I see a volunteer. Ma'am, you can make your way all the way up in the white t-shirt. You can come up too, sir. I'm going to call up on my colleague as well from South Africa. Come all the way up. And what we want to have you too, ma'am, please do feel free to come up. What we'll do is take a moment to actually, let me ask one of my colleagues for a handheld microphone so that we actually know who you are, which organization and industry you actually represent. So, if I could please have a mic, we'll take a mic on stage. Ma'am, we'd like to start with you. You can also sign your commitment. As soon as you've signed, you'll step over on the other side towards me. And we'll just ask you very briefly the organization, sector, and country that you're representing as you make a commitment here today. Go ahead and sign, ma'am, as we wait for the microphone. Thank you. Go ahead and sign. Fantastic. Thank you so much, ma'am. And your name? If you could join me. Looking at the stage. Thank you so much. A round of applause, please, for Madam Selvi Unisi of Zimbabwe. Ma'am, if you could join us, we'll pass the croquis along. Perhaps if we could have a spare marker just to assist. Dr. Chitambo. Go ahead and sign and make your mark, ma'am. Fantastic. No questions about where you're from, Dr. Chitambo, but you can remind us and tell us which organization you're representing. Fantastic. A round of applause, please, for Dr. Chitambo joining us from Zambia. Fantastic. You can join us on the left, ma'am. You can go ahead and sign. We'll get another copy as well, just to get more commitments. In the meantime, I think another marker might be best if you can actually get the process moving faster. So nobody told us we're stuck in 2020. Our mic was on mute. Huh? But this one should work better. Dr. Kasonga. Kasongo. Thank you.
My name is Nancy Kasongo, and I'm a medical doctor with the Ministry of Health Zambia, 7 at the Levi Mwanawasa University Teaching Hospital. Thank you.
Thank you so much, Dr. Kasongo. A round of applause, please. We have a colleague here as well who's joining us to give us some insight and, of course, making their participation clear and their mark. Thank you so much. Fantastic. South Africa being represented. Congratulations and thank you so much to Komotso. Ma'am, if you can go ahead and sign. Thank you so much, Dr. Ngube. Appreciate it and making your commitment and mark on the board as a fellow South African. We keep the line moving. Fantastic.
Good morning. My name is René Mano from the Livestock Advisory Council, Zimbabwe.
Fantastic. Thank you so much. Tatenda. Tatenda sana. Thank you so much. And you, sir?
Good morning, everyone. My name is Hamidu Budraugu. I come from Burkina Faso, a French country, civil society organization, Réseau Accès aux médicaments essentiels. Thank you.
Merci beaucoup. Thank you so much. Round of applause for Burkina Faso, please. Ma'am, you can go ahead.
Thank you. My name is Professor Priska Mugabe from Zimbabwe. I am a rangeland ecologist. From the University of Zimbabwe, also representing PREZODE.
Oh, fantastic. Thank you so much, ma'am. Truly appreciate it. Sir, you can go ahead. Thank you so much, sir. Truly appreciate it. A round of applause once again. We've also got Jean Zolo. Thank you so much.
Dr. Janine Shaw from the Ministry of Environment, Forestry and Tourism, Namibia. Thank you.
Namibia, baie dankie, ons waardeer jou tyd. We appreciate your time. Thank you.
Thank you so much. My name is Marion Kangome, and I'm from Africa, Centers for Disease Control and Prevention, Africa CDC.
Fantastic. Thank you so much.
My name is Nikki Wisdamini from the Kingdom of PREZODE.
Siyabonga, thank you so much, Miriam Gamini from the Kingdom of Eswatini. We'll take our last two commitments and signatures, and of course, after that, a photo opportunity. Go ahead, ma'am.
I'm Loni Kamoya. I'm from the Ministry of Fisheries and Livestock. That's Zambia.
Fantastic. Thank you so much, ma'am. Go ahead and sign first. Then we have a reference for the name and the signature that we have on the board.
Good morning. My name is Mary Rosaline. I'm from WHO.
Fantastic. Thank you so much. A round of applause, please, for all the different partners, commitments, and of course, partners and peers that we have on stage. I think to ensure that we get a great picture as well, as we do have a videographer still with us, if everyone could join around the sign and the call to action for one last photo opportunity for our colleagues in the room who were able to take a picture. If we could all come closer. Stomach in, chest out, chin up. To our videographer, you can go ahead and grab a picture. And of course, our peer, you came for the picture, sir, but we don't mind. You can go ahead. A round of applause. This is what commitment and camaraderie looks like, ladies and gentlemen. Peers, partners, neighboring countries, and international peers alike, making sure that One Health is a priority for the one future that we desire. Thank you once again to all of our participants. Truly appreciate your time as you make your way off stage. Thank you kindly for joining us on stage and being amazing leaders in participating. Rea leboha. Merci beaucoup. Muito obrigada. Thank you, thank you. Ndatenda. Asante sana. Well, on that note, ladies and gentlemen, I think one thing's for certain is you can tell that after 1 o'clock, we're going to shift gears and make sure that the commitments and signatures that we have on this board will be brought to life, that we unpack and distill this through various conversations and presentations to fully understand how we as members of academia, civil society, financing houses of various countries within the SADC region all not only add our names to the list, but how we're going to shift the needle to take it forward. During this part of the program, ladies and gentlemen, we are changing things slightly, so if you do refer to your QR code, please do be mindful that we will continue with the running order of the program promptly from 1 o'clock. So what I'd like to encourage you to do at the moment is to join the ministers as they have set out in the innovative marketplace discussions and, of course, displays that are outside in the exhibition hall, the innovation marketplace, as you make your way through the exits, around the corner, and outside of the registration table. There are various 21 innovations on display. If you ask me, that's a significant number. 21 entrepreneurs, 21 partners, innovators who are globally competitive, but making sure that the solutions they have speak to the region that we operate in, who will be able to share and will later be pitching their ideas here on stage. Please feel free to interact with them, engage with them, network yourselves as colleagues and counterparts. Feel free to follow up on calls and emails you might have missed, but the one thing we want you to prioritize is returning to the room at 12:45. 12:45, we would like to commence with the program promptly at 1 p.m. To give you some insight as to what we will be discussing, many of the ministers will be joining us back in conversation, or key representatives of government, specifically in health, agriculture, who'll be giving us some insight around the country commitments or partnerships that we have regarding One Health. Following that, we'll have a conversation into how best it is that we build up the workforce for One Health, and we'll also hear from many of the innovators themselves who give us more insight into the creations, the solutions that they are solving for when it comes to One Health across the continent. So, my clock says it is 22 minutes after 11. 22 minutes after 11. We have well over 70 minutes odd to enjoy lunch, to network, and have a comfort break. Please be back promptly in the room at 12:45. We commence with the program at 1 p.m. Back in the room at 12:45, commence with the program at 1 p.m. Enjoy your lunch break, engage in conversation, and enjoy networking, ladies and gentlemen. We'll see you back here at 1 o'clock. have fruitful outcomes to the development, the rollout, and new participation that they would like to advance upon to make sure that there's ongoing growth regarding One Health. So I'll introduce the panelists up on stage to make sure that we are able to interact. I do strongly encourage you to be mindful of the feedback, the commentary that we'll hear, and of course making sure that these are themes and concepts that we can continue with throughout the remainder of the program. For the moment though, I'd like to call on a few participants, or my panelists rather, who will be joining me on stage. My first panelist will be having a seat in the chair to my left-hand side. The second chair to my left-hand side, joining us for an interministerial conversation and ongoing engagement and participation. Please warmly welcome to the front of the stage, Honorable Minister of Agriculture in the Kingdom of Eswatini, Mandla Chauka, who's joining us. If we could give the Honorable Minister a round of applause, please, as he makes his way up on stage. Right there, thank you, sir. Seated next to him is the Honorable Minister of Health in the Republic of Seychelles, Honorable Marvin Fanny, who joins us on stage. A warm round of applause, please, to Minister Fanny. Permanent Secretary for the Ministry of Health in Mozambique, Honorable Ivan Manyika. A warm round of applause, please, to him in the following seat. Permanent Secretary in the Ministry of Green Economy and Environment in the Republic of Zambia, Dr. Doughty Chibamba. Please, a warm welcome to him. Permanent Secretary in the Department and Ministry of Health in the Republic of Zambia, Dr. Kennedy Lishimpi. A warm round of applause to him, please. And Permanent Secretary of the Public in the Public Healthcare Space within Angola, please warmly welcome to the front of the stage, Honorable Carlos Alberto Pinto de Sousa. A warm round of applause, please. Honorable Ministers, thank you so much for your time, as well as Permanent Secretaries. We don't take this particular opportunity for granted, because this is one of the parts of the program that gives us an insight into the understanding of how, as a region, through our national discourse, and most importantly, the partnerships that we've been able to expand upon, how best it is that we find tangible examples as to how we have implemented solutions, priorities, and partnerships that are focused around One Health. I'll make my way down the panel asking respective questions that actually speak to your unique countries, unique portfolios, and of course key lessons that we can learn as regional partners, but also happy to build up on the insight that many of you can share regarding the levels of support and insight that you have. Starting with yourself, Minister Chauka from Eswatini, I'd like us to build up on the theme of understanding the economy of the Kingdom of Eswatini, a robust economy, one that obviously prioritizes small-scale farmers and agricultural activity, and of course strong trade relations with its peers within Southern Africa. Perhaps if you can give us some perspective, given the portfolio that you do take care of, being agriculture. When you look at One Health, it certainly fits strategically into the objectives that you're trying to attain in terms of the support, development, partnership, and sustainability of the agricultural space. Help us contextualize some of the initiatives that you've actively embarked upon, prioritizing One Health as a strategy.
Thank you very much for the opportunity. I do have to ask a few housekeeping questions. First, being that how much time do I have?
Good point. I'd like to give all the...
We are going to come back to me again.
I'll do my best to come back to you, Honourable Minister, but what I do want you to do is just to give us a quick overview within 2 minutes for us to get some perspective, and then we'll be able to build up on some of the themes that you've shared.
Well, thank you very much, because say if you allow politicians to stand behind the mic,
we might be here all day.
We might be here the whole time. Just making sure that I don't subject this good audience to
Thank you, Minister. We appreciate it.
Okay, I think from a One Health perspective, I think firstly for us, as the Kingdom of Eswatini, we are an agricultural-based economy, and most of our farmers are in the rural areas, And we actually have about 72% of our farmers being small-scale farmers. Therefore, we are very aware of the fact that they're subjected to all sorts of climate change phenomena that can sometimes devastate their livelihoods. For instance, we've had persistent droughts over years, and as I speak today, sitting here, our NDMA, National Disaster Management Agency, is out in the rural areas trying to deal with a devastating hailstorm that took place, I think, sometime last week, where our crops were decimated. But we still believe that agriculture is the right place to start developing an economy, because it's got a very high multiplier effect. And we also believe, therefore, that in doing so, the One Health principle is key, because it integrates the human life, integrates plant life, animal life, and the environment.
Yes.
Remembering that we owe the environment to future generations. It's been borrowed to us.
Yeah.
So we need to make sure that we leave it intact for posterity. We do have a number of programs that we're trying to actually use to help our farmers deal with that reality. One of which is that we must make sure that there's enough water for people to irrigate their crops. Because planting your crop and hoping that you'll get rain, we have realized it's not always guaranteed under the circumstances because of climate change. So we're building small sort of dams and medium-sized dams and irrigation infrastructure for the smallholder farmers to be able to irrigate and secure their harvest.
Sure.
We are also engaged in a big project which we call a water augmentation project, which will change the face of our country, especially in the south, because we are going to have irrigation for production.
Yep.
We'll have an eco-city. We'll have ecotourism.
Sure.
We'll have power generation, agro-processing, and all that is going to make sure that our farmers are more resilient, I can tell.
Sure.
Step at a time. Thank you.
Thank you so much, Minister. We'll come back to some of those themes because I do believe it's imperative. The interventions you've highlighted are some of the solutions that can be bolstered and supported by the innovators who are going to or already showcasing their work and their efforts in the marketplace. Minister Fanny, I'd like to come to you. You take care of a very critical role as the Minister of Health in Seychelles, supporting a population of between 120 to 130,000 individuals, primarily leveraging off of your expertise as a pediatric surgeon. But if we do take a look at the economy of Seychelles, it's a net importer of food. And perhaps if we draw the alignment regarding food systems and how that speaks to healthcare, and more so, an area of expertise for you being child healthcare in pediatrics, I'm quite keen to understand some of the interventions that Seychelles has implemented to make sure that within health and looking at the value chain of food systems, that you're prioritizing sustainability and, of course, enhanced monitoring in that regard.
Thank you for your questions. First of all, I would like to say a good afternoon to everyone. It's a pleasure to be part of this auspicious occasion, to be part of this One Health initiative. Seychelles itself is, as you may know, it's a small island nation, and some of the issues that we face are definitely not similar to what the continent faces. And some of the risk as well, slightly different, but again, we are not isolated, and definitely we need to also be careful when it comes to biosecurity. So what we've done in Seychelles currently is that we've basically strengthened our resilience by fully embracing the One Health approach. So our new national health platform, established in April last year, now brings human, animals, and environment together. So by doing so, we are better able to plan how our bio-food security.
Yep.
We are better able to have better surveillance and also rapid response. So we've managed to train about 18 field epidemiologists who are able to recognize and act swiftly when there is a risk to our population. And apart from that, the partnership that we've had with FAO, WHO, OHA, and also Africa CDC has helped Seychelles to modernize our food safety system and also enhance the integrated antimicrobial resistance control.
Got you.
So your next point with regards to how this, we can integrate this into our healthcare system when it comes to children. We know that with the introductions of antibiotics when it comes to livestock, there is this risk whereby what we consume can also result in, especially the antimicrobial resistance, which when you look at children, they are more susceptible to certain diseases, and this in itself is a disadvantage.
100%. So it does call on additional solutions. You have implemented some of these to ensure that you're able to mitigate some of the risk, but a lot more opportunity for partnership that's certainly being highlighted, which we understand participants are here in the room to actively support this. I'd like to come to Permanent Secretary Manyeka to get your feedback on this one. And naturally, you also take care of a key view on health. Your background as well, deeply enriched in terms of research and implementing policies to ensure that you minimize the growth and, of course, advent of TB. But something else that's quite unique that your Mozambique has implemented recently that is aligned to One Health is that you've launched the One Health FETP initiative just earlier this year. I'm quite keen for us to actually build up on, again, the levels of partnership, how this particular initiative, much like your peers, is meant to actually help meet the interventions of minimizing risk when it comes to One Health as a key priority.
Boa tarde e muito obrigado. Eu vou falar em português.
Yes, please go ahead and speak in Portuguese. We're happy for you to be comfortable. For everyone else on the panel and in the room, there are translator kits available for you. If I may ask my colleagues in the technical team to assist the English participants on stage, just with a few technical packs that we can actually use to ensure that we're able to hear the Permanent Secretary. But we don't want to hold you up, sir. Please go ahead.
Bom, muito obrigado. Nós queremos começar por agradecer a oportunidade que temos de estar aqui. Queremos cumprimentar Sua Excelência, os ministros, secretários permanentes e todos os participantes neste painel. Nós queremos começar por recordar que Moçambique, também pela sua localização geográfica, é um país que está exposto a vários efeitos das mudanças climáticas e, naturalmente, isto afeta também esta plataforma que é One Health. Na verdade, Moçambique está entre os países considerados de alto risco a sofrerem os efeitos das mudanças climáticas e isto tem estado a afetar também a nossa estratégia, a nossa perspectiva de implementação desta plataforma One Health. E o modelo que nós temos no nosso sistema de saúde, que é um modelo descentralizado, é um modelo baseado na comunidade, é sem dúvidas uma grande fundação para a implementação da estratégia ou da plataforma One Health. Em resposta a estas pressões, nós criamos já no nosso país uma plataforma One Health, que é composta principalmente pelo Ministério da Saúde, mas também pelo Ministério da Agricultura, e envolve outros parceiros, outros setores, portanto, da governação pública, ONGs, sociedade civil, mas também academia e instituições de pesquisa. E é nesta plataforma onde nós discutimos todos os aspectos relacionados à resiliência que deve ser construída diariamente para combater o efeito de mudanças climáticas, para aperfeiçoar a nossa plataforma One Health, mas também para buscar resiliência e sustentabilidade ao longo do tempo. E é por isso que nós aprovamos o nosso Plano Nacional portanto, de Emergências para a Saúde, o National Action Plan for Health Security, que é um documento orientador e que tem as diretrizes de como deveremos trabalhar para garantir esta resiliência que se pretende em termos de saúde, mas também em termos de economia. Algumas das ações concretas que nós temos estado a tomar incluem, portanto, o investimento em sistemas de aviso prévio. Isto aqui demanda ação multissetorial e permite, naturalmente, que haja detecção precoce pelas comunidades de qualquer ameaça, mas também permite termos uma resposta rápida, resposta atempada a qualquer um destes efeitos. Uma outra ação que nós temos estado a tomar, portanto, visa proteger tudo aquilo que é o que chamamos health livelihoods, portanto, as necessidades em saúde.
Sure.
E isto vai nos permitir reduzir as perdas animais, em termos de ambiente, mas também em termos de saúde humana. E há ações muito claras descritas no nosso plano, que incluem vacinações conjuntas com veterinários, mobilização de mais recursos e, naturalmente, isto tudo vai evitar reduzir os danos ao nosso ecossistema. Temos também, na perspectiva de reforçar e garantir a continuidade de serviços face a estas ameaças, temos estado a investir em unidades de saúde resilientes, portanto, infraestrutura adaptada para resistir aos efeitos destes efeitos, mas também planificação conjunta multissetorial, porque a resposta aos determinantes de saúde demanda envolvimento de vários setores. E o último exemplo que eu quero colocar aqui é o empoderamento que temos estado a dar às comunidades. Temos previstas e estamos a implementar algumas ações de treino para que as comunidades sejam empoderadas para poder detectar riscos, para poderem participar na partilha de informação precoce e também no ciclo de resposta a estas ameaças. Portanto, em resumo, nós pensamos que a plataforma One Health em Moçambique contribui para a construção de um sistema de saúde mais resiliente, mais integrado, mas também mais adaptado para responder aos impactos do clima, sempre tendo em conta a perspectiva One Health.
Muito obrigada, Permanent Secretary, for that feedback and refreshing for us to actually hear that you are empowering members of the community to ensure that there's data exchange, information, and of course, a level of inclusion in terms of how they do participate. I'd like to come to Dr. Chibamba, who is Permanent Secretary within the Ministry of Green Economy and Environment here in Zambia. And perhaps to build up on this theme, Permanent Secretary, there's an interesting dynamic that's been happening within Zambia's economy. Macroeconomic factors are working favorably for the economy, seeing superb levels of economic growth, upwards of 6%, unemployment also said to decrease by 11%. But let's focus on the key industry and sector that you look at, being the green economy. And I believe that there was a recent tailings dam that actually collapsed earlier on, and that does highlight some of the intricacies we need to be mindful of regarding the interlink and interplay of our minerals industry, how that speaks to the green economy, and most importantly, the livelihoods and sustainability of jobs of Zambians within the economic ecosystem. I'm quite keen to understand some of the interventions that you have considered within the ministry that you serve, and most importantly, what new aspects of collaborative opportunities you might be looking for to address One Health within the green economy. It is on.
Good afternoon. I think ordinarily I'm an outlier. Everybody here is from ministries of health. What am I doing here environment, about health. But thanks to One Health, I think it's all about integration now. In fact, I can argue that we from the environment sector, we are the foundation of good health. Every health facility will need water in order to run properly. You will not have that water if we do not keep our forests intact, which are going to be the sources of the rivers that are going to give you the water in the hospitals. Every disease that you treat on the hospital bed, it has a geographical coordinate in the environment somewhere where it originates from. And because of that reality, I'm comfortable to sit amidst medical doctors and others from the health-related fields. So in Zambia, yes, our mandate at the Ministry of Green Economy is to take care of the environment. We need to green the economy literally. And in the ministry, we have 4 technical departments. We have the Department of Green Economy and Climate Change. We have the Department of Environment. We have the Department of the Forestry. And we have the Meteorological Department. Now, if you look at all these technical departments, they are interrelated.
Yes.
So across all the departments, we have 2 key mandates that we must deliver. One is to ensure that we have a resilient and climate compatible development pathway. And secondly, it's about resource efficiency. So in the department, we are very active in terms of protecting forests and creating jobs in that particular sector, green jobs for that matter. So because we want to keep our forests intact, for climate reasons, we have to make sure that we provide alternative livelihoods through non-timber products, for example, beekeeping, it can be climate-smart agriculture, it can be aquaculture. So along those value chains, we do create green jobs. And one of the big ones that we do is ecotourism in these forests, so that the communities can benefit from there. Of course, as a ministry, we have a very, very delicate balance to keep. As a country right now, our target is to produce 3 million tons of copper per annum through 2030. As we dig our minerals, there's inevitable environmental degradation that will pop up. You mentioned one mining accident there. So this is the dilemma that we are sitting on. That's the mandate that we have to deliver. How do we ensure that we increase copper production while at the same time taking care of the environment? So to do that, we have a good bouquet of policy framework in place. Just last week, we were launching the environment policy, the meteorology policy, and the forest policy. These are revised policies to address some of the emerging issues. In the mining sector, we just revised our law, the Environment Management Act, in 2023, to provide for stiffer penalties for those that are going to breach our laws. Yes, we want investment to come through, but not at the expense of our people's lives.
Sure.
So in terms of One Health specifically, we see ourselves as a foundation, and we do collaborate very well with our colleagues from Ministry of Health. Even across schools, especially universities, it's very common nowadays to find students from the Health School of Medicine, from the School of Veterinary Medicine, popping up in a lecture room in the Geography Department to take courses like Geographic Information Systems and Remote Sensing, and also to take up courses in climate change. So we play a key technical role to provide technical guidance to these departments. Not too long ago, we developed the National Adaptation Plan on Health, working together with the Ministry of Health. So we see ourselves as playing a facilitatory role. How do we embed climate considerations in the health plan, in the health delivery system, in the agricultural sector? I mean, it's a nexus approach. You're talking of food, climate, energy nexus, so you can't work alone. 100%. So I think One Health is providing that platform where we can all come together and speak one language. Thank you.
Thank you so much, Dr. Chibamba. Appreciate the fact that you emphasize in the fact that as a countrywide approach, there's a multi-pronged strategy to make sure that multiple parties are building up on these initiatives. This is perhaps where we also have the opportunity to hear from Dr. Lishimpi, who himself can also perhaps echo much of the sentiments that you've shared. But perhaps, Dr. Lishimpi, if you can also just emphasize some of the preventative measures that have been put in place in terms of funding, in terms of support, coming out of the pandemic. Zambia, as a nation, like many of its peers, certainly had significant lessons and solutions that are now being implemented in terms of ensuring that for One Health, through One Health, there's adequate preparation to ensure that we're able to meet any challenges that we might have within the healthcare ecosystem. Talk to us through some of these solutions, and feel free to build up on some of the points that have been shared by Dr. Chibamba.
Thank you very much. Thank you very much for inviting Minister of Health to this very important conference. And I'll start by appreciating the organizers of the conference. And let me go straight into the subject matter that you've asked. The One Health concept, like everyone has said, is a very important concept that brings together ministries of health, livestock, agriculture, and environment. And the basic principle there is to create a platform and strengthen our health security and health security architecture. And the concept is to reduce the disease burden that affects our communities as a result of any of the issues that could arise from either the environment, the agriculture, or livestock sector and the health sector. So we are coming from eras of COVID, where we learned quite a number of lessons in terms of what preparedness mechanisms do we have as countries in order to respond to health emergencies. So here in Zambia, like he's already alluded to, we have created documents around the One Health concept to see how the country can adapt itself to making sure that we are prepared for any health emergency. We can respond to a health emergency. As we respond to a health emergency, our systems should still remain resilient. Now, why are we doing all this? Is because when we had COVID, we had to shift healthcare workers, all of them, to respond to the COVID pandemic, whilst leaving other areas of health very vulnerable. And actually we saw that even the rates of our immunization coverage fell. And it was not only in Zambia, it was across many countries in the world. And now we are, all of us as countries, trying to catch up to make sure that immunization coverage is gone up back to over 95% in our countries. So all this is as a result of not planning well. So this time around, we have thought about the systems. We have looked at what health facilities must have. He's already alluded to the presence of water in our health facilities. So we want our health facilities to be ready. What do we mean? If we have to have health facilities that are ready to respond to health crises. So we need water, we need electricity, stable sources of electricity. We need internet, so that we are able to communicate between health facilities and among ourselves. So all these issues are important. And of course, we need to have the implements, the inputs that are required, medicines, the medical supplies that are required for us to respond to these emergencies. Secondly, we also need to identify what are the diseases around us that are as a result of climate change.
Yes.
Malaria is one of the commonest that we have in the sub-region. And we have seen that when there are floods, when there's drought, the incidence of malaria can actually go up. So what do we do? It's not health facilities per se that should be responding to malaria epidemics, but we need the communities. So we need programs also in the communities, rightly, like my colleague has put it. Without a responsive community, you will not be able to actually identify some of these diseases early enough for you to mount a response. So we need a very good community health response
Yep.
so that we are able to pick up these diseases quick enough. The bottom line that is there now is the digitization of all these processes, from the community, the health services, and of course linking into our other ministries.
Yes.
So that we are able to share information. We are able to see what the community health workers are doing. We are able to see what the public health nurses are doing. We are able to see our border health posts, what is happening there. And then we're able to communicate. Should I be able to communicate to my colleague in Mozambique? If I can see something at our borders, I should be able to communicate to him or to Tanzania or to Zimbabwe, you know, so that all of us can then manage this situation together. So the concept is, if there is a disease in Zambia of public health significance, then Mozambique is at risk, Zimbabwe is at risk.
Yes.
So if we are not communicating, then we will not be able to control that particular disease. So we put together all these in order to make sure that we protect our communities. Thank you.
100%. Thank you so much for addressing that, because the regional integration is certainly something that does need to be highlighted and underscored in these conversations. How do we make sure that as peers and partners, we're actually assisting and facilitating the growth that we require as a region through the transparency, the exchange, and the collective efforts in terms of sharing that information, but also mitigating the risk that continues to be there. I am aware that in the interest of time, we won't have an opportunity to come back, but perhaps this is where I have a favorable opportunity to come back to the Permanent Secretary representing Angola, Permanent Secretary Honorable De Souza, to give us your perspective, especially taking a look at an economy like Angola. You've recently implemented new solutions as well within the Ministry of Health to ensure that their proposals for a pandemic fund. Key objectives as well are to make sure that you mobilize manufacturing and production of healthcare resources, medicinal tools, and treatments within a nation like Angola. I'm quite keen for you just to expand on how far we are with these prospects, but more so, what do they mean for your peers within the SADC region and members of academia, the private sector, and development finance institutions to collaborate with a nation like Angola, prioritizing One Health?
Muito obrigado. Boa tarde. Gostaria de começar por cumprimentar a digníssima moderadora, os colegas do painel, agradecer o governo pelo convite que fez. Estou aqui a representar a Sua Excelência o Ministro e sou o Secretário de Estado para a Saúde Pública. Dizer que nós em Angola entendemos que a saúde não se trata apenas de um setor de governação. É muito mais que um setor de governação. É um pilar estratégico que permite o desenvolvimento econômico e social da sociedade angolana. Por outro lado, nós entendemos que nos últimos anos Angola fez um grande investimento por forma que tivesse ganhos na saúde. E aí não podia deixar de falar, sobretudo, capital humano. Houve um investimento em infraestruturas, nós crescemos muito, fizemos investimento nos 3 níveis hierárquicos, primário, secundário e terciário, em hospitais de alta complexidade, não esquecendo os cuidados primários, mas também o capital humano é fundamental. Angola tem um projeto de formação emergencial, porque é um problema, para formar 38 mil profissionais até 2027, em todas as áreas do conhecimento, médicos, enfermeiros, técnicos de diagnóstico terapêutico, regime geral e outros. Por outro lado, também olhamos um pouco para a questão dos recursos financeiros. Daí aquilo que a senhora moderadora disse, nós aderimos e criamos o fundo pandémico porque os surtos que têm surgido muitas vezes levam-nos a situações difíceis em termos de fundos. Então criamos o fundo. No âmbito de uma única saúde, também nós criamos os comitês técnicos de uma única saúde, em que todos os organismos, setores do Ministério, instituições, podem, portanto, interagir, inclusive a sociedade civil. Um outro aspecto importante foi a criação de um plano multissetorial de biossegurança que permite o investimento, quer na vigilância epidemiológica, investimento na vigilância laboratorial, a nível, portanto, que não só da saúde humana, mas da veterinária e ambiental, e que tem, tanto, dado bons resultados. Nós temos um sistema de alarme, que é o de emergências, que foi implantado, chamado COHESA, que permite detectar situações de ocorrências de surtos em todo o país. Portanto, esta é uma demonstração clara de que os órgãos regionais nós temos que fazer essas parcerias, não só com os países, por causa até para as questões transfronteiriças, estamos a fazer formação, mas também para essas situações, que uma delas muito recentemente foi a cólera, em que nós tivemos que interagir com o SADC, com o OMS, e, portanto, conseguimos controlar. Há também uma questão bastante importante, que é o sistema de informação e comunicação. Nós criamos um sistema de informação interno, mas nós temos que melhorar a comunicação, como o colega disse há bem pouco tempo, a comunicação entre nós, entre os vários países, por forma que se evite que essas epidemias ou surtos se alastrem rapidamente e que as medidas possam ser, tanto, conjuntas. Não devemos atuar isoladamente, mas como uma região, porque essas medidas tomadas dessa forma conseguem dar respostas muito mais rápidas. Portanto, para já vou ficar por aqui. Muito obrigado.
Fantastic. Muito obrigado, Minister, and really giving us some perspective there into some of the solutions that have been implemented, seeking and soliciting the right funding, and most importantly, the adequate manner within which you've addressed the current challenges that a nation like Angola has been challenged by. I believe that there's been quite a bit that we've had to share throughout the panel, and most importantly, for all of us here in the room, this is a clear representation of the leadership that we have within our governments, within our respective structures, and most importantly, an understanding that the levels of collaboration can be advanced upon. We won't be able to take any questions or perhaps continue with further insights and questions for the panelists. We will conclude it here. But I believe, as has been echoed and highlighted, there are various interventions to ensure that we prioritize One Health. No longer is a Ministry of Health looking to address this in isolation. But given the rich natural resources we have and commodities within our nations, we need to understand how that speaks to green ecosystems, ensuring that use of energy is also adequately prioritized to ensure that there's still sustainability at the end of the day. We speak to our key partners and peers when it comes to the realm of financing. We also ensure that we highlight the necessary partnerships too, with key leaders in academia as well as the private sector. And most importantly, that we keep the doors and levers of communication open right across the region to ensure that there is no border or limitation to the advancements that we can derive. To our respective representatives from the Ministries of Health, the Ministries of Environmental Affairs and Green Economy, and of course sharing your views and your perspectives, including in agriculture from the various nations that are represented here. We appreciate your time and your feedback. We look forward to hearing much more of the commentary and feedback that will come from the participants here in the room, who themselves will be able to say, I'm keen to do this in my home country, but I'm keen to do this for my region too. So thank you kindly, Honorable Ministers, Permanent Secretaries, for giving us your feedback and making yourselves available today. Ladies and gentlemen, please give our panelists a round of applause as they make their way off of stage as we prepare for our next session. A big thank you once again to the various representatives of Swaziland, Seychelles, Eswatini, I beg your pardon, the Kingdom of Eswatini, Seychelles, Mozambique, Zambia, and of course, Angola. Thank you kindly for your feedback. While we look to build up on much of this momentum, and as has been mentioned, we understand the leadership that we have and the feedback that we have from our respective speakers. But One of the key highlights for this year's conference has to be the fact that we have innovators and entrepreneurs who themselves are leading the charge in making sure that they provide the solutions that we need. Many challenges were highlighted, several interventions listed, but most importantly, there is an opportunity for all of us to play a critical role in making sure that One Health is a priority. This does lead us to following through with the innovator pitch session. We will hear from the various 21 innovators who will make themselves present here today by telling us what their innovations are, what it is that they've created, what problem they're looking to solve for, and most importantly, how best they're looking to partner with you and I here in the room. So for this particular next session, please do keep an open mind, be responsive to the suggestions and innovations that will be shared, and most importantly, do remember to engage with the various innovators within their various stores that are available at the marketplace. The rules are quite clear. This is where we shift gears and build the energy. So we're going to hear from at least 4 innovators. They'll be making their way up on stage. As mentioned, they'll have 3 minutes, just 3. We've got a countdown timer, we've got a clock, we've got an alarm, and we've got colleagues in the background who will make sure that we keep to time. They will be sharing their innovations with us over the next 3 minutes. As soon as they're done, we'll conclude, we'll wrap up, and we'll move on to the next particular innovator. On this note, I'd like us to introduce our first entrepreneur, an innovator that's going to make their way up to the stage. If they could be ready and on standby to make their way to the lectern. As soon as they're comfortable, we'll give them an opportunity to start with their presentation. But please, a warm welcome to Ms. Corlina Patterson of Agro Ledger and Face It. Fantastic. Ms. Corlina, my colleagues and team members have been getting ready with the countdown timer. However, we will ensure that there's an adequate manner within which we can communicate the timing and the buzzer to you. So, if my team and my colleagues in the background are ready, if we've got a timer running, thumbs up all round. Fantastic. Ms. Patterson, your 3 minutes
Thank you.
Starts now.
Excellencies, distinguished ministers and colleagues, good afternoon. It's an honor to join the innovators the World Bank has convened as you move from One Health strategy into national implementation. You know better than most that animal health disruptions rarely remain confined to livestock. They influence household stability, food availability, antimicrobial use pressures, and the environmental stresses that follow production losses. Strengthening animal health systems is central to achieving the One Health commitments your governments have made to protect populations, economies, and ecosystems. At Proof It Technologies, our work responds directly to this operational reality. Experience in regulated national programs has shown us that the critical barrier is not a lack of capacity or a willingness to intervene. It's the challenge of obtaining timely, trusted, and complete information from the field, without which ministries are forced to react late rather than guide events early. Our AgriLedger technology addresses this challenge by providing a national traceability and compliance backbone built on structured, event-based data capture. It consolidates inputs like animal movement events, treatment records, vaccination status, collected from farmers, veterinarians, inspectors, markets, and movement permitters into a single, continuously updated national data set. It standardizes event data to conform with national regulatory schemas, producing clean, interoperable records that support rapid tracing, compliance verification, and advanced analytics. In the event of a suspected foot and mouth disease case, for example, AgriLedger's tracing engine can identify all of the at-risk animals, premises, and conveyance vehicles in under 2 minutes. By reconstructing direct and indirect movement chains, authorities can isolate pathways before they generate wider disruption. Its architecture maintains immutable event histories while enabling real-time analytics, allowing governments to audit the past and respond to the present simultaneously. Our Face It technology complements this by bringing biometric animal identification to everyday devices. Each animal's unique facial signature is used to generate a secure biometric digital identity with no requirement for tags, specialized equipment, or controlled environments. The algorithms are trained to operate reliably under variable field conditions typical of rural and pastoral systems. Its architecture supports continuous learning across species, breeds, ages, and geographies, and establishes the foundation for future early disease detection capabilities as biometric disease signal research advances. What differentiates Prove-It systems is not just their individual functions, but also their interoperability. Together, AgriLedger and FACEIT form a unified animal health intelligence capability that transforms fragmented observations into a coherent national picture. These are not simply aspirational tools. AgriLedger is approved for use within Canada's regulated National Traceability Program. Its demonstrated performance under Canadian regulatory scrutiny conforms its suitability for nationwide deployment and its readiness for immediate, reliable integration at scale.
Ms. Patterson, I believe that your time ends now.
Thank
Unfortunately,
you.
the timer and, of course, our representative wasn't visible to your eye line. However, we'll have to leave it there.
I was done.
I know you were getting to the nub of it, and there will be an opportunity to engage, but that's part of the excitement. The fact that all of you are left having an opportunity to find Ms. Patterson at her store within the marketplace and interact with her. Thank you so much for your time, and of course, a round of applause, please, to Carolina Patterson, who's joined us on stage today. To my colleagues in the technical team, what we're going to try to make sure is that we have at least an audio appeal just to make sure, or sound effect to make sure that it is visible, audible to all of the speakers to understand that their 3 minutes will be up. We do want to make sure that this is fair and equitable to everyone. But thank you again, Ms. Carolina Patterson, for your feedback. Your time and your effort and your presentation is acknowledged. We keep the momentum moving, though, because we do want to make sure that the energy does continue. Please welcome to the front of the stage, Smart Surveillance Meets Sustainable Farming, Dr. Kayla Kaufman, who's going to join us today. You're ready? You're comfortable? A round of applause, please, to get the energy going. And perhaps I have to emphasize this. These are entrepreneurs who not only are passionate about their innovations, as we've heard as well from Ms. Carolina, but these are individuals who have put in months of work into making sure that their innovations not only meet industry standards, they are relevant to the market that they're trying to serve, but they've also had to put in time to make sure that they can communicate this succinctly in 3 minutes. So as we all know, sometimes it can be nerve-wracking. So when we ask for your applause, it's really to make sure that all our speakers are comfortable and relevant. We've got our colleague right in the front who'll give you a timer. She's a manual timer. I'll keep watch on my alarm clock as well. But 3 minutes is what you've got. Every minute, you're going to raise a different time code from 3 to 2 to 1. And then from there, as soon as she's done, she will stand up. That means that your 3 minutes is up. I'll make my way up on stage and introduce the next speaker. I trust we all understand the flow of the program now. We're comfortable? You don't sound certain. Are we comfortable? Fantastic. Your comfort and priority, comfort and understanding is my priority. Fantastic. So, Dr. Kaufman, your 3 minutes starts now.
Thank you for the honor of being here today. Across Africa, there are over 12,000 existing dams, with 600 more proposed or under construction. These projects create breeding grounds for schistosomiasis carrying aquatic snails, resulting in transmission hotspots that trap communities in cycles of poverty and disease. However, 90% of environmental impact assessments completely ignore the impacts of dams on this devastating parasitic disease. Our research group develops predictive systems to aid infrastructure planning and identifies novel environmental controls for schistosomiasis. First, our rapid risk assessment software called INVEST Schistosomiasis allows planners to input existing projected environmental data into the platform. For example, hydrological models of how water regimes will change when dams or canals are built. The software then outputs predictions of snail habitats and the human population at risk, generating actionable transmission risk maps. Next, our high-resolution spatial models of snail habitat identify the exact locations, floating aquatic vegetation, where snail control is needed most. These AI models combine decades of field surveys with drone and high-resolution satellite imagery, pinpointing the locations where snail treatment is needed and eliminating the need for wasteful blanket treatments. Next, we test ecological solutions to environmentally transmitted diseases like schistosomiasis. Communities in these places need One Health interventions, not just mass drug administrations and short-term controls. Currently, we are testing if integrated rice fish farming can help control schistosomiasis in rice farmers, which are disproportionately impacted by the disease. In integrated rice fish farms, native fish species naturally consume snails, while simultaneously providing farmers protein, additional income, and of course, fertilizing the rice crop itself. In fact, fish and rice grow better together than independently. As a low external input sustainable agricultural system, or LISA, farmers need only slightly modify their existing fields and purchase fish. No external feeding of fish, which is quite expensive, is required. In our pilot studies in the Senegal River Basin, we showed that farmers recoup the investments of modifying their fields within 1 year, and simultaneously snail populations plummet, thus providing disease control. Together, our projects combine predictive intelligence with ecologically driven solutions to help break the cycle of poverty and disease. Thank you.
Fantastic. Dr. Kofan, seems like you made it just in the nick of time. Been monitoring my colleague as well just to follow through with the time now. But on that note, we move on to our next innovator now who's joining us on stage, Dr. Sahil Tulsi, who represents Illumia Genomic Solutions for One Health. A round of applause, please, to help build his energy. Fantastic. Dr. Tulsi, your 3-minute timer is my colleague in the front of you. She'll start off with the 3-minute timer. She'll scroll down to 2, then 1. As soon as she stands up, that is essentially when your time is up, and I'll make my way up on stage.
Sounds good.
Fantastic.
Thank you so much.
You're welcome. All the best. Your 3 minutes starts now.
Great. A very good afternoon to everyone, and thank you very much for the opportunity to speak. As you all are aware, Africa is a continent that continues to face the burden of disease. Just in 2024, we had more than 200 outbreaks. Those outbreaks not only impacted the lives of many economically active individuals, but it's also claimed the lives. What if we had the possibility and the ability to detect pathogens before a patient even presented themselves with clinical symptoms? And this could be from a range of samples that were related to One Health, whether it's environmental samples, waste effluent, or even environmental samples itself, or wastewater. Of course, at Illumina, which is a global DNA sequencing and microarray service provider and supplier, innovation is actually in our DNA. It's our mission to reduce the burden of disease, both in humans as well as non-humans. And this expands to several market segments: infectious diseases, oncology, reproductive health, rare genetic diseases, as well as agriculture. With our latest innovation, known as the MySeq I100 series, which is a next-generation sequencing sequencer that you will have the ability to discuss and view at our booth, enables faster sequencing that is extremely rapid with quality that meets and exceeds industry standards to produce best-in-class genomic data. Not only is it a rapid sequencer with impressive turnaround time, but we also have room temperature shipment of reagents as well as storage. This would reduce the cost of shipping as well as eliminate the need for cold chain supply. Also, we have the ability to include onboard data analysis to perform data analysis without the need for an internet connection, allowing us to sequence and detect pathogens in less than 8 hours. No doubt, a system like this was designed and built for Africa. So in light of this powerful benchtop sequencer that has been innovated by Illumina, which is a multinational, it would be extremely beneficial and crucial from a One Health perspective if we could all stop working in isolation and work together to raise awareness on how the power of genomics and how its potential can strengthen our surveillance systems on the continent, so that we can work together to secure a healthier future for humans, wildlife, as well as the ecosystem that we share. Thank you.
Thank you so much joining us there to give us your perspective and, of course, sharing more about your innovation that we see there, Dr. Tulsi. As you can tell, my alarm just went off, so we are well aware that you made it in the nick of time with the timer. Well, I'm hoping that for many of you, this has provided an interesting perspective, right? How many of you were quite familiar with some of these innovations that have taken place? By show of hands? Yes? No? I see a few shooting up and shooting down. But that's the whole point of this particular conference, to make sure that through the heightened level of interaction and engagement that we have, we are able to actually profile so many more of these entrepreneurs as well as their solutions going forward. So I'd like to strongly encourage you to make your way to the respective booths that are available outside at the Innovation Marketplace regarding Agro Ledger and Face It. Of course, making sure that you meet smart surveillance, meet sustainable farming, and Illumia Genomic Solutions. These are just a few of the entrepreneurs who have been highlighted today, so please do make sure that you engage, listen to what their needs are, what it is they're solving for, and most importantly, how you can play your part. We're going to move the conversation now as we prepare for our second panel discussion, but I have an interesting question for you. How many of us have been on safari? Yes, no, maybe? Yep, show of hands, quite a few of us. Oh, there we are, confidently so. A large number of South Africans on safari. It's one thing for us to work within an ecosystem where we're able to control or perhaps influence human beings. But working with animals, working with wildlife, working within the natural ecosystem is a completely different ballgame. But this is where we've seen ongoing support, investment, training, and the development of ranges to capacitate the ecosystem that we live in. This is both in markets like Kenya, even here in Zambia. And this is where we're going to get a deeper understanding as to how prioritizing One Health unlocks so many more opportunities for the sustainable development of jobs. And jobs that also create systems for a shift within our societal impact. Our next section is going to incorporate a panel discussion. We'll be taking a look at how through the implementation of One Health, we can have healthy jobs, and most importantly, how we build that workforce with investments in the new generation. We'll hear from key role players and different institutions who participate in education, of course, in making sure that we understand the various sectors we can create jobs in, and of course, some of the innovations that they can share. But before we do that, we do want to kickstart with a TED-style talk. This will be delivered by 2 wildlife female rangers. So, if you haven't been on safari just yet, maybe these are the ladies that you need to make sure that you speak to during tea break today. We're going to hear from them regarding the experience of Team Lioness Female Rangers, and most importantly, the efforts and the work that they do at the Conservancy in Zambia. This will be a 10-minute presentation, following which we'll move to our panel discussion, which will give us some insight and build up on the themes and concepts that they share. If we could please give a warm round of applause to Anita and Constance, who are joining us on stage. Anita and Constance, to build up on the theme of healthy jobs and healthy people.
Distinguished ladies and gentlemen, all protocols observed. Yeah, we are the lionesses from the Kafue National Park. Today we've been allowed to stray and, and actually share what we have. Yeah, so looking at the One Health, when we talk about paid yeah, so when we talk about human health, we talk about pets, we talk about livestock. What usually comes in our minds are nurses, veterinarians, and not forgetting the doctors. Yeah, so we believe we are in the right place because our roles are to ensure that we conserve wildlife, we conserve the biodiversity, and conserve the ecosystem. Yeah? Yeah, so through One Health approach, this integrates human, animal, and environmental health through multi-sectoral collaboration to address the complex health threats addressing zoonotic diseases such as Ebola and rabies originate in animals and require integrated surveillance and response systems to protect humans. Impacts of climate change, combating antimicrobial resistance. Yeah, so we are the frontliners as we go about doing our various works in the world. We are the people that actually detect the diseases first through the observations. Yeah, we have monitoring tools that we have during the patrols. We are able to observe animal behavior, animal mortality, and the numbers of species. Yeah. So when we detect any anomalies in the animal behaviors, we are able to communicate with the control room where we will share the coordinates where maybe we came across such animals. Yeah, so that information can be accessed by stakeholders, interested parties, so that we can actually maybe carry out research and ensure that the diseases are not spread to other animals. Yeah, so these are female rangers. Yeah, I think that this was during the commemoration of the International Female Rangers Week, where we had interaction with the community to educate them on the importance of wildlife, the importance of combating, protecting our wildlife. Yeah, so we see the female ranger there. She was removing a snare. Yeah, so snaring is one of the methods that are used to actually poach the animals. So apart from detecting the diseases, we also prevent, talking about the zoonotic diseases, we also prevent other diseases from spreading to the communities. When we apprehend the poachers, we will confiscate the meat, yeah, not depriving the kaondes, like the minister mentioned earlier on, that they are the lovers of meat. Yeah, so what we're trying to do is to prevent possible diseases that we may not know that may be transferred to the members of the community. Yeah, so what happens when the snares are laid? They don't have a targeted animal. Any animal can be caught through that snare, regardless of what type of a species. It can be a hyena, it can be a wild dog, but for them, they don't care. They'll preserve it and, transport it to urban areas where it will be sold. By then, they wouldn't know what diseases will be, those animals will have. Yeah, I've talked about wild dogs. So imagine eating wild dog meat. You are not aware that that meat is contaminated with rabies. Yeah, so we prevent that meat from reaching the members of the public. There are other methods of hunting that are used apart from the snaring. They use poison, which they will put on the arrow to actually kill the animal. Or they will use the food that, especially for the elephants, they will use oranges, which will be poisoned. Yeah, so the meat eventually will be preserved and taken to the members of the public. So we wouldn't know the type of diseases that will be spread through that particular meat. Yeah, I've heard of people complaining that they have allergy after consuming wild meat. Yeah, the reasons are very clear. You might have consumed a wild dog, yeah, which is not meant for consumption. I'm sure you also agree with me that activities done under concealment. Illegal activities are usually done under concealment, meaning that the preservation of the meat is done under, very unhealthy circumstances. Yeah. Usually it will be done away from the water point where maybe the poachers are not, no, they will not have access to even bath or wash that meat, you know. Yeah. So, can you say something?
Thank you very much.
Yeah, so she will assist me in talking about the roles that we actually play in One Health.
Thank you very much. As wildlife police officers, rangers rather, we don't just, combat poaching. We also present or poachers, they are very sophisticated people. We would find that in a situation whereby they don't have enough wire snares to use or any other method. They also do the fishing in the park using different ways or methods. They do get chemicals, dangerous ones, very noxious, and put in the water for them to harvest a lot of fish. The very water they put in those chemicals, dangerous ones, is the very water we consume as wildlife police officers when you're out there combating poaching. But we don't rush, no matter how thirsty we are, we don't rush to consume that water. We first observe if there is life in that water, meaning if there are no ants or any movement of different species that are found in the water, if there is that, we do consume. If there isn't, which means that water has been contaminated or put in something dangerous, which is the chemical. When they harvest a lot of fish by doing that kind of method, they preserve that fish, take it to the community, and sell it. They don't care, they don't mind. As long as they get income, a lot of it from that, which is very dangerous. As wildlife police officers, our job is very risky. Let us work together as Africa to combat poaching.
Yeah, so in the case of fishing in the in the national park, what we do when we apprehend the suspects, we have the collaborative department, which is the Department of Fisheries. Yeah, so we'll communicate with them and then they'll come on board to enforce their act. Yeah, the perpetrators will be taken to court and that meat will be, it will be disposed of by the courts. Yeah, and by so doing, since we don't know the type of methods that have been used, sometimes they use mosquito nets which are treated. And as she has mentioned that there is also poisoning that is involved. Yeah, so by handing over the perpetrators to court, it means that we are preventing the possible diseases that could have been caused, that could cause, we are preventing the possible transmission of the diseases through the fish that was caught using poisoning and other methods that are not allowed. Yeah, so we manage human-wildlife conflict. Yeah, as you are aware that the populations are actually growing and hence the demand for more land for cultivation and other resources. Yeah, so because of the encroachment in the protected areas, we have, the animals have their corridors where they pass through and actually do their feeding. But in the process, because of the encroachment, they'll find that maybe there are developmental activities in the areas where they used to feed. Yeah, they'll find maybe they have done farming. theirs would be to consume those crops that they have found. And then eventually, there will be human-wildlife conflict. The humans would want to protect their crops, while the animal would want to feed from the area where they used to actually feed. Yeah, in the process, maybe because sometimes the local communities don't understand the interventions for that, they will be tampering with those animals, and we tend to lose human lives in the process. Yeah, but if we can have a collaborative approach like we are doing in the Kafue National Parks, where the Nature Conservancy and African Parks with other cooperative partners, they have supported us to carry out awareness around the protected areas to ensure that there are best practices. Yeah, so in terms of preparedness, yeah, this is my colleague, Cornet. She was just coming from the field with that chopper where suspects were apprehended, and we can see there's a contraband of meat there, which will be eventually be taken to court as evidence and later on destroyed so that it doesn't reach people out there. Yeah. Yeah, so this kind of response can also be used in collaboration with other interested parties in an event where we detect diseases in the field. Yeah.
Fantastic. Anita and Constance, you are doing incredibly well, and I think more than anything, you're educating a lot of people in the room about the hard work and emphasis that you put in place. So firstly, can we please acknowledge their efforts? A round of applause. Thank you. I do have one question to ask you, but I am tempted to say, who needs Power Rangers when you've got wildlife rangers in Zambia? Briefly, we have an audience of people who come from different countries, who represent the region, government officials, financiers, academia, private sector, civil society, continental movers. What's the one thing you need in your job or in your efforts and in your space that would make your work easier?
Yeah, what we need is capacity building to allow us carry out our job effectively.
And what does capacity look like? Is it money? Is it a chopper? Is it more ammunition or support? Is it more rangers like yourself?
Yeah, we need more rangers. We need more skills, yeah, to be able to interact with the communities.
Fantastic. So we understand what the wish list is. I'm sure all of us can put in our efforts to make sure that we capacitate them in terms of support. So skills, training, and of course, additional resources. Yeah. Anita and Constance, thank you so much for your time. We really appreciate your efforts. Please give them a round of applause as they make their way off stage.
Thank you so much.
Thank you. And this is part of the theme that we want to build up on, understanding how it is that all of us have a partnership and key efforts that we prioritize when it comes to One Health. Perhaps an aspect of life and part of an economy and job creation that seems so different for many others, depending on the sector that you're in, really does translate into ensuring that the ecosystem regarding One Health is interconnected. And I want to build up on the question that I asked both Constance and Anita. What's the one thing you need within your area and field of work that will advance your efforts? Our next panel discussion is going to be a quick-fire 30-minute discussion where we'll ask various industry experts to share their perspective on these themes. Whether it's from educational institutions, understanding the continental objective to actually minimize the spread of disease. We'll speak to key players in the private sector who themselves focus on climate risk, but also the investment portfolios. And most importantly, we'll also hear from government institutions and leaders in that regard to understand what role they are playing here. So I'm going to introduce my next few panelists who will join us on stage. You are more than welcome to participate in this particular panel discussion. We'll have a QR code that will be up on screen in about 2 minutes' time, and you can actually copy down, or rather click through the QR code. It will take you to a platform called Mentimeter. Through that, you'll be able to submit your questions and we'll be able to moderate them and share them with the panelists. The only request we have is that you are very specific as to who your question is directed to. That makes it easier for us to direct the question to the appropriate speaker for you to get the best answer possible. Our next panel discussion, ladies and gentlemen, is one where we focus on the key theme of healthy jobs, how it is that we prioritize this under One Health, One Future. Please help me welcome to the front of the stage various speakers. I'll introduce them individually according to their names and titles. We'll applaud and acknowledge them. From there, they'll have a seat, and then we'll get into the conversation as we should. Please warmly welcome Professor at Tufts University, Professor Helen Amunguni, who joins me in the seat to my left-hand side. She'll be followed by Mr. Mpundu Mutale, Zambia Country Manager for Pula Advisors, if he could join us in the second seat to my left-hand side. Dr. Frauke Jungblut, who joins us as Practice Manager at the World Bank, if you could have a seat in the center. Dr. Marie-Roseline Danke Belize, if you could join us as Director for Emergency Preparedness and Response at the World Health Organization. A warm round of applause, please. Ms. Kangume Malion, Lead Zoonotic Diseases Program at Africa CDC. A round of applause as she joins us in the last seat. Thank you so much to our panelists for joining us, and most importantly for all of you for giving us some insight into the themes and concepts that we need to unpack. In this particular panel discussion, I'd like us to keep the momentum and perhaps even build on it even further. What we heard from Anita and Constance is very critical. This is a sector of the economy that typically sits at the outside of our focus, but most importantly should be prioritized given its relevance to the One Health ecosystem. And this stands true for markets within the Southern and Eastern Africa region. We need to prioritize the efforts that we put into wildlife preservation. But through that, and through the efforts of Lioness Africa, we've been able to create jobs, enhance livelihoods from a societal point of view, but also enhance the level of data, insight, and research that we see into this critical sector. So the quick question that I asked was, what do you need, Constance and Anita, in order to build the capacity that you have? And one of the key themes that they alluded to was we need more rangers. This perhaps is where I'd like to come to you, Professor Helen. More rangers obviously speaks to ensuring that we prioritize this when it comes to curricula, ensure that we prioritize it when it comes to career awareness, and ensuring that there are many more participants who understand that not just for rangers alone, but economic and employment opportunities that exist when it comes to One Health. Given your expertise at Tufts University, you're a key leader in academia, I'm quite keen to get your perspective on some of the initiatives that can be undertaken by academia to highlight, profile, and support the wide ecosystem of job opportunities that can be created under One Health.
Thank you so much, Gugu, and thank you for this opportunity. I think one of the things we need to realize is that academia really is central to producing jobs. And we're talking about creating One Health jobs. So the question we need to be asking is, what skills do we need to create that person who is a One Health practitioner? In mind, three things come. The first one are the technical competencies that are needed. Secondly, we must have multi-sectoral competencies across different sectors, because that's a One Health practitioner. They need to be able to understand the complex challenges that we face: antimicrobial resistance, pandemics, preparedness, climate shock, all these things. And then the third most important thing is we must create an enabling environment for these people to be able to get jobs in the system. We can't train someone and then throw them out into a system that does not understand what One Health is. And so in academia, we've been forced over the last few years to actually change our mindset, to repurpose, to restructure our training curriculum, to make it transformative, make it very experiential, create a systems thinking approach that really targets these complex issues. So I'll just give an example of some of the things that we've done.
Sure.
Looking at our target audience has expanded. We are thinking we must start from primary schools to secondary schools into college. which teach kids mathematics. Why are we not training our children to know that they can get rabies? Why are we not training our children in primary schools and secondary schools to understand that climate change means flooding, means food insecurity?
Got you.
So we have a program that's called One Health for Kids, and you'll hear about it, where we target primary schools, we target secondary schools, and we train these people and teachers to understand about One Health so that there's that mind shift. The second thing that we've done is at high school level, bringing in students over holiday time, over summertime, to actually allow them to practice One Health together. Different students who aim to go to college and do different things, we don't differentiate. We'll bring in someone intending to go to vet school, medical school, economy, so that they work together in disciplines. And then, of course, we have college level, where at college level, we have so many One Health programs, especially experiential learning. They go to the field, they practice together. When they graduate college, we are right now running what we call a One Health Fellowship. And in this One Health Fellowship, we take different disciplines again together. Could be an economist, a journalist, a veterinarian like me. We bring them through a One Health leadership training process. We attach them to multiple organizations, One Health organizations out there. We have them practice with them. Through this process of attachment, we are building a pipeline. We are building a pipeline and a mentorship for them to get into practice. And then we also do like a 3-month field placement so that we can engage them with the private sector, we can engage them with NGOs, with government. So pulling them together and allowing them to work together where they would go.
Professor Helen, I think there's something we need to lean into regarding the fellowship here, because it seems as though you've got the ecosystem that everybody's looking for. We literally can come to you, pick a student, pick a graduate, and of course have them fill into the ecosystem. Are you sharing these ideas with your peers in the industry, maybe even other institutions of academia, to make sure that we can achieve this at scale in terms of adequately capacitating the labor force?
Absolutely. So we do have, like, our One Health Fellowship has been running for the last 4 years. And right now we run fellows from 4 different countries in Africa, and we bring them together, and then we attach them to 8 different countries. So they can go into Liberia and be attached to the government Ministry of Climate, or they can go into Uganda and be attached to the Ministry of Health, or they can go and be attached to the One Health Commission. You know, so we attach them with different partners across the world and across different countries, but we also bring these partners together. So I can just briefly mention that in January, we are going to be starting what we call a One Health Design Studio. And this One Health Design Studio is actually bringing our field partners, private sectors, people from the private sector, donors, veterinarians, medical doctors, into one space to design responses to innovative, to complex challenges, to design innovative responses. And they have students attached to them as well. Then they can go back into their field and practice. We believe that this will be a really good space for them to engage and continue to open up opportunities for our youth to get jobs.
100%. I want to use this opportunity to go to the other side of the panel. And Kangume, this sounds like a market and an opportunity that you would absolutely relish in. Given your leadership at Africa CDC, you implement a lot of workforce tools, participation, engagement, in order to make sure that we are ready for any kind of pandemic. There's a level of preparedness. Our approaches are strategic but also measurable. It sounds as though we've got the secret sauce sitting right here with Professor Helen. But I'm quite keen to understand, through Africa CDC, are there specific work readiness and work tool skill sets that you've implemented within your organization to speak to the development of new talent in the One Health economy?
Thank you so much. One is to appreciate academia.
Fantastic. Kangume, one particular favor, I'll just ask you to pull the microphone closer to your mouth, just to ensure that you're a lot more audible.
I hope now I'm audible.
Audible, right? Fantastic, yes.
First is to appreciate the academia. As a wildlife biologist from Makerere University, we had a lot of field work and attachment in One Health through the One Health Eastern Central Africa. And, you know, like the fellowship programs that were being run there. So when it comes to One Health workforce and leaning into the Africa CDC, which is a continental body that is working and mandated in strengthening capacity for public health institutes across Africa. One of the ways that we look at or that we need to strengthen One Health workforce. First of all, we need to look at what do we need when we talk about One Health workforce.
Yeah.
And an important role in this and how we can, as a continent, move forward. First of all, building this workforce. And this can be done through, the different partnerships and coordination mechanisms. One, working with our the private sector, working with the governments, the regional economic communities, and bodies, for us to be able to, first of all, look at the existing systems, like the academia that are already running some of the fellowships. How do we work together? And also ensure that the different innovation hubs are empowered.
Got you. And maybe that's a good point for me to come in here. I just want us to build into the solution thinking of the conversation. Are there any gaps that you witness in the market? As you say, you speak to stakeholders, you speak to partners. Are there any gaps? And on the back of that, are there solutions that we can implement to ensure that we move the narrative forward in the next 5 years?
Yes, there are very many gaps, but one of them is that we all agree, even in this room, that each and every one of us is doing something.
Yeah.
Is doing something to build into One Health, especially workforce. But we are limited in coordination. We are limited in having like a governance structure that can put all of us together in one place as stakeholders. For example, when it comes on the continent, do we have that platform? And as Africa CDC, we are looking at ensuring that we have stakeholders a platform that incorporates the different stakeholders, the technical partners, the different leveraging on the Africa Union frameworks.
Yep.
How can we come together?
Yeah.
Another important thing is at the Africa CDC, we have framework for workforce development, and under this we are running different programs, including the Africa Epidemic Service.
Yep.
We have the Kofi Annan Fellowship in leadership, but we also have the youth-led initiatives that we are also running. So through some of these platforms, we believe that we can build a stronger One Health network, a stronger One Health professionals that could go out there into the different ministries of health, different relevant sectors, to be able to move the One Health agenda ahead.
100%. I would like to come back to you here. There's an interesting theme that you touched on regarding youth. A quick question to the audience. By show of hands, how many of us would still regard ourselves to be youthful or young in our minds? Oh, wonderful. Almost all the hands go up. So that's quite telling, right? That we need to prioritize youth and youth development, regardless of how old or how young we feel. But perhaps this is a fantastic opportunity for me to come to you, Dr. Marie-Roseline, just to hear your perspective as well, and maybe building up both between yourself and Kangume representing Africa CDC. You sit at the front line of ensuring that preparedness and, of course, responsiveness is something that's a priority. That speaks to the skills that were highlighted through Constance and Anita, the educational efforts that we hear not only at Tufts University, but through the different fellowships that take place, and most importantly, prioritizing the youth. It is no secret that South Africa, and I guess the continent at large, I beg your pardon, has a very vibrant and youthful population. And unless we channel it accordingly to translate into a demographic dividend, we will be challenged by facing further levels of unemployment. Talk to us about the toolkits you implement through who, but most importantly, how it's also specifically directed to the audience here who are made up of youth.
Thank you so much. So let me start by congratulating the organizers for this important and well-organized conference that bring all those stakeholders together. So it is a very privilege for me to join this conversation, a topic that is really important and related to youth. So how do we transform workforce development into real job in WHO, and how we support a member state to scale up? So let me start by remind a data that shared this morning, I think, by one of the panelists. So 75% of emerging infectious diseases are zoonotics. I think it was said in the room this morning. And they jump from animals to human across ecosystem that are very fragile, you know, like we also said this morning in the room. So in Africa, we have more than, I can say, 60% increase of the outbreak in the last past decade. So that's really the reason why this question, how we develop a workforce, because we need that workforce to respond, because there's no surveillance system, no laboratory system that can run by itself. So we need, even though we have AI nowadays, but we still need a very skilled people. So to address that, WHO in the Quadripartite partnership that has been putting in place, we have developed a lot of tools under the One Health Joint Plan of Action. And I can cite some of the tools. One of them is the Workforce Development Tool. We have the Joint Risk Assessment Tool, the Multi-Sectoral Coordination Tool, the Surveillance and Information Sharing Tools, the Response Preparedness Tool, the Monitoring and Evaluation Tools. Gotcha. And most importantly, we have that competencies for One Health field epidemiology framework. And this morning, one of the ministers mentioned that in his country, they're already implementing the One Health field epidemiology. So this is a very vibrant example that also can train my colleague from the academia how those tools are transforming the workforce across Africa, across the continent. So in when we put those tools together, the example of that minister is one of the powerful examples how those tools become, when they give the competence, they become employment pathway. Yes. Because one of the things when you put in place a field epidemiology training program, you should employ those persons after. Yeah. Those epidemiologists shouldn't be jobless. Yeah. So once you put that program in place, one of the conditions is that those persons become employment of the government. Yep. So this is one of the examples. So now when we talk about the bridging workshop, it is where the One Health job starts, that bridging workshop, because it is one of the rare workshops that bring together 3 different categories of personnel: human health, animal health, environmental. Yes. They sit together. They learn together. Yeah. They identify the gap between each sector, and they put together what they call the roadmap for One Health in their countries. And that roadmap, it is what governing all the countries, not only in Africa, but all over the world. You can see example in America, in Europe, that bridge, I can say workshop bridge, put together those sectors, and they work on together. So how do we now coordinate that? So as my colleague from academia said, WHO globally and also across the continent, we are working with academia in order to create training that not only are training, but training that led to employment pathway that can become graduate training. Yes. You know, so that can have a master's degree on One Health. The same that we have public health, we can now have master's degree in One Health, and those curricula can now be translated into academic curricula that give more power to those persons earning that in order they can seek for job, not only in their country, but all over the world. So 100%. This is one of the examples.
I'll pause it there just a moment for you, because you have highlighted so many key themes that really do echo the sentiments of your colleagues and counterparts. But I also believe, Marie, have also highlighted opportunities that many of us can tap into. And I also want us to understand how we need to be deliberate in these efforts to ensure that it's no longer just about environment, health, and of course, people in isolation. It's about finding the synchronicities and the partnerships that we can establish in in that regard.
So, absolutely.
Frauke, apologies, I'd like to come to Frauke for a minute as we are under pressure. Frauke, I'd like to come to you because much like your peers here on the panel, and of course through their various organizations, you too, through the World Bank, have also implemented your own strategies. As has been highlighted, it's in academia, it's in the professional space regarding environment and health, and of course making sure that right through the full value chain of health, it's a priority. You've taken this approach from an agricultural point of view called AgriConnect. Again, very critical because the population and the countries represented in the room typically have a high population of small-scale informal farmers. Talk to us about not only what AgriConnect is, but most importantly, how this in itself has managed to plug the gap in terms of building a future workforce for One Health. Not yet. Let's turn on the button. There
Yes,
we go.
Okay, now. Well, thank you very much. And I think a lot of what we already heard is playing into what we're trying to achieve with, it's actually a new initiative, AgriConnect. So the past tense that you used, what we've managed to do, is not entirely correct. What we will manage to do, hopefully.
Sure.
So it's kind of something that we've started. And let me put it a little bit in context, you know, that in the coming decades, 1.2 billion young people in developing countries will enter the workforce. So creating jobs for those young people, I mean, that's globally, right, is really, really critical. In addition, the world will also face the need to increase 30% more the food production. So if you look at that, you know, the agri-food system is actually a sector that's urgently needed, you know, to increase its productivity, you know, its operation, but it also can generate a lot of jobs. So we already heard a lot of, you know, and these are not on-farm jobs only, but these are jobs in the food system.
Yep.
So looking at that, you know, that's why AgriConnect was kind of launched to kind of bring the private, the public sector, various players together to think about, you know, what are these gaps and what is needed for specific value chains to actually achieve the job creation and the, you know, increased food production challenge.
Yeah.
Basically, so it's so there will be individual country implementation plans that will be prepared, and then hopefully helping to identify a lot of these capacity needs and other needs to actually build these value chains up further in individual countries. And there's three pillars, core pillars that we will be looking at. So that's strengthening foundation, so that is human capacity, but it is also infrastructure, natural capital. It's revamping policies. A lot of money is actually spent on the agriculture sector, but can it be spent more efficiently?
Yeah.
What policies need to change to do that? And how can policies also help on job creation and capacity building?
Yeah.
And it's capital mobilization, because what we've also hear a lot is about that, you know, the ideas are there, the access to capital and insurance systems is what often hinders, you know, the scaling up of, you know, good potential opportunities that we see. Let me go more to the African context there.
Sure.
If you think there, there's about 10 to 12 million young Africans that enter the labor market every year, but only about 3 million formal jobs are being created. So agriculture value chains, again, are an opportunity to try to create more jobs. And you know, since we're talking One Health and livestock here, sustainable and resilient livestock value chains are an important part of that. If you look at, you know, our kind of discussions on AgriConnect, for a lot of countries, livestock or, you know, selective livestock products are very important value chains.
Yep.
So there's a lot of opportunities in creating jobs if we get these value chains better organized, if we get these value chains better integrated. That means, you know, bringing smallholders together, helping smallholders to actually increase their knowledge and expertise on One Health, on veterinaries, you know, getting better access to veterinary services,
Sure.
better access to advisory services, so that they actually can feed into these growing and, you know, hopefully, you know, more value-enriching value chains. So the One Health integration and interventions have various benefits on these value chains, right? So it's knowledge exchanges across value chains. There's higher demand for skilled and technical workers along the value chains, and there's an expansion of value addition in the country. So that's the idea around AgriConnect, and hopefully it can help all the participating countries to really create more jobs and more skilled jobs in the agribusiness, agri-food sector.
100%. So we're peers, we're understanding that there's new innovations, and we can all actively participate to ensure that it shifts the needle, whether from the various partners and stakeholder groups that we've heard on the panel. But one thing's for certain is that the solutions are there. What we need to do is plug and play, implement them, amend them to meet the needs of your local market. Bundu, I've kept you quiet for too long, Mr. Mutale, and many might actually acknowledge the fact that this is a panel discussion dominated by women, so you are a rose amongst many other roses. Thank you for your time, sir. Your industry is really intriguing to me, and it's one that's perhaps right up my alley, because you live in a world where you connect cities like Kampala, Nairobi, of course, Lusaka, Windhoek, Johannesburg, to the far outskirts and environments and communities that are typically in our rural environments across the continent. There's this beautiful bridge and intersection and connectivity that you have regarding financial services, risk mitigation, and unlocking the capital to essentially protect and preserve and mitigate against any risk that could unfold within the One Health ecosystems of environment, people, and animal. And I think this is important for us to actually reflect on, given the job opportunities that exist there. And of course, highlighting just how far-reaching One Health employment opportunities could be. Maybe share your reflections as someone who didn't typically start off analyzing risk for climate change, but found yourself essentially evolving and pivoting to that space, given your entry to Bula Advisory. Yes, it is on.
Thank you very much, and thank you for highlighting the gender dispersion that's on front row. Yeah, so from Bula Advisors, I think our role, and I'll speak for most of the private sector, is really to be able to design and develop the solutions that really delve into the aspect of resilience. And obviously, because our focus is on scaled solutions, we don't do this alone. I mean, there's a lot of partnerships that we have to onboard and take on, such as with governments that allow us to be able to take out the solutions that we do provide. Also developmental partners such as the World Bank that offer catalytic investment, to be able to allow the vulnerable to be able to be exposed to the solutions that we are providing as a private sector. On today's discussion, I think the dimension we're looking at is on the other side, which is quite interesting for us as well. The process flow of being able to provide these services, I think the implementation aspect and everything brings into play the aspects of data that we have to collect as entities to implement the insurance services. I think from a role point of view, none of these services can be provided without the right platform of data of the farmers or the vulnerables that we are actually serving. And to do this requires us partnering with the youths that are in the communities where they are mostly affected by these vulnerable issues, catastrophic climate change issues. So mainly you look at from the point of building the actual database to be able to offer these services and for these services to trickle down. That requires that you are working with the youth in the rural areas. And now I'm bringing it back not to the graduates, not to who. So our primary focus for us is really the people that are living in the communities. The grade 12 matric people that are a bit exposed to education and can communicate to their communities. So those are the people that we leverage on. And because of what insurance is, it has the potential to be able to provide jobs. I think from our experience as Pula, we've seen that insurance is able to provide 2x jobs per farmer. That's quite very important. I think from projects such as crop insurance that we execute in the most vulnerable drought-prone areas of Southern Africa, to projects such as human-wildlife conflict, I think what's very apparent is that you can never take away the human interface from it, and that human interface brings the ability to create jobs. I think jobs that are meaningful and create an interface and also create knowledge for communities that are uptaking these products. So I think in a nutshell, the products that we do offer as a private sector, I think highly hinge on a leverage between the workforce that's there in the rural communities, as well as the technologies that is created, I think, by the tertiary workforce and all the secondary workforce that lies there.
100%. A very refreshing perspective that you've given us to understand the multiplier effect that actually exists in terms of job creation. And it really builds up beautifully on the themes and concepts that have been shared by your colleagues on the panel. I do want us to gauge with the audience, our youthful audience, if there are any questions just yet. There is a QR code that will appear on screen. It's on my right-hand side. To the audience members who are on my left, we'll make sure that we do get you a QR code. This is for Mentimeter. Much like all the other QR codes you've been scanning, if you click on the link, open up your camera, click on the link, follow through, it will take you through a platform where you can actually ask your question to any of the specific panelists. And this is where we'll be able to direct your questions. So if there are any questions that you have, please put them through Mentimeter. Our only request is that you are very specific around your question and who it is addressed to. The shorter and more concise it is, the easier it is for us to get feedback here. We're going to give that an opportunity just to filter through. I am aware that we will be able to pull through the questions and messages as they do come through. Our colleagues will be able to moderate that in the background. If not, we might find an alternative just in terms of using a handheld mic if necessary. However, there is a theme that I do want us to bring to the conversation just before we wrap up and build on to the follow-up panel discussions that will be taking place. We can't ignore the fact that we've spoken about the fact that we have this beautiful ecosystem to build jobs in One Health. We've got the necessary policies, frameworks, programs, workplace toolkits, partnerships that are being implemented, and most importantly, new sectors of the economy that are also open to understanding why and how One Health can open up more economic opportunities. When it comes to creating jobs of the future for One Health, where does AI or technology fit in? This might not be a fair question, but I do believe that given that we are members of a global community looking for locally relevant solutions, we do need to be cognizant of some of these shifts that are taking place globally. I am keen to throw this question to my colleague at Africa CDC because there are certain initiatives that your organization does run, and earlier speaker did reference this, but it's really a question that's open to the panel if you'd like to share your feedback and perspective. From there, we'll go to the questions that are available from the audience.
Thank you so much.
Mrs. Malion.
Once again, we cannot run away from technology and new innovations that come globally. And as Africa, we also need to be ready to ensure that we move with the rest of the world. And a lot of tools out there that, incorporating AI into our routine work. And the basic example is through modeling, through disease surveillance and all that. So what are the opportunities in there for us as Africa CDC and as a continent? One is for us to ensure that we are ready to welcome and receive these technologies. And this can be done, one, through the policy development to ensure that we have the policy systems and guidelines that will enable us to reach into this technology that comes up. So as the Africa CDC, once again, with a convening power, we believe that the ecosystem is very important, the data ecosystem, through development of data governance structures. Another important role that we look at into these innovations, especially the AI, is for us to be able to incorporate the digital systems into our workforce development infrastructure, our framework, and ensure that the already existing systems are enabled and are interoperable with these, the AI structures if we go into remote disease sensing and surveillance.
Yep.
And we cannot do this without partnerships that are really important. We need to know that whatever we are going to do should be driven by evidence.
100%.
Here is where our academia comes in,
Yep.
so that we do more research on this. We need to work with the private sector,
Yep.
So that we work with the innovative private sector and tap into that blessing that we have on the continent to be able to put up like the different, hubs.
100%.
And we cannot do this also, we have to scale into, our national public health institutes.
Yes.
First of all, by ensuring that we have a workforce that is able to transmit these skills into real practice.
Yep.
So through some of the workforce development framework that we have and the different tracks, we need to ensure that some of these digital tracks that are really focusing on the new tools, especially AI, are also incorporated, and we train this workforce through the already existing courses that we are offering, or fellowships,
100%.
and deploy them into the national public health.
Fantastic. I'll ask you to pause it there because there's a great level of opportunity that you highlighted for academia and many other colleagues to actually share their voice. Professor Helen, we'll come to you. I do just want to start with Dr. Marie. You wanted to add and echo some of your thoughts and sentiment. And then Professor Helen, perhaps you can also just expand your view on technology, leveraging AI and other tools.
Thank you so much. Just to build on what my colleague from Africa CDC said, as you know, from 2007, we have in Africa that surveillance strategy that called IDSR, Integrated Disease and Surveillance. Actually, it is continent-wide in all the countries in Africa. And we build on that data, and we have a partnership now with Google, where we can monitor movement, not only human movement, but also animal movement. Because sometimes, a lot of, conflicts, even the conflict we can monitor are from transhumance. When they don't have enough food for the animals, they have to move from a country to another. So we are also monitor that movement, because actually we have an outbreak of Rift Valley fever in Senegal and Mauritania, and it is due to those movements of animals where they died, and unfortunately, the animal system couldn't cap it early, and we have now more than 500 cases of Rift Valley fever in Senegal, with a CFR, that means a case fatality rate of 15%. That means more than 50% have died in that outbreak. So we are working with AI, so it is a tool that captures AI, and it can send the message to the country to tell the country, we have noticed some animal movement in that region, so we have to be focused on that. So we are really, I think, using that opportunity in order to enhance surveillance and also to have an early detection of those movements, and also so we can early detection of a zoonotic disease.
Yeah. Very important and really critical that we also share that data and information. Thank you so much for that, Dr. Marie. Professor Helen, quite keen to get your thoughts. Academia's positioning when it comes to technology, AI, and partnership, as you've heard, with technology peers.
Okay. I will approach it from a different perspective, because they've already talked about data and how data is being used for AI is being used for surveillance. I just want to give an example of some of the things that we are able to do at community level, how we have engaged communities using AI. And I'll give an example of Sierra Leone, where we have women traders trading in wildlife at the marketplace. Most of the traders are women. We created a system where they would just use a chatbot to be able to communicate with each other. They can be able to get information through the chatbot on the diseases that are coming in from the wildlife, that they can be able to identify which animals are endangered, when they come to them, and they can record and send us that information without anonymously, without feeling that like they're being harassed. The same thing we did in Côte d'Ivoire. In Côte d'Ivoire, the restaurants, all the restaurants and the markets trade in wild meat again. And so creating a system where the restaurant owners came together And through just their WhatsApp, you know, being able to use AI to allow them to communicate with each other, to share information, and then we can take that information and use it to apply, you know, in the field what they need to do.
Yeah.
So those are sort of like simple things that we use at community level. Another example is we have women smallholder livestock farmers in East Africa, and we have animal health service providers. Animal health service providers in those fields can be able to take pictures of their sick animals. They take pictures of their sick animals. It goes into a system where a veterinarian can be able to look at them. If not, they can communicate with each other and say, hey, I have this sick animal. Do you have a similar thing happening? And so creating that system among them, people who are on the ground, allows them to really be able to be part of it. So that AI is not just for us academicians or for other people who are the scientists, but actually anchored in the community. Yes.
And anchored, as you say, practical. And sometimes it's using the simplistic tools that already exist that so many of us have become familiar with. I do want us to just get closing remarks as well from Frauke as well as Mpundu. But in the moment, I am made aware that Mentimeter is not fully functional. So I haven't been able to get through any of your questions. I see my colleagues nodding. Would that be correct? Fantastic. Appreciate your feedback. I do just want to gauge if there are any questions on the floor. We're happy to take at least 2 questions. There's a roving mic that could be made available, and we could address your questions. If not, I'll direct my final 2 questions to Frauke as well. I beg your pardon, as Mpundu. Any questions in the audience? I see your hand, sir. If you could please stand up. It's just easier for my colleagues to identify you with the roving mic. Plus, we've got cameras in the room, so it would be wonderful to get a shot of you. We also any other hands in the audience? Any other hands?
There's one on the other side.
Oh, there's one on the other side. Fantastic. So if you could please be upstanding, it's easier for my colleagues to identify you. We'll take your questions back to back. If you could please keep them short, concise, straight to the point as to who you're asking your question to, and we'll do our best to address it. I'm aware that you might want to add context. However, that just might eat into the time that we have. So please do be brief, short and sharp, and tell us who you are addressing your question to. I heard a mic moving. Have you got the mic on standby already, sir? Fantastic. If we could hand it to the gentleman. We'll start with your question on my right-hand side and then move to the left of the room. You can go ahead first, sir. Yes, sir.
Thank
I'm
you.
looking at you.
My question is directed to CDC. After doing the surveillance, the detection, to what extent do our governments have the capacity to respond? Thank you.
Fantastic. Thank you so much for your question. Noted as well, and we will get to it. Sir, you can go ahead with your question.
Can you hear me?
Not yet. Let's try again. The microphone might not be working too clearly. If we could try the other options you have. If not, please go ahead and try, sir. Project. Between myself and our colleagues, we might be able to hear you. Yes, we can.
Okay. Thank you very much. Unfortunately, my question would be a bit lengthy, as I am trying to address this to Prof from Tufts and CDC, but it might be open to any other panelist. My point here is that as we are talking about shaping future jobs, how come the current One Health only focuses on human, animal, and environmental health? Why is plant health not part of the OH initiative? Are we not missing the intersection of plant, animal, human diseases in the current narrow approach of One Health? For example, take food insecurity.
Got you.
Crop failure leads to malnourished livestock, to reduced cattle feed, to diseases, to bovine TB. Take aflatoxins from seed, transmitted to animals and humans.
100%.
Why are we just ignoring plant health?
Fantastic. Thank you so much, sir. The gist of your question is completely understood, and I do think that we have a fair representation, not only from WHO, but the World Bank as well, who can perhaps share their feedback on that. Let's start with the first question we had regarding Africa CDC, and this one is for you, Ms. Malion. You've got the data, you share the data. How quickly and swiftly do governments act upon receipt of this data and information you share?
Thank you so much. I think I'll put this question into perspective. When we talk about response, it will also depend on the resources that are available to us. and the entire ecosystem that is at stake. So our role as Africa CDC is not only to detect and provide the landscape for the countries to do early detection and response public health threats, but to also give capacity building for our member states through different capacity buildings, one through infrastructure, but also the human resource capacity building when it comes to, for example, disease detection. We are deploying a lot of efforts in our member states, including the event-based surveillance system, as well as event management system.
Got you.
But also working with the different stakeholders. And in this case, our long-standing World Health Organization, which is mandated to strengthen our capacities and as well look at implementation of the IHR.
Sure.
So when it comes to country, capacity to respond, I think it's, like a very big question that we all need to look at. We capacitate them through, the different partners that are already on the ground that work with our member states to be able to respond. But also, as Africa CDC, we have the ready deployable workforce that go to these countries to be able to work with them, to walk through them in terms of responding to some of the public health threats.
Got you.
And this one is very, open to most of our public health professionals out there.
Yeah.
So it's like it's a volunteer program.
Got you.
That we readily deploy.
Got you.
Yes, but there are also other more
themes, and what I'm recognizing, and I'm hoping that you are satisfied by the response survey. If anything, we can tell that it's multi-layered. And of course, we need to ensure that there are further interventions to make sure that through collaborative efforts, there are quicker, more appropriate responses that we do see to any health concerns that might happen, not only per country, but also this is why the conversation matters for us to have it as a region, to make sure through collaborative efforts, perhaps that's where we can build up on some efforts.
Can I quickly add something to that?
Go ahead, Dr. Helen.
I think we also have to acknowledge that we've come a very long way with response to like pandemics and things like that. And I'm going to give an example of Uganda. In 2012, there was an Ebola outbreak in Uganda. I think it took them more than 3 months to control it and respond. In 2022, there was an outbreak, and within less than 1 month, they already had it under control. So different African countries with prevention in mind, detection and response have actually come a long way. We just need to be able to build those systems better, but some of those systems are really working. So I wouldn't say that there isn't much happening, there's a lot happening, and we just need to continue building on those systems.
Fantastic. I would like to address the second question, which also was directed to you, but I'm Professor Helen, but also happy to get it from Dr. Frauke, if you can respond. The lack of inclusion of plant life in One Health. I know this must have been an ongoing conversation, but just your response to plant life in One Health.
In One Health.
Why are we leaving it out?
I can say that One Health has evolved. When it started at the beginning, we were talking about human, animal, and environment. Actually, right now, plant health is a big part of that. At the same time, it's not that just that. One Health is a holistic approach. So we are not just talking about human, animal, environment. We were talking about energy, we are talking about urban planning, we are talking about life on land and ecosystems. And so it's this holistic approach that really includes everyone. Economists, we're talking about health. So I would like to say that it might look like plant health is not, but it is really a key part of the evolution of One Health going forward,
100%. Dr. Frauke, would you like to respond very briefly? There we go.
Yes, I want to. No, let me say a few things, I think, on the various aspects. So maybe let me start with the plant side. From our perspective, I agree, it is kind of embedded, but it is anyway embedded in good animal practices, right? And this is something that if we're looking on the livestock value chain, that is very, very important, right? The better you feed your animal, the healthier your feed is, the better, more productive your animal is. But also the more you're reducing risks of disease transmission. So I think it's embedded in this entire. Even if you just talk livestock, it's very much embedded. I also wanted to make a comment on the technology side,
yes,
because I think there's two elements to that: the AI and technology. So on the one hand, since we started talking about jobs and different skills, so it's a real opportunity for skills development, and we've heard what has already been happening on developing those skills for young people to come on board and really be productive to kind of shape these value chains and the evolving landscape and bring these new technologies in. But there's also another element, I think, where the technologies really can help with bringing we've said, how can smallholder farmers be linked? And often the problem is it's so costly to do that because they're so widespread. Well, technology can be a tool to bring this information and better practices, extension services, even veterinary advice closer to these smallholders. So it is also a tool to really try to assure that more integration is happening.
Yep.
We just have to make sure we're really embedding it in all of the vision and the strategy going forward, so that the tools are there. They have to be used. And sometimes I think the challenge is also maybe there's too many tools. So which one and how do you integrate them best into the strategies and policies?
100%. Integration of tools, adequately using them within the right context and circumstances. But one thing is clear is that technology is a key enabler. When it comes to the theme and concept of One Health, it is quite clear that it's fully inclusive of the various aspects as well that we do need to prioritize, and rightfully so. Perhaps a nuance can be placed on the various contributing factors into the interconnectedness of animal, people, plant, and of course the environment. But there's something peculiar that I do want to tie this back to, especially when we talk about creation of jobs. We've highlighted that we've got the necessary toolkits, we're implementing policies, we've got the training and capacity, we're ensuring that we're implementing this. But one thing's clearer is that this conversation, in order to broaden the scope of work, ensure that youth are also employed, we do need to ensure that other sectors of the economy are involved and understand the nuance and importance of this. Mr. Mutale, this is where I come to you. Again, I've kept you quiet for too long, but I'm hoping that you can give us our parting shot for today. You get to interact quite literally with all key stakeholders, from development institutions to, of course, understanding health organizations and industry bodies, academia, and, of course, the entrepreneurs, the farmers, and the people themselves who are plagued and faced by climate challenges. I'm quite keen to understand, as a leader in the private sector, which often gets viewed as just being in it for profit, how do you want to share a message with key stakeholders within the ecosystem to highlight the level of participation they need with private sector participants like you? So in other words, how do we build up on this level of camaraderie we've created to make sure that there quite literally is a multiplier effect in the next 5-10 years?
Yeah, thanks for that. So I think in most cases, when we view the efforts that we do put in terms of insurance, it's really thought of in terms of the response, the back end kind of implementation. But I think of late, which is a quite positive thing, we've seen that it's been taken up in a more preparatory approach, where I think governments and everybody who's involved with working with economies and the vulnerables at scale is looking at insurance as something that is ideally has to be embedded from the forefront, and is quite important in each and every aspect of a project or implementation of any social activity, because it quite ultimately provides that social safety net, not only at sovereign state, but also at household state, basically protecting the incomes of the household. So I think the driving factor to all this, I think, is having a pillar in terms of partnerships and in terms of synergies being built between the private sectors in terms of the provision of these products, the government being able to create the right environment in terms of the policies, the frameworks that are there, the projects as well. I think we've seen that in ideally some of the countries that we work in. I think Zambia is a very good example, clear example of that. I think Mozambique, Kenya, they've taken a different approach. And also in understanding what is the actual need of the population and the people. That's quite vital. I know there's been a lot of push towards finding solutions that work for a particular country. Like he said, what we've noticed from the past is that he was saying crop is possibly something that's been put aside. But I think we like to view it as a country-specific approach where we've seen Zambia, for instance, the priority has been in terms of finding solution towards the crop because that's a primary sector that's here. You find in Kenya there's a lot of drive towards human-wildlife conflict because that's what's sort of the driving sector on that side as well. Apart from agriculture, they're still trying to find solutions there. So I think the standing point in all this, what stands in the middle of it, is just the synergies that have to be built in order for the solutions that are being provided by the private sector to be able to thrive in a sector.
100%. With that said, I trust that we all understand what is in the toolkit to make sure that we shift the needle going forward. So at the next time we meet for a conference of this nature, the room is triple the size, as we would have created more jobs, more industry experts, more peers and partners in different fields of our environment to ensure that we're all actively contributing to the new jobs that can be implemented on the back of One Health. Thank you to each and every one of you for your feedback, giving us some insight from academia, of course, Professor Helen, Mr. Mutumbi, Mr. Mutale, I beg your pardon. Let me try that again. Mr. Mutale giving us some insight. Dr. Frauke, of course, Dr. Marie, and Ms. Malion giving us some feedback as well from Africa CDC. Thank you very much to each of you as panelists. Please give them a round of applause as we make our way off stage. Thank you very much to our panelists, and of course they will be available to interact, for you to pose your questions, and maybe even look to partner with them in some of the suggestions that they have shared. But one thing is for certain is that when it comes to One Health jobs of the future, we are on the right track in making it happen. We're going to actively participate, ladies and gentlemen, in continuing with the remainder of the program. I do want to encourage you to stay with us in the room throughout the course of the next 2 hours. Not only do we have a follow-up panel discussion that will take place, one that will give us some insight into clear ways as to how we can use and implement circular themes within the food economy, but we'll also have a few more entrepreneurs who will give us some insight into how best they are meeting the solutions that we have. Outside of that, we're also going to build up on key themes regarding economic resilience. That is a panel discussion that will also take place closer to the end of the day to make sure that whilst we're prioritizing One Health, all of us as peers are essentially seeing the necessary economic success that we require. As you can imagine, we've got time now to make sure that we actively engage with the innovators and entrepreneurs who are part of the marketplace. My colleague has made her way to the front row of the room to count us down and, of course, help us introduce the various entrepreneurs who will be sharing their innovations. As this takes place, we are going to make sure that we do have a clear timer for our entrepreneurs and, of course, innovators. A reminder, you can interact and meet the innovators at their respective stalls that is outside within the exhibition stall and area. We're going to move on to our first entrepreneur who's going to give us some insight into their innovation. I'm going to welcome her to the front of the stage before we count it down. So if you could please welcome Ms. Mediatrice Wangi-Gira. Miss Mediatrice, let me get this right. There's nothing. Miss Mediatrice, oh, now your name has gone past. But helping us understand more perspective around the importance of One Life, One Health for kids, we're going to hear more details and insight into this particular innovation, and it's going to help us get a better perspective of One Health for kids. Miss Mediatrice Wangi-Gira Akin Ojo. Please give her a warm welcome before we let her go. My colleague We'll count you down with a 3-minute timer, 3 separate sheets of paper. As soon as she stands up, she will say stop, and that does mean that our time would have run out. On that note, thank you. Microphones are in place. Ms. Mediatrice, your 3 minutes starts now.
Imagine, over 7 million lives were lost to COVID-19 worldwide. Now ask yourself, how many of these lives could have been saved if the younger generation understood how pathogens spread from animal or environment to people? What if they had the skill to spot early warning signs, protect their communities, and even stop transmission before they began? One Health for Kids is preparing the next generation of One Health champions to have those critical skills. One Health for Kids is a fun, hands-on, after-school program that transforms children and teens into informed, responsible citizens. We have established One Health clubs in 15 schools across Rwanda. Teachers and university volunteers have been trained as club facilitators. Through interactive lessons, children learn how to prevent zoonotic diseases, encourage reporting sick animals, and even help reduce risky behaviors. Our program promotes hygiene and hand washing. Students create posters, skits, and songs. They even teach their peers and families about disease prevention. The results? One Health for Kids is changing how students think. Our students are empowered to take real ownership. They lead community projects like planting vegetables that feed students, more than 1,000 students in their schools. School administrators have reported increased classroom engagement, improved academic performance, and fewer absences due to improved health. We are building a pipeline of future One Health leaders equipped with collaboration, creativity, and problem-solving skills. We are investing in our children today to build a stronger and safer Africa. We are now ready to scale. With a partnership, investment, we aim to reach 10% of Africa's 620,000 primary and secondary schools. So together, we can empower millions of young people to protect the lives of our planet and everyone on it. Thank you.
Thank you so much, Media. Right on time, and of course, making sure that you meet the timeline that we have. Our next entrepreneur who will be joining us to help share some perspective is Professor Carlos Eduardo. He joins us from Communicating One Health Through Science, Art and Society. Professor Carlos, a round of applause, please, as we encourage him before his presentation. Okay. Fantastic. My colleague is with us, and of course, we'll count you down. You're comfortable? You're ready?
Yes.
Your 3 minutes starts now.
Okay, thank you very much. My innovation is about health communication on health, and we have decided to use the community theater to raise awareness about zoonotic disease using One Health perspective. This can assure you that as a result, it has been shown as the best cultural and contextually appropriate methods to raise awareness among different communities levels, including children, adults, and other stakeholders within the community. This proposal comes into a moment where we have noticed that in Mozambique, as in most African countries, we have been using what we call traditional methods of raising awareness about health, mainly, for instance, pamphlets and also posters, using a language that local communities do not understand at all. Moreover, most of these traditional methods have used top-down community and so on. So we came together with different people, communities, researchers, and also artists to build upon theater play about One Health. In this theater plays, we raise awareness about rabies, about, for instance, bovine tuberculosis within the communities. And definitely, because of this approach that we are using, most community members have already have knowledge about One Health. They're already engaging themselves in protecting against zoonotic diseases, and it has achieved good results. And as such, I can assure you that investing in community theater, it's really a very important and contextualized, appropriated, and culturally approach that can reach sustainable awareness within the community. Thank you very much.
Muito obrigada, and thank you so much for your presentation there, Professor Eduardo. My colleague Njoki has been keeping us counting down, and so far it seems as though all of us are within that 3-minute time frame that is a priority. Our next speaker is Michelle Francis Padeachi, who joins us to tell us more about GS1 Digital Trust Bridge, verified product identification for safer food and medicine in Africa. Please give her a round of applause. This is where we're going to learn more about the art of all things to do with barcodes and tracking and tracing. So, you're comfortable, you're ready, the mic is in the right position?
Thank you.
Fantastic.
Thank you, Gugu.
Your
beautiful
3 minutes.
fellow South African.
Indeed. Your 3 minutes starts now.
So thank you to this opportunity and to be in front of incredible leaders. We want to tell you a story of the problem today. Across too many families in Africa, they still face many painful questions. Is the medicine safe? Is the water we drink good to go? Is the food real? Will it heal or will it harm? Counterfeit medicine, unsafe food, stockouts, and weak traceability hurt not only our people, but also the animals that we've heard, farmers, the environment, and our economies. When trust is broken in our health and food systems, lives are lost quietly. Communities lose confidence. Africa is the least harmonized regulatory identification and tracking systems. That's the reason why we can't achieve World Health Organization level 4 maturity, to say that is less substandard and falsified medicines hitting our countries and our continent. How are we looking after our demographic dividend, our youth population on the African continent, when we can't assure that the products that move across our borders to keep us well is identified correctly? This is what the Verified by Trust digital innovation is all about. How can this digital trust platform help? GS1 gives every product a unique identity. Look at the bottle of water. It has a unique GS1 barcode on it. It's a trusted identity and relies on everyone here, not just GS1. I saw solutions using traceability standards. We don't have the systems. You have the systems to make sure that foundation is bedded in every scan across the world. It's more than 10 billion beeps, more than Google searches every day that uses the standard, and we are so unknown on the African continent. It allows a trace of product from factory to shelf with one shared global language. Today, a powerful breakthrough makes us even more accessible. On the 20th of November, Google and GS1 made this data metric that is part of your regulatory authorities to say that every product must be marked with a 2D data metric. I don't need a special app. Open up Google Lens, and it's going to take you to a leaflet, a patient leaflet of your choice and your language. It's going to take you to a trusted owner of who owns that product. That is foundational. Now, a nurse can verify a vaccine. A mother can trust the medicine she gives her child. A farmer can protect their livestock. A regulator can act faster and recall, and a country can protect its people and confidence. GS1 is not just a standard, it's a promise of trust for Africa's future. And we really want this identity to be embraced by allowing us to have better investment, collaboration, and education. Thank you.
But thank you so much. And yes, amazing innovations that are being shared currently by all our entrepreneurs and, of course, innovators so far that we need to be cognizant of. And I do want us to build up on many of these themes because they do help us fully understand and comprehend just how best it is that we take these conversations and themes going forward. Whether it's scanning through barcodes to track and trace, understanding the innovations that exist when it comes to testing of products and tools, of course, making sure that from an ergonomic point of view, there's ongoing support that we prioritize, and, of course, partnerships that we can leverage on. Well, ladies and gentlemen, we're going to build up on these themes in just a moment with a panel discussion, but perhaps before we do get there, I do want to enlighten you to the fact that we will participate in 2 panel discussions. One that will certainly give us an overview of understanding how we build up and include the circular economy within this ecosystem and landscape. We'll then follow up with another panel discussion that will give us some insight into leveraging and building on trade. And we don't need to talk about what happens in many other markets. We need to prioritize the level of trade and partnership that we can establish here. So these are some of the themes that will be discussed and, of course, moderated by my peers and colleagues and many of your industry associates that you are familiar with. Before we do get started, though, typically one thing does happen after we have lunch. Our energy levels drop. We get tired. Perhaps the coffee from this morning has filtered out. So if I may respectfully ask you each, ladies and gentlemen, to please be upstanding. Just for 2 minutes, we're going to take an opportunity just to reinvigorate some of the energy in the room. For the moment, I'm probably going to practice being your aerobics instructor. I can't promise that I've done this before, but perhaps if we could just shake out our arms as we are upstanding. To those who are still seated, this is where we say, get up, get up, get up. Right? Your neck around, move your neck around. I hope I'm doing this right. For all the physiologists in the room, you're happy to correct me. Perhaps move your shoulders around as well. Right? Move your elbows out as well. And now give me 10 jumping jacks. Well, if you can, we'd appreciate it. But thank you so much, ladies and gentlemen, as we just make sure that we get our energy going again to get ready for the next panel discussion and, of course, the participants who are with us. And maybe on that note, no jumping jacks, but a round of applause to make sure we're still awake. Fantastic. I'm going to do one more thing, and this is potentially me breaking the rules, but I think my colleagues will allow me. Each of you have a mic on your table, don't you? Yes, no? Fantastic. If I can ask this table, ma'am, since the mic is in your hand, if you could please stand up, tell us what you've learned so far throughout the conference, some interesting insights. One sentence, one word, it's not complicated. What have you learned? And your name is, if I may? Dr. Kabetswe Ngube from the homegirl from the University of Johannesburg in South Africa. Dr. Ngube, if you could give us a brief explanation of what you've learned so far, what you've enjoyed so far from the conference.
What I've enjoyed so far. Good afternoon, everyone. What I've learned and enjoyed so far is seeing how all the countries and everyone in the room is working together to break the silos. And that has been a major challenge in the past.
Fantastic. Thank you so much, Dr. Ngube. Appreciate it. We'll touch base back home. I'll ask you, how are you moving this and changing it and implementing it going forward? Thank you so much. I'll come to this table over here where everyone's avoiding eye contact. Have you got a microphone? If not, we'll get you a microphone. Have you got a microphone? No microphone. We'll find one. It's not impossible. And maybe if I can come to you, ma'am. Is it on? There we go. If you could just tell us what you've learned so far. Such a pleasure.
Thank you. Thank you, Kuku. What I've learned so far is that we all have the same purpose.
Yes.
We all are working on the same direction. So we might divert, it might just all come back together.
Yes.
So I'm hoping this conference, the call to action is like, how do we really make it work?
Yes.
We have seen so many solutions that have been presented. Let's be powerful, let's be bold as Africans and take this charge for ourselves.
100%. Zinhle Chikwe joining us. Thank you so much. Of GS1 and, of course, building up on the innovations. We all have the same prospects and direction and opportunities that we need to be mindful of. Everyone's avoiding eye contact, except for you. I'll ask for your feedback. Then I'll make my way to the other side of the room, so don't believe that you've been spared. We're all here to interact and engage. Ma'am, if you could go ahead. Your name, please, if I...
My name is Priska Mugabe.
Fantastic. Ms. Priska Mugabe joining us. Yes, I recall you signed in the commitment from
Yes.
Zimbabwe.
I wrote this down when we were having the opening remarks from AU. They said One Health truly resonates with the spirit of Ubuntu.
Ah, fantastic. Short, sweet, to the point. Thank you so much, ma'am. Ma'am Mugabe, they're giving us her feedback. A round of applause for her, please. I'm so tempted to come to the other side of the audience, but you know what? I've been told we'll save that for a little later. So we will come back to the left-hand side of the room just to build up on the feedback and perspective that many of you have to share with us. This is critical because fundamentally it's what we're here for, to network, to engage, to make sure that we're able to build up on the solutions that we're learning, and by the time we get back home, to our various countries and cities in the upcoming weeks, we'll be able to implement these going forward. So that remains pertinent and important. On that note, I'm getting ready to introduce our next panelists and panel discussion. This is a panel discussion that will be moderated by a key leader from the World Bank Group, who plays a critical role in highlighting, testing, and shifting the narrative for us to think outside the box when it comes to understanding how we can implement circular and preventative pathways. Consider the circular economy, consider how best it is that we can prioritize aspects and avenues of ensuring that recycling, reuse, repurposing can be prioritized. And how does that speak to the world of prevention? Well, she'll be joined by 3 panelists in conversation to help her with this discussion. There will be an opportunity for Q&A, if I'm not mistaken, but we'll follow the lead of the moderator in this particular conversation. This conversation will be led by Dorte Werner, lead agriculture economist at the World Bank Group. If we could please give her a round of applause. Dorte will be joined by the Director General for National Health for the National Institute of Agricultural Science in South Korea, Hee-sun Bang. Please give him a round of applause. Her a round of applause. Rodrigo Caldorian, Reploid Group representing Australia. A round of applause, please, for Rodrigo. Followed by Reneth Mano, Livestock and Meat Advisory Council from Zimbabwe. A round of applause, please, for all the panelists. Dorte, it's over to you.
What if I told you it's possible to make everybody healthy on the planet? All people, all animal, all plants. You might say it's a dream. But there are some magic bullets out there, and we're going to share one of them with you. There are untapped potential for producing nutritious food without running down the remaining standing tropical forest. It's even possible to reduce food insecurity and hopefully alleviate it. And what we're going to show you that is a way that's not going to take up more arable land and is not going to use any water. And it's going to create climate resilience jobs on the way that we learned from the last session is so needed. We also learned from the last session that soil health needs to be improved for the plant. We can take care of that too. This is an innovation, a circularity way of using something that we just waste and turning it into something that is truly a magic bullet. Per capita food production in Africa has been falling since 2014. That means that food security has also been increasing, unfortunately. And it's the people living in countries that are affected by conflict and war that are most affected by this food insecurity and lack of access to food. 29% of the people living in FCV countries are acute food insecure, compared to 18% in non-FCV countries. Business as usual is not a way forward. We need to transform the food system, and it needs to be done from now on before we will see any changes that probably take about a decade to do. New disruptive technologies, such as insect farming, hydroponic farming, such as fermentation, algae, can increase the access to nutritious protein-rich foods and increase food security. Globally, we need to move away from the linear production model that you see, where we waste a lot of stuff. A lot of waste is being wasted, as you will see, as we move along in this presentation. And we need to move towards a circular economy, where we don't waste anything. We reuse everything and put it to really good use. Insect farming is part of a promising menu of solutions to strengthen the food system, as it does three things. It not only strengthens the food security, but it also provides more nutritious food. It creates climate-resilient livelihoods and jobs and incomes from the farm and all the way up the value chain that we heard about in the AgriConnect presented by Frauke in the previous presentation. And then it reduces the agricultural footprint on the planet. We were also learning about climate change in the last session. And this innovation can also take care of part of that. I've had the privilege to share a nutrition-rich meal with many people across the planet. There's a market for these meals. In Zimbabwe, I learned that 90% of the population eats insects. They're nutritious and delicious. In South Korea, I learned that insect powder can be a super delicious ingredient in salad dressings. And let me mention the desserts. They were outstanding when they got a little bit of protein from the insect powders. In Chhattisgarh, India, I learned that red weaver ant can be some of the most amazing meals we can have. I really enjoyed the red weaver ant paste with my rice. But trust me, it wasn't easy because the ants were running out of the pan. So sometimes you have to work hard, even when it's small animals we're dealing with. Globally, about 2 billion people eat insects, some on a regular basis and some as snacks. But that doesn't matter. It's super nutritious and it's super good for our gut health. There's a market for insects. And as we have learned from Barclays Investment Bank, they have calculated by 2030, it's an $8 billion business. And honestly, I think, based on what I have seen in Africa, it's the only sector that I can literally say is increasing and popping like popcorn. Every day there's a new insect farm standing up. For example, in Malawi, when I went the first time 2 years ago, there wasn't many, if any. And my colleague Time and his team there have started a WhatsApp group. Now there's 288 as of yesterday. 288 farms just in Malawi producing insects. Insects are delicious and nutritious. They're a source of high quality protein, 9 amino acids, calcium, zinc, potassium, iron, all micronutrients that children, pregnant women, and we all really need. Adding just 5 grams of insect protein to a diet every day can alleviate a child's risk of folate, zinc, and B12 deficiency. 5 grams is not much. Think about it. Also, insect protein provide incredible recovery properties when people are sick because it helps in our guts. And a lot of the research that we have learned from Korea, including the cancer research, show that people recover faster. And even they can take higher levels of radiation and will recover. Also, it benefits the gut health of the animals. So animals no longer need the antibiotics. And what's not to love? Some of the antibiotics that is left in the animals that people eat is no longer there. Plus, of course, farmers save on the vet bills because the animals are healthier. Again, it has to do with gut health. And also plant. By giving plants the frass, which is basically the insect manure, plants also become more resilient. So that the farmers don't need to buy as many pesticides. So that's why I say it's kind of a magic bullet. But don't take my word for it. There are free risks with the way that many insects are being consumed right now. Because most insects on the planet are collected in the wild. So what does that mean? That means, as we know, insects are not available all year round. In my countries, there's very few mosquitoes with the snow, for example. So insects are available only a few months a year. Like Mopama worms in Zimbabwe, we're talking about 4 months a year. Also, by collecting them in the wild, we run the risk of over-harvesting insects, meaning that ecosystem services that insect provides, they will no longer be providing. And finally, we should not forget the food safety. Because I have seen insects, I've seen cricket in Mexico eating off the corn that have just been sprayed by dangerous pesticides. And nobody thinks about the insects and checking them if we should wait a little to eat them. No, we wait a little to eat the corn, right? So that's the dangers. By farming insects, we move away from all these problems. Because we will have all year-round supply, we have control of what they're being fed. We can raise insects like other livestock. Insect is kind of a micro-livestock. That just, we have many more in a bucket than we can of other animals. But these insects have 20 times less greenhouse gas emissions per kilo of edible protein than other animals. Globally, we eat about 2,100 different insects. Africans consume roughly 25% of these, but we only farm 20 species. I know, this is pretty good, 20 species in adding on to the ones we already produce. Can you remember roughly how many we actually produce? Yeah, it's around that number, right? Maybe it's 30. So now we're all of a sudden producing 50. We collected data in Africa, in 13 countries, to learn about these insect farms. And we found that existed 850. And every year we see the number going up. But maybe not everybody wants to eat a burger that is made of mealworm. What if we fed them to animals? So we fed them their favorite food. I think we have all seen chickens looking for worms in the backyard. Today, we feed fish to fish. The wild-caught fish, for example, from Peru, is being used to feed farmed fish. And it's a third of the global fish catch that we feed to farmed fish. And soy needs a lot of arable land to grow. That's another protein that is very prevalent in the food sector. But we can substitute fish protein and soy protein with black soldier fly protein. And by doing that, the farmers that we have worked with and the research that has been undertaken shows that the price of eggs doubles, the price of pigs that have been fed black soldier fly go to market in 5 months instead of 7 months. Plus, when they get to the market, they get a price that is between 100 and 120% higher because they have broader shoulder and they're leaner. And then remember, they don't have the pesticides. They have not had the pesticides, antibiotics that we have seen before. So what does an insect farm look like? Black soldier fly farm crates can be stacked on top of each other. There's love nest, and these are some of the main ingredients of an insect farm. How long does it take to produce a batch of black soldier flies? It's very fast. It's a couple of weeks. We know it takes a while to produce a ton of soy and to raise other livestock. So in the country where we did the surveys, we found that already in Africa there's produced 16 different species. Mealworm, cricket, and black soldier flies are the most commonly produced insects. And 81% of the insects that are being produced in Africa is for human food. So what do insects eat? Insects can be fed organic waste. So household waste, brewery waste, agricultural waste. And when the larvae grow big, we get two main things. We get protein, we get the larvae, and we get the frass, which is an organic fertilizer. We can process the insect even further and get oil, and some of the micronutrients, the chitin, which is basically the fiber. We can eat the larvae. I have had a black soldier fly Coke in Japan. It was delicious. I have black soldier fly ice cream in Africa. I loved it. Anybody loves ice cream, really. And we can also feed them to fish and to chickens, to pigs that people eat. And then people, they have some of it as waste, and voila, we can give it back to the black soldier fly. So there's no waste we are wasting. And actually, the waste we are wasting right now can be collected and fed to the black soldier flies. And in this process, we create jobs along the whole value chain. We would use the greenhouse gas emissions. If this waste is just being put in landfill, it gives off methane, and voila, we internalize, we mitigate climate change also in this process. Raise your hand if you know your weight. How much do you weigh? Oh, roughly. Forget the lunch break. Just roughly. Good. So imagine for a second you are a black soldier fly larvae. That means that you would have to eat 3 times your weight today. You don't have time to sit here. You will be out in the buffet. Because honestly, 3 times our weight, that's a ferocious appetite, right? But this is why they can be produced so quickly. So what does it need in terms of structure? This graph picture show a representation of the value chain and costs of edible insect farms. And we can see many of these components already exist for other animals, but not everywhere for insects. Insect farming is mainly determined by the cost of labor and the cost of waste. So please remember that if you're transporting waste across countries, it can be a very expensive business. But if you put your plant next to a brewery where you get the spent grain from the brewery, there's not high costs. But there is one country example I would like to share with you today, and that's Korea. Korea has simply been so impressive because they have really done everything that is needed as of this slide here. I will pass the mic to Dr. Bang. Thank you.
Can I use this one also? No?
Can we turn on this mic? Please, can we turn on this mic?
It's on.
Okay.
Yeah. Hi, everyone. Thank you for joining. Today, I briefly introduce Korea's insect industry, our history, our system, and partnership with Africa. I'd like to introduce some reasons why the insect industry in Korea was able to develop. First, Korea has been raising insects for thousands of years, especially silkworm, giving us a historical and cultural foundation. Second, government leadership, such as in policy, RDA funding, and technology transfer, is driving the growth of our insect industry. Last, the Rural Development Administration, my office, RDA, works very closely with the insect-related association and farmers. Korea has a science-based approval system for insect as food. Whenever a new species is proposed, we checked nutrient, contaminant, toxicity, and safety. Normally, it takes for 3 to 5 years. Currently, 9 insect species are officially approved as food ingredient. Nowadays, we focused on a research that insects may have medical and functional potentials. In a clinical trial with 100 cancer patients, 2 months of mealworm intake improved immune system cell activity by almost 70% increased. Studies have suggested prevent effective related to Parkinson's, cancer, and Alzheimer's. Research is now expanding insect from food to medifood. We also support farmers with guidebooks on rearing techniques and disease management. And to improve public awareness, we organized activity like children's foster contest and edible insect cooking events. Thanks to these combined efforts, the industry has grown rapidly. From 2017 to 2024, farm income increased 153%. And over the same period, the number of farmers grew by 138%. Internationally, our COPIA Center in Zimbabwe developed a black source fly feed for native chickens, now contributing to farmer income. We plan to expand these partnerships across Africa. This last slide. To wrap up, I would like to say and insist, insect is not just for future food. They are practical and sustainable solution, both Korea and Africa. And I truly believe that if we together, we can achieve even more with the insect. Thank you very much.
So we have learned from Korea that insect farming is a good investment. It is also a good investment in many other places. For example, in Ghana, an insect farmer paid back the whole investment in 127 days. I don't know how many other industries that you can invest and you pay everything off within a year. Now we're going to hear from Zimbabwe about their struggles and how far they have come in terms of insect farming.
Thank you. I'm standing here in partnership with Chinoi. Okay, thank you, Chinoi, University of Technology. Your nearest neighbor, Zambians, it's the University of Zambia in Zimbabwe. You can learn quite a lot about insect farming. They are the leaders there. Today, I'm not talking about insect farming. Africans don't need a lesson on insect farming. Today is the beginning week, I think, in Botswana of Mopani worm harvesting season. Delicious, isn't it? Am I lying? Right, your president is probably inaugurating and cutting a ribbon to start that process. We eat Mopani worms, maklimbi, throughout Southern Africa. We eat flying ants, we eat things. But insect farming is a technology that we learned from our chickens. So 5 reasons why African black soldier fly village business models will succeed where others have failed. There are, this week, this month, some unicorn projects on insect farming, unfortunately, have folded in Europe and elsewhere. Here is a confidence vote that in Africa they will succeed. First is because of our people. Our people are observant. They watch their poultry chicken, spending most of their time in the pen where we keep our cattle overnight. And they learn that delicious things come from there. We started doing poultry 3000 DC, before Christ, in Africa. Since then, there's been a symbiotic partnership between our cattle, our people, and our indigenous poultry. We now have more than 400 million in Africa raised by indigenous people. The people and their culture, they don't fear insects. They incorporate them in their diets and the diets of the animals. They are an important component of our circular economy. Because of our people and our culture and their observations, we will succeed in the business of insect farming for feed and for food. People are aware of the cost of raising food in Africa. We import our fertilizer from afar to produce our grain. We import our soya meal from afar to convert into our stock feed to feed all our animals. These two components make our feed and food very expensive. Africa, we have a solution to reduce that bill while increasing food security. Because our people have already shown that by integrating African wisdom and science, we can reduce the cost of food and feed. We can defeat protein insecurity in our children by incorporating a lower cost of feed, integrating the feed from our insects. We are integrating this because of the hunger that Africans face. You have heard of the hunger for food. I'm talking of the hunger and thirsting for knowledge that our village women, as you see there in the Chinhoyi University of Technology, thirsting for technological and science evidence that their thinking and wisdom of what the solution rests in their village and within their kraals, are learning and translating the scientific knowledge of farming insects as a business into a solution to one of the biggest challenges that they were facing, reducing the cost of feed, reducing the cost of fertilizer, to make food available, affordable, and raise a healthy next generation of people. Hunger is one of the reasons why Africa will be the epicenter of successful black soldier fly business models. The village business models will thrive because the people want it, because it's a technology not imported, but one that is developed by their chickens, as they visit the crop pen every day. Village science, technology. In Africa, at universities, we have seen our governments establish agricultural innovation hubs, not to import technologies, but to equip and weaponize the knowledge of science, combine it with the African village wisdom to convert and find important solutions to African problems from African scientists. Partnering African women in the village, we have first-hand account of the problems they are trying to solve, where important solutions have not yet worked, and they continue to fail the African women who bear the burden of raising their children and budgeting with very little to feed their children every day. So the solution that have come to being is that one of farming insects for feed, to feed their poultry, to feed their animals, to feed their kids in a secular economy. Markets. African markets are expanding, they are getting bigger, they are getting deeper. With the free trade, we know we can produce more indigenous chickens together and alongside the hybrid broilers and layers, just like Zambians are now doing, Zimbabweans and South Africans are our leaders. But we will do it at a lower cost when we consider reducing the cost of feed, particularly soya meal, integrating our black soldier fly into the market. The food waste has become a new gold mine. The key challenge is how do we combine the two? Yeah, this institution produces probably a ton of food waste every day. How can University of Zambia next door convert this into a solution? These are the solutions we are finding through the partnership with communities and women. Food security is not about importation anymore, because in Africa we are also looking for food sovereignty. And that begins in the village, where we first saw, as we grow up, our chicken finding the solutions in the cattle pen. Thank you.
Okay, so what are the potentials for Africa? We need jobs, we need livelihoods. So just assume we take organic waste from the top 10 agricultural countries in Washington. We take 30% of the waste from the top 5 crops and feed them to black soldier flies. How many jobs, how much protein would that generate? So we're talking about 200 million tons of recycled crop waste, and we would get 6 million tons of biofertilizer. We would get 6 million tons of BSF protein and we will get roughly 15 million jobs along the value chain. Plus, remember there's a climate impact. We will reduce greenhouse gas emission equivalent to taking 18 million cars off the road a year. The World Bank, we have been doing this for a while. We have taken it 4 stages. We did a report. The QR code is there. We have done pilots. And now we're at the situation we are ready to stand and to roll out and do things at bigger scale. And I would like to invite Rodrigo just to spend 2 minutes on explaining the scaling, how it can be done.
Thank you, Dorta. After hearing about the challenges around feed, fertilizer, and food security, I want to show you a very practical solution that's already working today and the opportunity it creates. Across many regions, feed and fertilizer are heavily imported. and large volumes of organic residues remain unused and often create problems for the environmental and public health. What you see on this slide is one of our production units. In this kind of building, we're going to produce two essential resources: animal feed and organic fertilizer. Sorry, one second. Sorry. But these residues, these large volumes of organic residues, are a local resource. At Reploid, we transform these residues into these valuable outputs using black soldier fly larvae. When we give the larvae these residues that already exist in our food system, they transform them within days into these valuable outputs. So instead of these residues becoming a problem for the environmental, animal, and human health, they become an opportunity to produce feed and fertilizer locally, making the resilience of the entire food system stronger. This is our solution, the Refarm unit. It is a modular, standardized insect farm built from standard shipping containers. So the principle is simple. We feed the larvae once, and 7 days after, we harvest, feed, and fertilizer. Everything inside is standardized and climate controlled. That means it can work anywhere, including Africa, despite the weather. Extreme heat, cold, or sudden temperature swings can lead to conventional insect systems collapsing. But all these risks are eliminated in our Refarm unit. The stable climate protects biological performance, even under harsh or unpredictable conditions. We deployed these systems working together with partners along the value chain. Waste and agri-food companies provide the residues, feed and fertilizer companies use or distribute the products, and farmers benefit from a reliable and local source of feed and fertilizer. So Reploid brings the standardized technology, the biological know-how, and the operating model, and local partners provide the local context, the market, the materials, and the operational workforce. This partnership model builds local feed and fertilizer independence, using resources that already exist in our food system. We're here in Lusaka today to learn, to understand, and to listen how decentralized bioconversion can support national priorities on feed security, fertilizer independence, and One Health. If you want to know more about this, and you want to know if they can fit into your context, I'm going to be at the innovation booth. Thank you so much.
So now we have heard from all the speakers, and now it's time for me to sum up. We have learned when we can transform the food system, we can increase food security. That's number one. We can create jobs and livelihoods along the value chain. We can reduce greenhouse gas emission and save the environment. But there's one thing I haven't mentioned that is also important. I think the ministers of finance will actually like this model because they can spend their hard currency on other things than soy and fish meal. They can buy medicine, they can buy school books, they can buy other things that are important. Maybe not everybody would like to eat insects, but let the animals have their favorite food. But if you have never had a dessert made of bee larvae and white chocolate, you have honestly missed out. Thank you.
Conversation? Oh, pardon me.
Questions, if any, if there's time. Question if there's time.
questions. I do understand that we're under pressure for time, so we'll have to wrap it up on that note, but the feedback and presentations that have been shared really hit the spot. So if you could please give Dorte and her panelists a round of applause, please, as they exit the stage.
Thank you. We are around, so we're happy to talk more. Thank you.
Thank you so much. Much appreciated, and of course puts a different perspective as to how we view the different aspects of the circular economy and of course recycling within our food program. Something that does continue to have to be prioritized within the markets that we serve and of course placed under key consideration. We're about to prepare for our next panel discussion, but before we get there, I do want to remind you very briefly that we are currently serving a few refreshments outside. So if you'd like a quick cup of coffee, maybe something to get your energy and blood sugar going, we'd like you to warmly accept the refreshments that are available outside. But please do make sure that you come back into the session because our next panel discussion is a robust one. One that really sets the theme and the context around how we build, how we navigate, and how we ensure that we move forward as key economies in Southern Africa. If I can continue to get your attention, please, ladies and gentlemen, just a brief reminder that there are some QR codes that will be distributed by our team and colleagues from the exhibition stalls. These are partners who have helped craft and put together the innovation marketplace. So you will find that there's a big, bold blue paper with a QR code on it. Please scan it in order to share your feedback regarding the innovative marketplace that we're distributing. Something else that becomes pertinent is that you can imagine that this morning, right through to this hour, has been an incredibly busy day. And that, for many of our colleagues and counterparts in the room, means that we've moved around different parts of the conference center throughout the course of the day. There is a set of car keys that has gone missing. If you happen to find any car keys of a particular Toyota brand under your chair, or perhaps that doesn't belong to you, even if it ended up inside your pocket, please do be kind enough to take it to the back, the technical desk. One of my colleagues there, Dorcas, will be able to collect it for you or from you at the technical desk. Dorcas, she's standing and she's waving. She'll be able to collect the car keys from you to make sure that we give the key back to its rightful owner. So please, ladies and gentlemen, do be mindful if you happen to have any items that do not belong to you, from cell phones to car keys or any other objects, please do make sure that you do take them to the technical desk at the back. Dorcas will be able to handle and manage the redistribution. Whew, this sounds like we're talking about land of the property and, of course, the keys. On that note, I understand we're ready for our next panel discussion, and slowly, slowly, this is where things build up. Because whilst we talk about being one region and approaching one health strategically together, we also need to understand that we are an ecosystem in and of within ourselves, specifically in the Southern Africa region and Eastern region. This is something that we need to be cognizant of because it does actually speak to the economic success that we'd like to attain. And we see those partnerships being leveraged on so far. But how do we do that within the One Health ecosystem? It's one thing between our colleagues to exchange oranges and bananas with Dr. Marie and, of course, our professionals and colleagues in the front. But it's also critical to understand that we need to continue to build a robust partnership that does build up on the development and opportunities that we seek within the region, but, of course, across the globe as well. So on that note, ladies and gentlemen, I do want you to get ready to participate in our follow-up panel discussion. Through this panel discussion as well, there will be an opportunity for Q&A. We will address the Q&A through the floor and the roving mics that will be present. Our moderator for this particular conversation, who will be guiding us through some themes, is no stranger to the world of One Health, a key participant and leader within serving as the steering committee chair for Africa One Health Network. He is well respected. I've followed him and seen him interacting with many of you as peers and colleagues earlier on this morning. And what's refreshing to note is that he offers a clear, insightful perspective. Thank you so much. Clear, insightful perspective right across the spectrum to really highlight how different markets and through interregional partnership that we can continue to bolster the level of efforts and growth that we have. Please warmly welcome to the front of the stage, keen, ready and eager, so I will not waste any more time, Mr. Mishek Mulumba, joining us as Steering Committee Chair for Africa One Health Network. A warm round of applause for him, please.
Thank you very much, Master of Ceremonies. I'm sure most of you notice me going through this ritual. Unfortunately, I have to do that because almost everybody who speaks before me is shorter than me. Now, another thing I have to make, also a very, very frank person, and I think I need to say it, that all the previous speakers have eaten our time. They were supposed to go for 30 minutes, they went for 1 hour, 15 minutes, so I don't intend to follow in their footsteps. So basically the panel discussion that we are going to listen to now concerns economic resilience and regional trade through integrated action. And we want to interrogate that by leveraging One Health approaches for regional economic development. So what is clear from the beginning is that trade has the ability to shape global health security for humans, for animals, and also for the environment, especially if all the players adopt a One Health approach in resolving issues leading up to an enabling trade environment. Now, this session is going to examine how a coordinated One Health strategy can unlock trade opportunities, strengthen food safety systems so that consumers eat safe and wholesome products, and at the same time, protect the environment while ensuring sustainability of trade and also enhancing economic resilience across the continent, and also its regional groupings, which we call RECs, Regional Economic Communities. And at this conference, there are 2 regional economic communities, SADC and the East African Community. So to help me address this problem, I've got a very capable panel that I believe will adequately ventilate this topic. And after they've spoken, we are going to involve you as the audience also. So you can ask questions to the panelists, and we'll reserve about 12 to 15 minutes for that. So without much ado, it is now my pleasure to introduce the panelists by first calling to the podium Professor James Wabacha. Please, you can come and take the next seat there. Professor Wabacha is an animal health expert from AU IBA. Let's give him a big hand again, please. And then the next to be introduced is Dr. Magresia Hausiku, the Chief Director in the Veterinary Department from the Ministry of Agriculture, Water and Land Reform in Namibia. She'll be sitting next to Dr. Wabacha. Give her a big hand. We also have Edwin Casey, the Director responsible for Agriculture and Commodities at the World Trade Organization. There he comes. And then we have Safian Koroma, who is a Senior Policy Advisor in the East African Sub-Regional Office of the Food and Agriculture Organization. Dr. Koroma. And lastly, but not least, we have Providence Mavubi, who is the Director of Industry and Agriculture at COHESA. So, without much ado, I think I'll start with you, James. So, I have a question for you, or let me say questions. What improvements in One Health systems would contribute to food and health security and also help countries trade more safely and competitively? And at the same time, what do you consider to be major opportunities for countries to harmonize their efforts on disease surveillance and control so that they can support safer trade and compliance with sanitary requirements?
Thank you, Meshach, and I take this opportunity to thank the organizers for inviting AUIBA to participate in this very important meeting. We really appreciate. And before I get into the question, I would rather want first to give the context. Animal resources in our continent, the continent of Africa, are key to our livelihoods, the way we manage resilience, and to our food security. That is important. With that in mind, then we can move and really look at livestock in terms of livelihood support. In our continent, this important sector is supporting more than 300 million people, supporting their livelihoods. I'm not talking about myself and others who keep 1 or 2 animals, really not depending on those animals for livelihood. So the number is huge. When you look at the way we keep these animals in our continent, as we create the context so that we're able to understand the rest of our conversation, we are keeping animals, majority of animals are kept by pastoralists and people practicing transhumance. So they are moving across borders, which has implication in the way diseases are transmitted. Again, if you look at the sector, and this has come before from the previous speakers, we are importing our importing bill is about 4 billion USD. So somebody talked about food sovereignty. Therefore, we need to do much in order to enhance the productivity of our livestock. Having said that, again, we need to look at the issues that face that sector. And the issues include the heavy burden of transboundary animal diseases, including zoonosis. And the animal health issue is robbing our continent of up to 4 billion USD. So we are losing that. And you consider also we are importing animal and animal products worth almost the same. So that has serious implication on the economy and food security of our continent. To address these challenges, as AIBA, we have been in this space for quite some time. And as people setting the vision for livestock development in Africa, we are supporting, working with partners and member states and regional economic communities, working on strategies to support harmonized, coordinated development of the sector, and supporting countries to undertake surveillance, early warning systems, and also capacity development. So that's what we are doing. And to get to, because I don't have much time, to get to the second question, because I can see, Murumba, you are looking at me, is if you look at response, surveillance, disease control, you ask, what do I see as a huge opportunity in terms of countries working together in order to advance these areas? One, I would want to advocate that countries, regions need to prioritize regional networks, be they animal health networks, be they what we launched this morning. These are key if we have to leverage regional resources, continental resources, given that resources are never adequate. Number two, I would urge African Union member states to prioritize information sharing. This is very important. And in addition to information sharing, they need to put in mechanisms that allow this to happen through information platforms, through collaborative MOUs to undertake cross-border surveillance, undertake cross-border disease control. This is key. And more important, not more important than the others, is our ability to work from the bottom, working with the communities, because diseases start there, and these are the people who are supposed to do and support the response. So I leave it at that.
Yeah, thank you very much, James. So definitely you have touched on very important, topics like the need for information sharing, networks. All these are key, not only for the regions, but also for the continent. Thank you very much for that response. Now I come to you, Magresia. From the Namibian experience, what are the biggest opportunities for building competencies, both at national and also at regional level, for preventing and controlling transboundary animal diseases so that a country can be firmly established in the global export markets? And as you answer that also, can you comment on the support that you feel countries need to strengthen their ability to comply with food safety and animal health standards? You have 4 minutes.
Thank you very much for this opportunity and for the questions. Allow me to give a brief background on how Namibia became a net exporter of livestock and livestock products. So Namibia as a country is a WOHA recognized FMD free zone. Okay, and this forms part of the larger part of the country. It also has an FMD protection and a FMD infection zone. The reason why I'm referring to FMD is because it's a trade-sensitive disease. And because of this status, Namibia was able to gain access to lucrative trade opportunities due to minimal sanitary restrictions. And it has also reinforced the country's comparative advantage when it comes to global livestock trade. So, as a country, the livestock industry is a major contributor to the agricultural sector, which comprises 60% of the agricultural sector. And so to safeguard this freedom status without vaccination, we have to implement strict WOHA trade control measures, and this is just to preserve the livestock industry's animal health status as well as trade. So what we were able to leverage from this environment or animal health situation and then use it as an opportunity to advance national competencies, we were able to develop policies. We were able to develop policy for the eradication of transboundary animal diseases, which was launched in 2010. And this then reinforced or showed the commitment from government to be able to invest in measures to make sure that this eradication of transboundary animal diseases such as FMD and CBPP is achieved in the northern communal areas. We were also able to develop foot and mouth disease and CBP control programs, which was later in 2014, and this was endorsed by WOHA once again as a control program. And this reinforced the Namibian government to adopt, through cabinet decision, and support whatever activities are under the control program, such as annual vaccination against FMD in the northern communal areas, increasing surveillance of disease control, whether at farmers, communities, auctions, animal health events, strengthening laboratory capacities, as well as really developing infrastructure, whether it's at borders with veterinary presence and other agencies, clinics, offices, abattoirs where anti-mortem and post-mortem inspections takes place, and also ensuring that the Namibian animal, livestock, and traceability system is enrolled throughout the country for individual identification, which is a key requirement for importation to be able to trace where these products are coming from. So how then this contribute, or what can we do to really ensure regional cooperation was already highlighted by the previous speaker. Really, it's to harmonize, if we can harmonize control strategies or animal disease control strategies or protocols, and this can be done, which was already mentioned, either through the development of MOUs, cross-border meetings, or bilateral where we can enforce joint surveillance, maybe synchronize some animal disease control activities or surveillance or vaccination campaigns. We can also do capacity building across different countries where we can do twinning projects, build capacity for diagnostic purposes, or even send sampling for disease detection. So these are various ways in which, and once more importantly, to be able to have cross-border information sharing, which would be able to give timely notifications to whichever competent authority for preparedness and of disease events. So just to answer your second question, sorry, I know it's a mouthful, but One Health is important. The One Health system focuses on early detection, rapid response and prevention. And it's very key because proactive investments in One Health systems is better than, and is a better cost benefit than a reaction to an outbreak. So with investing in One Health systems, we are able to ensure that we have integrated approaches, and we really manage this disease outbreak in an integrated manner. This can ensure trade partners that there's preparedness when it comes to response to outbreak, and can also ensure minimal loss, economical loss, should these events occur. So what I would advise countries to then have in place, or what they need, is to build a strong evidence-based veterinary or animal health system and food safety systems, and this can, which align to international standards, whether it's the WOHA standards or the Codex Alimentarius.
No, thank you very much, Magresia. We really appreciate that. So I picked out some key words in your response there. You spoke about the need for investment in the sector, and you also spoke about effective disease control through surveillance and vaccinations, and all these should be anchored on the WOA, principles. And also you mentioned traceability, and just as James had indicated, harmonizing control strategies for the region to benefit, especially where transboundary animal diseases are concerned. Thank you very much. Now, the World Trade Organization, I'm sure you agree with me, is key to trade, not only in other products, but also in animal and animal products. And Edwin, the question I have for you is, what steps can countries take to make it easier for their food and livestock products to reach regional and international markets? And also, what is the single most important improvement, in your opinion, that can help countries participate competitively in the agri-food trade?
Thank you very much, and I would like also to thank the organizers for inviting the World Trade Organization. As you just pointed out, the WTO is the main international body overseeing world trade. Last year, world trade amounted to $32 trillion, and trade in agriculture was about $2 trillion. So we have seen a tremendous increase in trade since the GATT, which went into force in 1948. Now, in terms of agribusiness, the WTO is home to the Agreement on Sanitary and Phytosanitary Measures, and this agreement recognizes the right of countries to impose measures for food safety, animal, plant, life, and health. At the same time, the agreement also cautions members that the measures they impose shouldn't be more restrictive than necessary. So it strikes a careful balance between these two competing goals. So if a country wants to really enhance its market access, obviously there are bilateral regional approaches as well as the multilateral approach, and the two are not mutually exclusive. Countries can pursue both tracks in order to expand market access. Tariffs have generally come down, with the exception of we are all conscious that since April of this year, the United States, where average tariffs were around 2.5%, now the average tariffs of the United States is around 13%. But other than that, if you look at the OECD countries, average tariffs have fallen to below 4%, and this has contributed to the tremendous expansion of global trade. However, I think we also need to take stock of non-tariff measures like SPS measures, TBT measures, and I think it's very important for countries also to focus on that. Countries, as I pointed out, the SPS agreement prioritizes science. It requests members to base their measures on science, scientific principles, and where necessary, they have to base their measures on, we normally call the three sisters, the IPPC, the WOHA, and then also Codex Alimentarius. If a measure is based on an international standard, it is presumed to be WTO consistent. So if countries take SPS principles when building their policy approaches, there is the guarantee that their products would be accepted in external markets, whether regional or international markets. So it's very important for countries to bear that in mind, apart from tariff barriers, also to concentrate on non-tariff barriers. Now, on the question as to the coordinated response, I think that we know that that can deliver a lot of benefits. Clearly, stronger, if countries were to cooperate regionally, it could deliver a lot of benefits in terms of early warning systems, the fact that, you know, disease control, countries collaborate, it can limit the spread of animal and plant diseases, and that could have tremendous benefits to all the countries involved. So regionally, I think it's very important for countries to do that. And also, countries should also make use of the WTO, the SPS committee. It's not always, you know, a lot of disputes gets resolved in the SPS committee, not necessarily through the, and African countries have not been making effective use of the SPS committee. We do have the YIPING, which is instituted by the STDF, which is, you know, funded by the WTO, World Bank Group, most of the institutions which are behind this conference, FAO. So there are about 5 partners. And the idea is to help developing countries to gain market access for their agri-food products. So the STDF, apart from being a financing facility, it is also a knowledge hub for SPS matters. And so I would encourage countries to make use of the YIPING as we are speaking. Actually, there was a meeting yesterday in Nairobi. The STDF is piloting a project for 5 countries in the Eastern and Southern Africa, South Africa, Namibia, Kenya, Tanzania, and Uganda, because African countries are not making use of the YIPING, because if countries are able to obtain or track real policy developments in real time, that would improve market readiness, enhance competitiveness, and also enable countries to raise complaints at the WTO, because under the WTO system, before a country implements measures, it must afford opportunity for comments. And so through participation of the YIPING, if countries make use of the YIPING platform, they'll be able to know which measures countries are imposing or about to impose, and they can make representations to those countries.
Thank you very much, Edwin, for that. I think some of the key takeaway messages I picked from your response there were that African countries should start making use of the WTO SPS committees to resolve most of the trade issues they get. And also in terms of funding the STDF, we should also start making use of that. And generally tariffs are falling, except for the exceptions we know. But we should take advantage of that, colleagues, so that we can promote trade. And you recall, colleagues, that the African Union promulgated the Africa Free Continental Trade Area, or trade agreement. And in that trade agreement, anything grown or produced in Africa and sold in Africa is not supposed to attract any tariffs. So let us take advantage of that. Thank you very much. Now let's turn to FAO. Dr. Koromo, what could help countries strengthen their food safety systems so that their products are more trusted and accepted in regional and global markets? And also in terms of strengthening these food systems and food safety, what practical steps can countries take to achieve this?
Thank you, moderator. Well, let me start by pointing out...
Just pull the mic towards you.
Let me start by pointing out that the FAO views food safety not only as a public health objective, but also as an economic trajectory and as a trade resilience mechanism. When countries align their food control systems to the Codex standards, they are able to open markets that demands transparency, traceability, and scientific credibility, including consumer protection. Now, quite easily here, it can be noted that the Codex is the global interface for food safety and quality, and is jointly managed by FAO and WHO as the founding partners. Now it includes the IPPC and the World Organization for Animal Health. Edwin, my colleague, mentioned the WTO Sanitary and Phytosanitary Agreement. The Codex underpins that agreement. Thus, Codex-aligned measures are seen as legitimate and science-based, reducing disputes and helping exporters trade with coherence. In essence, Codex connects safe food with safe trade, ensuring that compliance becomes a gateway to competitiveness and not as a barrier. Now, across Africa, you talked about how it builds trust and open markets. Countries are investing in Codex-based systems that builds trust with trading partners. For example, in the East African community, there is a lot of harmonization in food safety laws using Codex guidance, cutting border delays and SPS rejections. Also through the Codex Fund, which we work jointly with the WTO, over 20 African countries have strengthened jobs and trained inspectors in risk-based control systems. Now, the practical way for countries to align their systems to the WTO is a very simple system. It's a very simple process. Either a request to one of the organization for this, the WTO, FAO, the IPPC, and others, depending on the specific area they want to focus, and we can mobilize partnership and resources to do this. This also goes to the fact that, there must be a concern here about informal SMEs and how they would benefit from trade. The Codex is such that it is flexible enough to be tailor-made to certain markets, especially smallholder markets. So with that, Mr. Chairman, let me stop for now.
Thank you very, very much, Dr. Koroma. I think you did indicate here that Codex, which was initially being administered only by FAO and WTO, but other partners have joined, is really underpinning the global trade in terms of food safety. And colleagues, it's important, no country is going to import anything that isn't safe to consume. So all exporting countries must aspire to ensure the safety of the product that they are exporting. And the Codex is there to actually see to that, because it connects safe food with safe trade. Right. And for us as African countries to take advantage of this, there's need for capacity enhancement in risk-based control systems so that the food we are exporting can be considered safe. And now, last but not least, Providence, I come to you, coming from COHESA, which I know has a free trade agreement among its members. My question is, which regional approaches or harmonization efforts are most essential for increasing trade and enabling safer movement of food and livestock products? And as you consider that question, you may wish to also answer this one. What measures would you say need to be harmonized at regional level to improve consistency of inspections to allow trade to flow more efficiently?
Good evening. I guess we are already evening. Thank you first to the organizer for inviting COHESA to be part of this conference. For us, One Health system is not just a health policy, it's a developmental agenda, where we see that for us to be able to trade on this continent, we need to trade goods or food that are safe. In COHESA, we have a saying, if it is not safe, it's not food. So we don't trade. So we start from there. So over the years, as we have been working to remove tariff barrier to facilitate intra-regional trade or intra-Africa trade, we have realized that the non-tariff barriers have become the new standards that detect who trade or who doesn't trade. So we started working on the journey of harmonizing some of our standards. At one point we stopped because even with harmonized standard, especially in grains in the animal feeds, in the seeds and horticulture, still we're not trading. So we ask ourselves, what else can we do to ensure that we are able to trade as a bloc or trade with our sister lakes? The measure that we are currently championing is through mutual recognition agreement, accepting each other's way of doing procedures for inspection, for certification, for testings. Because we realized when we started this project, when we bring member states together, please, can you map out your process of imports or export? We realized that they are similar. Why are we not then trading as much as we can? Why some of our goods, when they reach at the borders, they stay there longer than they're supposed to do, because the other importing or exporting country need to do testing first. So we are championing the mutual recognition agreement for conformity assessment. Since we all agree, grade the A of maize is A, B, C, D, and you also agree. So let's put it in a procedure so that once you certify, for example, Uganda Bureau of Standards give me a certificate as an exporter that my maize is grade A. When they reach Kenya border at Busia, the Kenyan authority in charge of inspecting should accept that the counterpart in Uganda have done a good job. That's one way we are thinking that it can help us move safe products across the borders. So you ask the second question?
To say, what measures would you say need to be harmonized at regional level to improve consistency of inspections to allow for the flow of trade more efficiently?
I think we have in place different measures. For example, COHESA, we have our SPS strategy, which is aligned to the Africa Continental Express strategy, aligned to WTO, as well IPC, HUA, and the CODES alimentarius. They are already there in place. But for this to be effective, we need to invest more on our regional reference laboratory systems so that our laboratories are accredited at international level, and fellow laboratories or other authorities in the member state can approve whatever certificate comes from that laboratory. And also we need to harmonize on our e-certificate for SPS. Some of our member states have started issuing e-certificate for the phytosanitary, but not all the member states are doing it. So we need to work at that regulatory framework to allow e-certificate. Why is that important? Because it helps the custom and the SPS authority to verify document in real time and cut border processing time. Thank you.
Thank you very much, Providence, for that. I'm sure, colleagues, you appreciated from a regional perspective what they are trying to do to promote trade among African countries. Some of the things I picked out was the issue of mutual recognition agreements between countries, so that what is certified here to be this is accepted by the importing country. And you may wish to know that even WOA actually facilitates this process. There are countries which started trading in animal and animal products even without a disease freedom certification from WOA. Why are we not using that as African countries? And then you also mentioned the point that some of the strategies COHESA is trying to develop are aligned to most of the international regulatory bodies, so that you do not have to do the same thing twice. You do it once and it's done for good. And accreditation of laboratories is very important, colleagues, because when a laboratory is accredited for a certain test, then when it gives out a result for that test is accepted internationally. But without that accreditation, anybody can take issue with that. So we can see, colleagues, from the contributions from the panel that trade has the capacity to actually bring in more revenue for the countries, even more than aid can do. And this is why the focus is now shifting to fair trade. But we cannot start trading with outsiders before we start trading among ourselves. So that is a clarion call to say, let us implement this first in our own house before we can go out and ask others to actually assist us. Thank you very much. Now I'll open it up for questions from the audience. I think, let me stand. I hope you won't be intimidated. So anybody in the audience who has got a question for the panel? Don't tell me you are that tired. Okay. Yeah, there's one hand there, so if we can have a mic there. Anybody else? Please assist me to see if there are some hands, because I can't pick out all of them from here. Okay, you can go ahead with your question. There's another hand that side will come to you afterwards. You can go ahead.
Thank you, Director of Ceremonies. Thank you very much, panelists. This is Lesonyo from the World Organization for Animal Health. Mine is not really a question. It's just an appreciation and acknowledgement of the recognition of the World Organization for Animal Health Standards. We try by all means to try and create the scientific fair standards, and I think a good account from Namibia as a country implementing that is very much well appreciated. So I stand here to encourage member countries to really adhere to WOA standards. They will help you. If you produce your products in compliance with WOA standards, it becomes much easier to trade with these products. And the other thing I wanted to just inform you is that we currently have a project on SPS, which is supported by the EU, really to try and facilitate the Africa Free Trade Agreement, members' compliance with that trade, to make sure that when they are trading properly and we don't spread diseases by a liberalized movement. So take advantage of this. It has a special component on the improvement of laboratory capacity. You are urged to take advantage of this. We do capacity building, we do other support to member countries, especially starting with member countries of COHESA. We are working very closely with COHESA on that. So what I'm just trying to say is that the play field is fair, and there's available tools to help you even do better in that regard. Thank you.
Thank you very much, Dr. Leswenyo. I think what he's saying is telling us is that you're supposed to be a panelist. Anyway, it's very important, colleagues. I always say this to my colleagues. When it comes to international trade, especially in animal and animal products, there are no African standards, let alone African country standards. We only have global standards. And Dr. Leswenyo is telling us they have a program of training on SPS. Let us take advantage of that so that our people can have their capacity built up so that they can implement what they learn in their countries. Thank you very much for that. Dr. Banda, you had your hand up. Somebody doesn't want you to talk.
Thank you. Mine is a contribution to what was being spoken by the COHESA lady. I think, yeah, the labs, yes, and Doc Mlumba, what he mentioned about the importance of accreditation. But the other thing maybe which can help laboratories to more like harmonize the results would be to also have them do inter-laboratory comparisons. Like you have the same sample distributed to the other. And that would also make sure that the other labs also agree to the fact that what they are producing is a correct result and believe in their colleagues who are producing that. And that would help maybe into ensuring that there's just one test which is done and everybody else will agree. But I also wanted to just find out from you if you are deliberately trying to put in something to ensure that COHESA moves towards that, towards having harmonized, so that more like supporting the labs having that type of approach, the quality assurance basis, ensuring that all the labs are meeting the standards. Thank you.
So that's a question for you, Providence. Would you like to respond?
Thank you, Dr. Banda. Yes, I didn't have enough time to elaborate everything we are doing under the SPS.
Don't look at me when you are saying
area. Sorry. So we have a program on the COHESA Reference Laboratory. It was approved some years ago by our Council of Ministers, but we just 2 years ago they developed it, where we have reference laboratory and satellite laboratory recognized in the COHESA. And part of the program actually is that about inter-laboratory comparison. Also, we are doing a peer-to-peer exchange where we get people from, for example, Ethiopian conformity assessment coming to Zambia, or sending people from ZABS going to KEFIS in Kenya. We're also doing that, what you're recommending, under our proficiency grading scheme, where we are getting graders from different countries going to work with other graders. In 2 weeks ago, we just concluded the first cohort of that exchange program. And you have selected CARO. It's an institution from Kenya as the regional proficiency grader, providing the training. We are also building our own training center to provide training for the others. So it's a good recommendation and something we hope to continue, because we are 2 years into the program. First was to identify the laboratories, to do the need assessment, to equip them with the necessary lab equipment. Now we are moving to the next, where they are exchanging test results and the peer-to-peer learning. Thank you.
Thank you. So there are deliberate efforts which these organizations are taking for your benefits as member states. Let us take advantage of that. I see a hand back there and another one here, and the last one that side. I'm sorry, we are running out of time. I promised I won't eat time like the others.
Good afternoon. Thanks for the very elaborate panel discussion. My name is Lillian Wambua from WOA. My concern is not about the legal and formal trade. My concern is about the informal trade that occurs sometimes across borders, most often undocumented, most often unsafe. We're talking about trading of animals across borders, sometimes just through, the cross-border markets. We're also talking about illegal trade of wildlife and wildlife products. How can we formalize this informal trade and bring this volume of trade, of informal trade, to become more formal and safe?
Okay, thank you. We'll take another one, but colleagues, you just note the questions, which one applies to you. Please, sir, your question.
Thank you. Thank you, Dr. Mulumba. Let me just structure my question, mentioning that the nutrient-dense food is not only the livestock product, but also vegetable, fruits, eggs, fisheries, etc. What is common there? These food, all of them, they share cold chain, quick transportation, food safety, traceability. And if we go beyond and dive deep, and they are mostly, they require a lot of private sector investment. So my question to panel, and more specifically to COHESA, what we can do, because all the discussion we heard are, well, it's good discussion, excellent, but dominated on the public sector. How can we bring them on the investment that Dr. Mulumba, you have said, that the trade can bring more money than the aid? Thank you.
Thank you. And the last one, Niwa.
Thank you,
Dr. Mulumba, and thank you. I appreciate the panelists for all the insightful discussions that they have brought forward. My small question is to COHESA with regard to e-certification. I would like to learn more. Why are the countries not interested? And this will help us because we have a project under STOSA, which also would like to support countries with towards that regard. So we would like to really learn what is it that is making the countries not be interested, being that it's very, very effective in terms of timeliness. Thank you.
Okay, thank you very much. So the first one, maybe Edwin, would you like to respond to that one, the informal trade one?
Well, with the informal trade, what I'll say is that under the AFCTA, they want to try to encourage, for them to move to the formal in terms of even improving revenue generation. But I think at the end of the day, it is up to countries to adopt the right policies because most of the informal traders, during the transition, they may think they have to pay tax, but if incentives are created that they would be able to get loans, then I think that would help because a lot of African trade between African countries is not captured formally. So it is up to countries individually and also at the regional level, and the AFCTA wants to do that so that it can be captured. So I think there's a long way, but once the informal traders know that it will be to their benefit, then certainly I think they would be much more willing, to go formal. But currently we do have a lot of challenges, but I think gradually countries, in terms of revenue generation and others, they want to see that transition. So it will be some time, but I think it would happen gradually.
Safian, would you like to comment on the safety of the informally traded products?
Yes. I think just to add to what Edwin has just said, we have done considerable amount of work trying to, first of all, understand, when you talk mostly the safety is related to food products, to just understand the nature and structure of the markets. Now, if you look, for example, in Eastern Africa, the market, the structure of the market changes from morning to evening. The products that are going through are different at time. It's happened also in West Africa. We have also done work on, we've done, as a matter of fact, we just finished our assessment of the bushmeat trade in Ghana, and we are looking at other countries, and their requirements are different. It requires a lot of commitments from governments themselves. I mean, although yes, donors might be involved, but government needs to make that commitment because it's a gradual shift. We've also documented how to transform informality into formality. We have several documents that we have authored, just looking at lessons from all over the world to show how countries have been able to achieve that. So these are instruments that needs to filter through at the national level and the regional level, especially, I mean, the idea of one-stop border post is a very, very good initiative, especially in East and Southern Africa. But that also needs to be strengthened. The COHESA simplified trade regime is also another instrument in the right direction, but it suffers from a lot of issues, especially in the fact that the countries involved have different thresholds for goods to pass through the border. So there are a lot of things that needs to be tightened in that, but yes, there is a recognition that this needs to take place.
Yeah, so what I'm getting there, it's more of a national issue to be addressed. And it's a serious issue, colleagues, because if not addressed, it has the ability to stifle the formal trade. So it must be addressed. And now, Providence, would you like to respond to the last two questions?
Yes. Let me start with the last question. Is the easier one?
Yeah.
Reason why some countries are not moving ahead with the phytosanitary certificate, it have to do with their digital laws and the regulation in the country. That's one. Two, it's about security issue. So people want to be sure if this certificate I'm receiving, digital certificate, is authentic. It's not something someone have pirated. Secondly, there's the issue of infrastructure involved in issuing those certificates. Last, which is not common, some countries feel like some people will lose a job. To be honest, we have done some analysis about it. But if we can address the issue of trust, issue of security, and ensuring that the national laws take into consideration such certificates. It applies also for the certificate of origins. Some of our member states are implementing it, others are not. So we are pushing. It's a way of creating awareness and showing the advantage. And for me, I found digital tool easier to verify than a physical document. On the issue about investment, any investor want to know, am I working in a very predictable environment? Can my goods produced here be able to move to the other side of the market? Yes or not? Is the law, the regulation in place, do not change over time? So if we are to increase investment in this sector, especially on agriculture and animal, we have to work together beyond the Ministry of Agriculture, Health, Environment, and even the Ministry of Finance to understand that these different regulations we put in place, they are one of the reasons why someone may decide to invest in a certain country. Thank you.
So policy certainty. You'd like to come in, Edwin?
Yes, I had made reference to the STDF, which is a multi-stakeholder partnership involving the World Bank Group, FAO, the World Health Organization, WOHA, and then the WTO. We do offer preparation grants of up to $50,000, and we can provide initial funding for up to $1 million, and donor countries can also fund. So we have had projects where once the SCDF provides the seed funding of up to $1 million, donor countries can also supplement that. So countries can also look at that. I mean, we are open, and if any country, it can, not only country, but it could be cross-regional as well. So that is also a facility which countries can explore when they have SPS projects.
Yeah. So there are all these vehicles which we should take advantage of, colleagues. Are we doing that at the moment or not? And maybe just in conclusion, I'm sure the panel has ably ventilated most of the issues, you know, surrounding trade. But it is sad to say that whereas efforts are being made at continental and regional level to facilitate trade, the picture is different at national level. I remember when I was still working at SADC, I was still young and handsome in those days. You know, I did a paper on the candid assessment of trade in animal and animal products in the SADC region. And to my dismay, I found out that we trade with each other less than one third of the time, and more than 2/3 of the time we trade with outsiders outside the continent. And the restrictions we put on a fellow African country were almost twice as much as the restrictions we put on other partners we were trading with. So it is high time that countries started addressing this. It is good that the leadership has identified that trade can act as a vehicle to drive many out of poverty instead of relying on aid. Now, the onus is on us, the technocrats, to actuate that, to make it happen. The non-tariff barriers, you find just getting a permit for you to export, it's a huge, huge undertaking. Why should it be the case? We should be facilitating, not impeding trade among ourselves. So I hope that we've gotten one or two things, but in conclusion, let's give a very big hand to our panel. Thank you very much.
Another round of applause, please, for the panelists and Dr. Mulumba for facilitating an amazing panel discussion. Thank you so much again, Dr. Mulumba and the various panelists for giving us their feedback. I don't think it is lost upon us that this conversation really comes at a pertinent time, given the news flow and the dynamics that we're aware of, especially when it comes to the SADC region and our trade relations and partnerships. So that is important. You forgot your spectacles. The better to see you with. Well, we're glad you found them. Thank you so much, sir. To all of you who are still present with us in the room, we're really appreciative of the fact that you've been interacting and sharing much of your thoughts with us, because this is really what we're here for, to learn from each other, to have key themes that we're able to take away from the various conversations, and of course go back and implement within our various jurisdictions. To the Minister, as well as the secretaries and ministers who are present with us, that's also not lost on us, that we are going forward in terms of participating in these conversations and implementing them back in our home countries to advance the region, though, overall. We've come to the last stretch of the program, but do bear with us. We've got 2 presentations and speakers who will be joining us. Following that, we'll have concluding remarks. I just want to gently remind you that there are QR codes on your table, specifically a A4 size piece of paper with a blue background. It is titled that it is the Innovation Market. Thank you so much, sir. That's exactly the one I'm talking about. Innovation Market Survey. And this really speaks to your feedback that we'd like to solicit regarding your participation in the innovation market throughout the course of today. If you've missed interacting with any of the entrepreneurs or innovators, please bear in mind tomorrow is still another day. You can interact, ask your questions, and most importantly, you'll have an opportunity to see them here on stage as they share their 3-minute presentations with us and pitch. One more key announcement. To any of the key delegates who came to this conference under the sponsorship of the World Bank, I've got a message for you to kindly meet Marie Lolo. Meet Marie Lolo. She's at the Business Center here on this same floor. If you need any help or assistance, there are colleagues from the World Bank who can direct you. I understand that you will know what this message means. So if you are a delegate or partner who has made your way to the conference under the World Bank sponsorship, please meet Marie Lolo. Your interaction and your feedback there would be greatly appreciated. As we started off this morning, we heard from key role players and institutions, organizations, and speakers who, as we know, are champions of making sure that One Health is a priority right across the board. We're going to hear from all 3 of them now, starting with the first 2, representing key organizations that work hand in hand in making sure that One Health remains a priority for the continent at large. Following that, we'll go back to hearing from PREZODE COHESA, who will wrap up and conclude the discussions that we have for us. So our next speakers, much like they did this morning, will share their reflections on how we've built up on much of the conversation today. Then we'll hear as well in terms of how best it is that we move forward with these themes and conversations tomorrow. 3 speakers, but I'll introduce the first 2, and then we'll close off with PREZODE COHESA with Dr. Papa Sek. But for now, please allow me to warmly welcome to the front of the stage our first 2 speakers who will join us, and they will share their representations and thoughts back to back as they make their way to the podium. Please warmly welcome Dr. Mary Mbole Kariuku, who is from Africa, or the AU IBAR, and not forgetting Dr. Yewande Alimi, joining us as well from Africa CDC. Both of us will join us to share their reflections, and then we'll get ready to hear from our final speaker. I think the round of applause can be a little warmer than that. Thank you very much, ladies and gentlemen.
Okay. So, I think Professor Mishek said, so we are also adjusting. Is he in the room? Okay, we are also adjusting. As he said, he adjusts after others. So on behalf of AUIBA, I think this has been an awesome interaction, and you can clearly see that we are all speaking one language. It was already said. The good thing is that we are focused on where we want to go, and we will get there eventually. Allow me just to focus on 3 things that I observed. And this all goes back to the foundations of One Health. I know you all know this about the 4 C's: communication, coordination, collaboration, and capacity building. Throughout all these discussions, this has been echoed by every speaker who stood up to say something. The 4 C's have continued to be the foundation of our One Health discussions. And this is evident. This is where we need to go. We need to communicate better. We need to collaborate stronger. We need to coordinate in a way that we can clearly see there's some impact that will be realized, and we need to drive capacity building. As the discussions were held, the issue of capacity building clearly shows that it's not really about the lack of capacities,
but we have not put in place systems to disseminate these capacities efficiently and effectively. And it is our hope that through this regional workshop and conference, we're going to drive that agenda. When we start that ripple effect from the SADC region, it is evident we shall be able to push that agenda across the African continent in a smarter and better way. I was excited by the issues that were projected here in terms of integration of AI. I think this is the new boy on the block, and we need to come and align ourselves to these actions as Africa and really see what can we benefit from AI in a positive and in a smart manner. Really tracking the transhumance, I think this came from WHO, really gave me a thought, how can we do this without so much of collection of data in the way that we think data should be collected that drives a lot of our financial constraints to all of us. So what do we need to do? If we drive the agenda of AI, then we need to put regulations in place. This has been echoed over and over by all our stakeholders and really honorable ministers in the House. Governance is everything. We can talk about money, but without governance structures in place for One Health, everything remains morbidant. We'll not be able to move forward, we'll not be able to have anything. Even the new innovations that will be put in place, if they are not smart and tech-savvy policies in place to adopt these innovations, we will remain in the same place that we are at in this space of One Health. So it's encouraging to see what we've discussed. Africa is moving forward. I think we really deserve a hand clap. Africa is moving forward. We are moving forward steadily and well. And this is something that we need to acknowledge and say thank you even to the governments that have now embraced One Health as part and parcel of their budget allocations. This we appreciate, and we commend governments that have taken this strongly. In the African context, we always have the analogy of a three-legged stool. And this is something we've said over and over. I think this is something typical. I don't know if there's any African in this house who's never seen a three-legged stool. This is typical of our culture. And if the three-legged stool has one leg that is shorter, can you use the tool? The stool? Can you sit on it? Can you? You can't sit on it. So that really calls for our attention to really come together. Environmental health, human health, and animal health. Let us work together. Let's move forward. And even with the new innovations, including of insects, what can we do to bring in the actions on insects and drive our agenda forward? Because this is part and parcel. So as I conclude, I just want to share something very simple, a proverb with you. And it says, a river cuts through rock, not because of its power, but because of its persistence. And that is where Africa needs to go in relation to One Health. We need to remain persistent, and we need to move forward and make sure that One Health is institutionalized and operationalized. Thank you very much.
Thank you very much, Your Excellencies. A big round of applause for our Excellencies. Usually when we have such convenings, we would see our Excellencies leave very quickly. But we really like to appreciate your leadership. Staying in this conversation does not only demonstrate your commitment, but also as champions of One Health. Ladies and gentlemen, it's been a fantastic session. I think we've all heard really remarkable insights, not just from technical experts, innovators, but we've also heard from our ministers as well as permanent secretaries. It's hard to come after my sister who has dropped phenomenal African proverbs. So I'm going to go another direction and ask a few thought-provoking questions because we're going to come back here tomorrow. His Excellency, the Minister of Health, raised a crucial question when he said, we've made progress in One Health, but we still keep fighting for who is the leader. So my question to you, ladies and gentlemen, as we continue to compete in the space, deciding should it be led by health, agriculture, or environment, it's important for us to take a step back and ask ourselves indeed truly, what does One Health really mean to you? Is One Health a means to an end for us to say we're working together? Or is One Health actually a practical way for us to work together in the African continent? I'll leave you with a few more questions. Over the course of the sessions, the panels, we can all agree as technical experts, One Health is working from Namibia to Mozambique to Zambia to across the different regions. SADC has really put all of us together to highlight this. But the question is, why is it so difficult to convince people outside this room? And when I say people outside this room, the people who sign the checks, the people who make the right investments, be it our ministers of finance or our ministers of trade, or be it donor partners or international funders. Why does One Health become a difficult subject to convince? Ladies and gentlemen, if One Health is really the way to go, how do we quantify impact of One Health? How do we tell the African story of success? How do we articulate clearly the cost benefit of One Health? And how do we go back to our heads of state for the cost of inaction when we don't take on a One Health approach? It's been an exciting conversation, not just because I've been honored to converse and engage with people from different sectors, but because of the uniqueness of this session. Of course, it was quite crucial to see the Rangers, a unique voice we would not often see in these platforms. So that was very inspiring. Thank you. I would like to also applaud someone who I'm going to call a One Health champion now. I did a quick search on your biography, Madam MC. You're not a One Health expert, but you have sold this message to us. You are a champion. You represent the media. And you have made such a technical discussion easy to understand. The flow of the sessions, you agree with me, ladies and gentlemen, is how One Health should be articulated. So, ladies and gentlemen, as we go back, I've spent the last 12 months engaging with many of you on different platforms. We keep talking to ourselves. Let's take the message outside. We're here in Lusaka today. We're staying in beautiful hotel rooms. The people we engage with on a daily basis, do they know about One Health? And how do we ensure the message no longer sits in fancy conference rooms and technical boardrooms or meeting rooms, and the message can go back to the community? So, ladies and gentlemen, a few questions for you to think about. We're back here tomorrow. We're hoping that some of the ideas that can come out of this discussion would help us champion the conversations around One Health. Thank you so much, and welcome back, Ms. MC.
Oh, Yewande, thank you so much, ma'am. Appreciate it. And as you've highlighted, some key questions that we all need to ask ourselves. Before we do wrap up, we've got two more speakers who are going to share their reflections as well. Key members of the Quadripartite Alliance and, of course, partnership, as we have heard from our peers who have come before us. So this will give us the views and concluding remarks of the day. I will introduce the two of them up on stage, following which, when they conclude, that will release us and give us an opportunity to recess, catch up with colleagues, network, call your emails, call some family and loved ones, and emphasize the message regarding One Health going forward. A reminder that the program tomorrow will start promptly at 9 o'clock. Promptly. I'll do my best too. I'll shorten my panels too, Mr. Mulumba. He's left the building. But please do be mindful that the program will commence promptly at 9 a.m. tomorrow. In the meantime, though, to wrap up, conclude, share their thoughts with us, and of course welcome us with some perspective regarding the Evening Innovation Showcase and networking that will be taking place, I'd like to welcome two guests and speakers who will be sharing their perspective, representing PREZODE and COHESA. Starting off with Dr. Papa Sek, the President and General Assembly of the Preventing Zoonotic Diseases Emergence Initiative, PREZODE, and of course we'll be joined by Priska Mugabe, representing COHESA for this particular conversation. If they could both make their way up on stage, following the concluding remarks we hear from Mrs. Mugabe, that is when we will conclude the evening and you'll be able to actively participate in a recess. This is the last you'll hear from me today, but following the wrap-up from Mrs. Mugabe, then we will be released to actively participate in the networking and engagement for the rest of the evening. Another round of applause, please, as we welcome them both on stage.
Thank you so much, Madam Master of Ceremony, and you did very well. I have to congratulate you to really, just my colleague from Africa CDC said you're really a One Health champion, and congratulations for that. So we were supposed to welcome you in the market space, and giving you welcome reception. But now, since we are called upon my colleague Professor Priska, and myself to speak, it will be not to wrap up, but just to say a few words about this exhibition, the meaning of the marketplace, but also about PREZODE, which is today a co-organizer of this very important gathering, this Regional One Health Conference. So, if you allow me, I would like to say that PREZODE is an international multi-stakeholder initiative launched to address one of the most urgent global challenges of our time, the growing risk of emerging infectious disease driven by environmental change, intensifying interaction between animal, human, and ecosystem, and the increasing vulnerability across health system. Our vision is very clear: a world where epidemic emergence is anticipated and prevented through integrated, science-driven, and socially inclusive strategies. Our mission is equally ambitious to generate actionable knowledge on drivers of disease emergence, to co-design risk prediction strategies with government, research, and communities, but also to strengthen surveillance systems across human, animal, and environmental sectors, to translate evidence into policy and practice, and to support countries in operationalizing the One Health approach. Today, I can say that PREZODE is about more than 250 members across the world, and among those members, we have 30 engaged government. And I would like here to highlight the President has a PREZODE member of the Government of Zambia, and I would like really a big applause for that. Let me also invite other states from the SADC region to really join PREZODE. They will be very welcome. Mr. Minister, you will be very welcome in PREZODE. So now, why PREZODE is relevant to this innovation market? Prevention is not an abstract concept. It requires tools, technology, data, and behavioral innovation that transform how we detect risk, how we work with communities, and how we design policy. PREZODE promotes a model of innovation anchored in three principles: science to policy, and policy to action. PREZODE is acting as a bridge between scientific research and decision making. Our initiative helps ensure that evidence on land use change, wildlife interference, climate impact, antimicrobial resistance drivers, or socioeconomic vulnerabilities inform national strategies and regional cooperation. The second principle is the co-construction and community engagement. Our core principle is the co-construction. We want to connect the community to the scientific fora, but also to the policy. And doing so, our approach is the co-construction. We build with communities. We build with scientific communities. We build with policy to be able really to be very efficient in our way of implementing strategies. The meaning of this marketplace, you already saw this morning, and you will continue to see, is this space celebrate the diversity of innovation, from digital tools to biosurveillance technologies, from circular bioeconomic models to community-led approach. But above all, it demonstrates that innovation is a shared responsibility. And government innovate, scientists innovate, the private sector also innovate, youth and communities also innovate. And we should really take advantage of those innovations that these different bodies are doing, and try to connect them each other to be able to be more efficient in disease surveillance, but also in disease response. Now I would like to introduce my colleague, Professor Priska Mugabe, who will give you also some talk about the innovation we have. Thank you so much.
Thank you very much. Can I? Yeah, thank you. So, Dr. Papa has introduced us to the concept of PREZODE, which is a global coalition, and COHESA, which is capacitating One Health in East and Southern Africa, is one of the members, implementing members of PREZODE. Okay. I assume you heard what I was saying. So we are saying the capacitating One Health in East and Southern Africa is an implementing partner of PREZODE, like we've just heard. So COHESA is funded by the European Union with an implementation partnership with the African, Caribbean, and Pacific group of states. This is a 5-year project, of which we just have about 6 months left, so we've done most of the work. So the aim of COHESA is to build an inclusive research and innovation ecosystem to facilitate the embedding of One Health approach across society in East and Southern African countries that you can see on the map. We are also very proud to say we are representing an easy 25% across those East and Southern African countries of the continent of Africa. So this aim of COHESA is achieved through 4 major pillars. The first one being knowledge sharing, through understanding One Health status across the various countries as a starting point. And then quite a lot of work has been done in the governance through promoting national and regional One Health collaboration and supporting implementation. We also have the third pillar of education and research, aimed at building the future One Health workforce. We heard that earlier in earlier presentations, that we have to start them young and across the whole process of learning. so in secondary and tertiary education institutions. And finally, we have a pillar on delivery of One Health solutions across partners, across the different member participating countries of COHESA. So we have quite an impressive, if I can say so, an impressive list of outputs. The first one that we did was the One Health context analysis, which was completed across all the 12 participating countries. We have developed One Health strategy documents in 8 of the countries. And I'm very proud and happy to let you know that Zimbabwe would be the next one to launch the COHESA facilitated National One Health strategy. And this will happen next week on the 18th of December by His Excellency, the President of the Republic of Zimbabwe. And then we have had an output on One Health in higher education, where we have facilitated the embedding and infusion of One Health approach learning across hundreds of courses in 11 countries. And then we have new One Health governmental platforms which have been supported in 4 countries of COHESA. One Health teaching in schools has been introduced in 8 countries of COHESA. We have One Health operationalization projects in 16 projects across 10 countries. Various projects, mainly from waste management to, you had one of them in one of the pitching, advocacy and sharing the messages. So quite a diversity there. And finally, we have had online One Health training, which is where we have had participation of at least 1,400 participants from across 21 countries. This was open even beyond the COHESA community. One example of those courses that have been facilitated has been on food safety, where a lot of university professors and teachers participated to upscale their knowledge in food safety. So I believe I've gone through all of what we have been doing. This has been a fun and fulfilling initiative and activity through COHESA. If you would like to know more about what we are doing and what we've been doing and the publications we've had and the communities we are working through, I refer you to Alex. Alex, please stand up. Alex, one of our consortium leaders. Sorry, I forgot to mention that COHESA is led through a consortium of International Livestock Research Institute, of CIRAD, and ISA AfriCenter for the knowledge facilitation. Thank you very much.
Now I think we are done. So it's time for us to invite you to the welcome reception. And I would like here to hand it to Madame Master of Ceremony, who will say it.
Fantastic.
I guess more than me.
Fantastic.
Thank you so much.
Stay with me on stage. Ms. Mugabe, thank you as well. We understand there is a evening function and cocktail function that will be taking place, which is hosted by PREZODE together with COHESA. Thank you. It's been a long day of English, but we're getting there. If you could remind us of the details, what we need to prepare for, where this is taking place, that everybody, as we exit the venue this evening, will know where to go. In the marketplace. Network, engage. We need to have sharp minds. It's been a long day, but we need to attend, right? Fantastic. We've got the word. It's quite clear. We are going to actively participate in the marketplace cocktail function. Tomorrow, our program will start promptly at 9 a.m. Please do network, engage, interact. If you do have any feedback that you'd like to share, do ensure that you solicit your feedback. But please, another round of applause to our speakers and hosts for the cocktail this evening, and to yourselves, ladies and gentlemen, for being such amazing participants and respecting your colleagues, your counterparts, and peers across the region and the continent by staying with us all day throughout the full sessions. Toast to your excellencies, various representatives who are present with us today. Thank you so much. We wish you a wonderful evening. We'll see you tomorrow. Thank you so much, Ms. Mr. Well done. Muito obrigado.